Did you guys put together an exhibit list so I can keep track of
Yes, Your Honor, I'm gonna email it.
the growing universe? Morning, Deputy Gibbs. How are we looking back there? How many jurors do we have?
We have all 13.
All 13. What a crew.
Oh, you got it. No, not.
Actually, Your Honor, I need to make a couple more edits. Is it okay if I get it to you a little later?
I can't do anything with it till you give it to me, so you get it to me when you can.
Okay, thank you. I just want to make sure it's accurate.
Okay, that would be a good thing. Ms. Rivers, are you ready?
Yes.
Great, let's get on the record in State versus Poole. It is Friday, December 5th, a little after 9 o'clock. Mr. Poole is here. Good morning, Mr. Poole.
Good morning, good morning.
With his two lawyers, our prosecutors are here, Deputy Gibbs again, and his support team. And all our jurors are ready to go. Mr. Miller, anything we need to talk about before the jurors come in? I mean, to get you mid-breakfast.
No, Your Honor.
You're good?
Yeah.
Is Ms. Freeman here?
Yes.
Okay, here is in the building, not in the, maybe she's on an elevator.
No, sir.
Okay, if you don't mind getting her so she can be in position, that would be great. You've got other witnesses ready to go following her testimony?
Yes, Your Honor.
Okay, what's your forecast as to what we'll get through today? Do you think that by day's end, you'll be resting?
Yes, Your Honor.
Okay, you got a bunch of names on the witness list. You don't plan on calling everyone, or some of them are just gonna come in and say, hey, what's up, Miller? There's a dissent on the team.
My timing hasn't been good.
Not that it's not been good. You take the time you need. Just things take longer than you forecast.
Yeah, and I'm very optimistic about my time, which is why I'm usually late everywhere. But I would say we should be done, but
Okay. Do you intend to call every name on your witness list?
yes.
Because I can tell you, you're not gonna be done. I mean, even if you took 10 minutes with each of these people, we wouldn't make it. And if we're taking less than 10 minutes, do what they're here for, but we'll figure it out. Mute that, okay. If we don't finish today, we're back on Wednesday, not Monday or Tuesday, but Wednesday. We'll talk a little bit about when that would be, probably noon when we'd start up on Wednesday.
Your Honor, we received your, the jury trials.
Mhm.
Do we know yet when we're gonna have the conference on that?
We could do it at lunch today if that's when you want to do it, but if we aren't going to be done till next week, we could talk about it. I don't want to delay closings and a charge I give them because we didn't do the jury charge. So let's figure out, let's see how this morning goes. Talk about that. And to be clear, what I sent out was, it said final on it because that was the final, that's what we gave the jury last time. So it ought not to be a whole lot different this time around, but we'll see. Mr. Abadi, anything from the state? Okay. Can we bring Ms. Freeman in? Morning.
Morning.
Thanks for coming back. You can take a seat. Jurors are going to come in a second. Want to make sure everything was in position, and it is. All right, well, let's bring the jurors in then. Any trouble getting here this morning?
Not at all.
Not at all.
I'm surprised because of the rain,
Yep.
but it was good.
Thank you. All right, for the jurors.
Do you want to sit in? I'll check it. Sorry.
I realize this.
Thank you, Deputy Gibbs. Everyone else can be seated. Good morning, ladies and gentlemen. Good to see you all. When I was walking my dog this morning, it was cold and dreary and gray. All I could think of is what better place to be on such an icky day than in a jury box in a jury room. You're warm, you're dry, there's no cold wind or anything, so you're welcome. That's what we're here for. We're also here to continue the case of State versus Poole. Hopefully you recall that we had Ms. Freeman on the stand late yesterday, and thank you for giving us extra time yesterday. We completed the direct examination, and it is time now for any cross-examination from the state. And Ms. Freeman remains under oath, the oath she received yesterday from Deputy Gibbs. Mr. Body.
Thank you, Judge. Good morning, Mr. Chairman.
Good morning.
Could you tell us, I know you talked a little bit about, you are an RN, I think you said Cobb Wellstar,
Correct.
and, tell the jurors, when did you, get your certifications to be, an RN?
I became an RN in July of 2023.
Prior to, July of 2023, you worked as a emergency department technician and the unit secretary?
Correct.
So there's what hospital, what facility were you at?
Same hospital, Cobb Hospital.
Cobb Wellstar?
Correct.
And I think you told us yesterday, Cobb Wellstar is a level 2 trauma center,
Level 3.
level 3. And have you ever worked at a level 2 or level 1 trauma center?
I worked at Level 2, which was a children's hospital.
Okay. Can you tell the jurors, as it relates to the difference between a level 2 and a level 1 trauma center, what is that difference?
The resources available, such as on-call physicians versus in-house. Level 2, trauma centers normally have the physicians already there. You don't have to call them. Certain conditions can be treated at level 2 versus level 3. Training that goes with level 2 versus level 3 as far as research or residency programs.
I think you just mentioned resources. Would you agree a level 1 trauma center as it relates to resources? Some of those are the fact that they have more physicians and surgeons and other trauma personnel ready and available at all times.
Yes,
And at a level 1 trauma center, the personnel, whether it be someone in your position working as an RN or orthopedic surgeon or a heart surgeon and things of that nature, they are, because it's a level 1, doing procedures and performing trauma-related work more often than people at trauma level 3 hospitals, correct?
correct.
They see a lot more patients as it relates to trauma, correct?
I don't know about more, but definitely a higher acuity.
Let's talk about Brady. Have you ever, when you said you've been in the emergency room environment since March 2015?
No, I've worked at Cobb ER since February of 2010.
And so, I guess in your tenure, working at different roles in the emergency room at Cobb Wellstar, at any point prior to that, have you ever worked at a level 1 trauma center such as Brady?
No,
And you would agree, the individuals, physicians, the Brady paramedics and EMTs, they experience trauma-related patients every shift. They
Objection, call for speculation.
Had you finished your question?
had it, but
Okay, why don't you ask the whole question and then if you'll hold off on answering, we'll see what we're gonna do.
I'll rephrase to see if I can avoid objection. But Grady's a level 1 trauma center, correct?
correct.
And I think we just discussed with level 1 trauma centers, they experience a higher volume of trauma-related patients in correlation to someone like you who works at a level 3 trauma center,
I
right?
wouldn't say higher volume, but higher acuity.
Okay, so do you think that Cobb Wellstar treats as many patients as Grady here down in Atlanta on a daily or weekly basis?
I can't confirm or deny.
And you're here to testify as an expert in emergency room procedure and emergency medicine, right?
Correct.
And as part of your, I guess, preparation for today, did you do any research into how many patients Grady treats on a daily, weekly, and yearly basis?
There's no way to find out that information.
Okay, so it would be your opinion that Brady doesn't keep numbers as it relates to the number of patients, specifically trauma patients that they treat.
Objection, call for speculation.
Overruled.
If there is, I'm not sure where to find it.
Now, as part of what you do with Cobb Wellstar, I guess if you've been trained to use the GCS scale that we talked about,
Correct.
and can you tell the jurors, obviously they've got GCS, and is it a maximum of what, 15?
Yes.
And the lowest you can have is what, 3? Can you tell the jurors, how do you get to either 3 or 15 when you're adding G, C, and S?
It's divided into 3 sections. You have eye response, you have verbal response, and you have motor response. And each section is scored differently based off if the patient is able to open their eyes spontaneously, can't open their eyes at all. It's a criteria. As far as verbal responses, there's a numbering for whether they can talk at all, whether it's incomprehensible, whether they sound confused. And as far as the motor response, it questions you based on whether they respond to pain, they flex from pain, extend from pain, or don't respond at all. So it's numbering.
Okay, so you get a score for G, you get a score for C, you get a score for S, right?
Correct,
And then you combine or add all those together.
correct,
And you can either get a minimum of 3 or maximum of 15.
correct.
So there's the maximum of 15, let's say 14 to 15, if that's what the score or the value that the physician or the medical professional who's treating the patient finds. What does that mean as it relates to what you do as an RN?
The GCS score gives you a quick look as to whether or not there's a possible brain injury. So the closer that they are to 15, the less likely they are to have a brain injury.
So if someone scores 14, I know it sounds kind of silly since you said the closer they are to 15, they're less likely to have brain injury.
Correct,
Do you agree that if someone scores a 14, that they're less likely to have a brain injury?
correct.
Now I want to show you State's Exhibit 140.
Your Honor, my
Yes, ma'am.
screen says.
Oh,
mute.
yeah, if you will press the stay muted button. Yep, thanks.
Also the TV up there is not out.
Ah, the usual,
Like,
you can do that, thank you. Mr. Bate's gonna have to kind of squeeze in behind you, just turning a TV on.
Space for a quick second.
You're fine.
This,
That, yeah, that's it. Good. I will teach you how to do this. Deputy Gordon is the magic guy, so you didn't know that was part of deputy training.
Okay, so in a second, it's gonna be on the screen before you, but while I'm pulling it up, as someone who works as an RN in the ER, Cobb or in Cobb, can you tell the jurors, do you, I guess, work closely and often with either EMTs, paramedics, people who go to scenes and provide medical assistance?
Yes,
Okay, and is it something you say you probably wouldn't do every time you're on shift?
say that again, I'm sorry.
I'm sorry, is that something that you do or you work with those people every time that you're on shift?
Yes,
So yesterday, Mr. Miller showed you page one of Mr. Poole's EMS records. Do you remember that?
page 1.
Yes.
I would have to see it to remember.
Hold on, sorry.
Yes, I remember.
Okay, and do you see, and I'll make it a little bigger, I'm so sorry.
Can you all see that on the top screen? Nope, okay. It's awfully early to be getting in the lounge.
Okay, so I'll focus you to the box where it says vital signs. Do you see that?
Yes,
And you see in that box, so the vital signs, 3:48 and then 4 AM, correct?
correct,
And in both those boxes at 3:48 and 4 AM, the box next to the time says alert in both of those boxes, correct?
correct,
And if you continue to go down where it says pain, it says 10, correct?
correct.
Now, based on your training and experience, in order for EMT, a paramedic, someone like yourself who is filling in the box, coming up with the number value 10, the patient would have to be communicating with them as it relates to the pain they're feeling, correct?
They don't have to verbally communicate. We have different pain scales that can go based off grimaces or noises they're making to insinuate that they're in pain.
So,
How would you, if you're doing that, know if all you're getting is grimaces or something like that, know that for that person, it's at the maximum? I mean, other than the obvious, like if his leg was chopped off, but if you have someone with all limbs intact and everything, and all they're doing is grunting or groaning, how do you, as the medical professional, say, well, for that guy or gal, it's a 6, it's a 7, if they aren't verbalizing. I have never felt this much pain in my life.
Okay. The pain scale is almost like the GCS scale where different questions are asked and they have numbers. So if the patient, I don't know the numbers per se, I have to see it. But let's just say if the person is crying or screaming, it'll have a number. If they're moaning just a little bit, it'll have a lower number. So based off what they're doing is how you score.
Okay, so if you're not getting what I'll call a verbal response to your question, there's also a guide that says if they're screaming at the top of their lungs,
Correct.
put 10 down.
You can do nonverbal adult pain scale.
Okay.
And what you just described in relation to Judge Bernie's question, you would agree that you would describe in the narrative section, kind of what you just said, that you were able to get to the 10 pain level in this vital section because the patient was screaming, the patient was grimacing, the patient, you could tell, you would explain somehow how you knew he was a 10, correct?
You're not able to do that. With Epic, which is the medical record we use, most hospitals use, for the nonverbal pain scale, you don't get to write they're screaming or they're crying. There's boxes that you click. It may have crying, comma, screaming, or whatever, and you click on those boxes, but you're not able to manually write the patient is crying on that pain scale. You can make a note, but on the actual pain scale, you're just able to click the numbers and it adds it up for you.
Okay, thank you for clarifying that. So, as it relates to the box about the nonverbal cues as it relates to pain, you check it, whatever option you have under the box or the dropdown. But you would agree when after you pass the dropdown box, there's another area where you can write a narrative as to what you observed, what you experienced with the patient, and why you made the decision.
Correct.
Okay. And in that box, you would agree, you would put the things that you just described. If the person, if you got a 10 because of nonverbal cues, right?
Not necessarily.
Is it the point of a form like this to provide as much information as possible to the treating physicians once the patient arrives, based on, like you said, patient's acuity?
I've never completed a form like this, so I'm not sure.
Okay. Well, you may have never completed a form like this because it's done by the paramedics or the EMTs, correct?
Correct.
But you receive forms like this when a patient's received, correct?
I don't receive this form. I received the ambulance en route information. Well, when I did that job, I received that information. I've never received the EMS report.
Okay, so what's the point of an EMS report?
Part of the patient's medical records.
Do you know if a treating physician would look at it at some point?
They may.
Okay, but it's not something you in your role would have looked at?
No, I will look at the en route information.
Okay, and yesterday, Mr. Miller had these 2 documents side by side, this one plus another one. That other one was the en route information?
Correct.
So that's what you are looking at?
Correct. And this form would come later after it's been sent to medical records and transcribed.
Okay,
Okay, so you would agree, the person who's filling this form out is the person who's actually assessing and treating the patient as they're being brought into here at Grady Hospital, correct?
I cannot confirm or deny who fills this form out.
Well, you said you worked in the industry of the emergency room for over 20 years, right?
Correct. Well, 15 years.
15 years, excuse me. Shouldn't have recognized, giving me some extra years. But you would agree in your 15 years that you're aware that these forms are completed by the individuals who are treating a patient on Zoom, correct?
I cannot confirm who completes this form.
Well, you. So this says Grady EMS patient care record, right?
Yes,
And I know you don't work at Grady, but I'm sure they have Cobb EMS, right?
correct.
Who works for Cobb EMS?
Well, we don't have a Cobb EMS. This, Grady has their own EMS. Cobb Hospital does not.
Okay, so do you know about Grady EMS?
No.
At your hospital, at Cobb Hospital, when I guess who brings in patients? All right, there's an ambulance, it's a private service,
It is an ambulance.
okay? And it's an ambulance that's employed by Cobb.
I'm sorry.
The people who are in the ambulance, whether it be the driver, the paramedic, EMT, employed by your hospital, Caldwell?
I cannot confirm or deny.
And do they do a form similar to this when a patient is brought into the emergency room?
Again, I've never seen this type of form. I've only seen the en route form.
So yesterday you were asked a lot of questions about impressions you had related to this form. Do you remember that?
Yes,
But it's your testimony today, you had never seen this form until you reviewed the one that we're looking at, states Exhibit 140, as it relates to Kenneth Poole, correct?
correct.
Now, just to finish talking about the vital section, you see where it says the GCS and then the parentheses E, V, M qualifier?
Correct.
And you see under each one of the two boxes underneath, the one associated with 3:48 and the one associated with 4 AM. Can you tell the jurors what is the number for the assessment for Mr. Poole's GCS score scale by Mr. Mike Berry?
15 at 3:48 and 15 at 4 o'clock.
And you looked at this form in its full completion, correct?
Yes,
You saw at the back of the form, the signatures from Mr. Berry saying that he completed this form based on his assessment in scene and en route to Brady of this patient, the defendant, Kenneth Poole, right?
it says that it was electronically signed by Barry Larry. That's what it says at the bottom of the form.
Now, I want to show you the narrative section of State Exhibit 140. And you had an opportunity to review the narrative section, correct?
Yes, but I wouldn't need to refresh. I wouldn't know it by heart.
Give you hard copy, so have that in front of you, so just read it. So I'm finding that, can you tell the jurors, based on what you know as it relates to emergency room procedures that you were qualified to talk about yesterday, that narrative section, who fills that out?
The person completing this form.
Okay, and from your review, who is the person who completed the narrative section of this form?
Larry Barry.
Okay, and can you tell the jurors, are you able to read it in front of me?
I have it in front of me, yes.
Can you tell the jurors, during his narrative description, does he describe the patient's age?
His age,
Yes.
you have to scroll down.
It's in the, he's asking just about what's in the narrative box.
Oh, I'm sorry. In the box, yes, he's 22.
And then next to where it says the patient's 22, can you tell the jurors, he describes that he was an unrestrained driver, correct?
Correct.
And then next to that, he described how he was found in the vehicle, right?
Correct.
And he was found on his back across the front seat, right?
Correct.
His head was out the passenger door, right?
Correct.
And his feet were in the steering wheel or steering column area, right?
Correct.
Now next, what does he say about the patient's level of alertness, consciousness, his ability to comprehend and understand?
He says patient was conscious and alert.
Okay, and then does he say why he was unable to get out of the car as we move further?
He was pinned in the wreckage.
Okay, and did it take a while to get him out? The fire and EMS had to get him out?
He said it was a lengthy extrication.
And then can you, as you continue to read, can you tell the jurors what injuries did EMT Barry see initially?
It says abrasions noted to the anterior chest. Right leg had obvious deformity. Multiple soft tissue injuries noted to the arms. burns with swelling skin to the hands. And that's all I see.
Okay. Did he indicate that he had soft tissue injuries to his head? His eyes were burned, right?
Oh, I'm sorry, I missed that part. Head had numerous soft tissue injuries, eyes were burned. Burns and dry blood noted to the mouth.
Then you tell the jurors, did he notate that Mr. Poole could speak without difficulty?
Yes,
And then you see where it says kind of specialty patient motor vehicle collision, that section?
yes,
And you see that it says that the patient, the defendant, Kenneth Poole, was in the front left side, the driver's area, right?
yes,
There's a damage location, that the car was damaged, center front right side.
yes.
Okay. Now, I want to talk to you, transition to, and I apologize, I wrote it down and I can't find the actual title that, Mr. Todd Clark, had. And he's the person who, sorry if I'm getting it wrong, but I would describe him kind of as like a dispatcher. He's receiving calls from, the ambulance, and then he's taking information down and putting it in. Is it y'all's, you said EMS? What's the system called?
The Epic record,
Right?
correct.
What's his title?
The person taking the report,
Yes.
or my hospital is called the Command Center Tech.
Okay. And can you tell me, what are the primary roles of the command center tech?
The Command Center Tech takes report from EMS, police, or anybody that's bringing a patient into the emergency department.
Okay, so is it fair to say that person, just generally, we'll use person at your hospital, he or she receives a phone call and or a radio from somebody on an ambulance, and they relay information to that person, right?
Yes,
And the person who is relaying the information, that person is physically assessing, treating the patient, right?
correct.
And the person, I'm gonna call him the dispatcher for the hospital. That person never sees the patient, right?
They see the patient once they get there.
Okay. But prior to that person's arrival, they don't see the patient.
No,
And there's a chance that even after that person's arrival, they don't see the patient, right?
they see the patient as soon as they come in, from my experience.
Okay. But do you know if at Grady, when a person arrives, that for lack of better words, the dispatcher actually sees the patient?
I'm not sure about Grady's process.
Okay, and would say, for argument's sake, that the dispatcher does see the patient. When he or she sees the patient, they don't assess him, correct?
No,
They don't treat him, correct?
no,
If they see him, it's because he's being rolled in, for trauma services, correct?
correct.
That person's only role is to, notate as, the EMT and paramedics carrying the patient, as they're coming in, right? The information they provide.
Enter the information and also report to the charge nurse.
Okay. So, in Defense Exhibit 8, this was the medical records of Mr. Poole. Do you remember talking about and looking at those yesterday? I think we were on page 5. Let's go back. Okay, let me zoom in a little bit for you. All right, so this is the notes by Todd Clark, right?
Yes,
And through your work in the emergency room department, industry or field, have you ever met Todd Clark?
no,
Prior to your testimony today, did you make any attempt to call Todd Clark?
no,
Send him an email?
no.
Do you know if he even still works at Grady?
I'm not sure.
Okay. And so Todd Clark, his title is paramedic nurse extender,
Yes,
and that would be the equivalent to what you described as the command center individual at Wellstar, right?
well, just because he's a paramedic doesn't mean he does that job. All the paramedics don't actually sit and take calls. Some of them work on the floor.
Okay. Based on your reading of Mr. Clark's notes, he is the equivalent of what you described as, and what I have given the term of dispatcher, right?
Yes,
So he is the dispatcher this night.
yes,
And he receives a call from Mr. Berry, correct?
yes,
And as he's receiving a call from Mr. Berry, he's typing in what he thinks he's hearing, right?
I'm not sure if he types it or writes down, but in my experience, it's written down first.
Okay, so he's reporting it in some way, right?
Yes,
And you would agree, as it relates to the GCS score you talked about yesterday, he records the score as 11, right?
yes,
And do you see where it says patient arrival information, arrival date, arrival time, 4 AM?
yes,
Would you agree that it's not only the GCS score of 11 is different than the two scores that Mr. Berry had recorded in his report after he physically assessed the patient?
yes,
And you go further down, that last couple of lines of information where it says patient arrival information,
yes,
and it says 4 AM, correct?
correct.
And do you recall, we were talking about State's Exhibit 140, that at 4 AM, he was assessed for his alertness, correct?
He was assessed for,
How alert he was.
yes,
In the vital section, he was assessed, the box next to the time said alert, right?
correct.
And again, what does that mean?
That he was able to respond,
Okay. And that at 4 AM, not only was he able to respond, he was able to assess that his pain level was still under 10, right?
can you repeat the question?
So remember the box, the vital section box had the time 3:48 and it had 4 AM, right?
Okay, yes,
And it went through the same assessments that he had went through at 3:48, right?
yes,
And so at 4 AM, he assessed his pain level, right?
yes,
And at the same time, or during that time, he assessed his pain level still to be a 10, correct?
yes,
And at 4 AM, he did the GCS score or scale for the patient, right?
yes,
And he notated that it was 15, right?
correct.
Where on this page, page 5 of Mr. Clark's notes, do you see anything about EMT Barry's assessment of the patient at 4 AM when he arrives and before he brings him into the ED or ER?
I don't see anything about an assessment from Mr. Berry.
So it's fair to say Mr. Clark didn't include that in his notes.
About just pain assessment?
Well, pain assessment about his GCS score at 4 AM, do you see that?
I see the GCF score of 11.
Okay, is that at 4 AM?
According to, can you scroll down on the form? I don't know if there's a time at the top. I'm sorry, the other, I can see the top of the form. According to this, it's saying 3:48.
Okay, so 3:48 was the first score that we have on States at 140, page 1 of EMT Barry's report, correct?
Correct.
So Mr. Clark, you would agree his assessment or his notes don't have anything related to EMT Barry's assessment of the patient right before he arrives at 4 AM, correct?
He hasn't, the report from 3:48, and he wrote down what he listened to over the radio from Mr. Berry.
Anything about the assessment that Mr. Berry did of this patient, the defendant Kenneth Poole, is not contained, or from 4 AM, is not contained in Mr. Clark's notation page. on
For
page
4
5.
AM, no.
Now, in your review of the records, can you tell the jury, is Mr. Poole's GCS score, or is Mr. Poole's, is the GCS evaluation done on Mr. Poole more than once?
It is.
How many times?
Before he, well, according to the EMS report, twice.
Okay, and well, in his entire stay from April 9th of 2021 to the date of discharge, April 4th of 2026, or excuse me, April 26th of 2021, is his GCS score recorded throughout the medical records?
I would have to look at the medical records again to confirm.
Okay. Would it surprise you that Mr. Poole's GCS or a GCS evaluation is done on Mr. Poole and it is scored in his records over 130 times?
I can't confirm numbers like that.
Would it surprise you?
I'm sorry.
Would it surprise you that GCS, the GCS score for Mr. Poole is notated 130
I
times?
think that's a lot.
A lot as if
How many days was he in the hospital? That's a lot for him to be in the hospital that many times. It's normally assessed probably once a shift by each nurse at the most, I would think.
How many shifts in a day?
It depends on the hospital. They could do 2 shifts, 7A to 7P, 7P to 7A, or they may have a mid shift.
You don't know how great he does it.
I'm not sure how great he does it.
Okay.
One second. So for example, showing page 8 of Defense Exhibit 8. All right, you see at the bottom of the page 8,
Yes,
where it says, I guess, disability, PERRL, and then the GCS score.
yes,
Can you tell the jurors, what's the GCS score?
14.
And what time, if you know, was the GCS score taken by a physician or a RN?
I can't see the top of the screen.
Well, tell me when to stop.
Okay, this was from an MD.
Okay. And was it that morning?
It was that morning, well, no, it was that night, actually. It says at 11:59 PM. Oh, no, I'm sorry, I'm looking at this head station. That was from 6:58 AM.
Okay. And hold on. You see at the top of the box, let me zoom in so you can see.
I've got a, if you leave it on the screen there, I've got a question for you. Blood pressure is in red with exclamation point. Is the system, I know this isn't your hospital system, but is that a way just to draw attention to someone reviewing the records that
That's to
something
draw
is-
attention to the fact that the 54 is less than 60.
Okay, and that 60 is an important threshold?
60 is kind of, you have a parameter for normal blood pressure. And 60 is, you don't really want it less than 60.
Okay.
So do you see at the top of the screen what I've typed into the little black area, black box there where it says GCS?
Yes.
No, I'm sorry, up here, right up here. You see where I
Oh, yes.
search GCS?
Search, yes.
Okay, and then you see it says 2 and then of 2 of 130.
Yes.
All right, I want to go to. Next page. Now, do you see on page 16, the GCS score for the defendant that was assessed or evaluated by this physician or medical professional?
Yes.
And what's the score?
14.
I want to show you, it's right there on page 32. You see the highlighted area?
Yes.
Here it says the patient is a 22-year-old man who presents after high-speed MDC with facial exposure to oil and things of that nature.
Yes.
Okay, you see on the, it says on arrival. So what does that mean?
When he got to the ER.
And keep reading, on arrival, the next sentence is GCS 15, right?
Yes.
So that means that his GCS was 15 upon arrival, correct?
According to this, yes.
According to the notes that were, I guess, input by the physician who was treating Mr. Poole, looks like at 4:32 AM, right?
Correct.
That was the resident, Dr. Chester, right?
Yes.
And Dr. Chester recorded in his medical records, like EMT Barry did, that he was a GCS of 15 upon his arrival at the hospital, right?
Correct.
Not like what Mr. Clark said, 11, correct?
Correct.
If you're a GCS of 15, you are very unlikely to have a brain injury, correct?
Correct.
And before he indicates that his GCS upon arrival is 15, can you tell me what it says about his ability to speak?
Primary intake, able to speak without stridor or hoarseness.
So anywhere upon arrival, does anyone ever notate that the defendant has an inability or has difficulty speaking or communicating?
I would have to look at the records again to see if anyone wrote it.
I can bring them to you. There's a lot of pages based on your preparation for today and based on your review previously of the records. Do you remember anybody ever indicating that the defendant had difficulty speaking, difficulty communicating to anyone upon his arrival at the Grady EMS, Grady Hospital?
I do remember at one point that a nurse charted he had loss of consciousness.
And let's talk about that. So, when you say he had loss of consciousness, are you telling the jury that he had loss of consciousness in the ER?
According to the medical records.
Right, do you remember where in the medical records it said that?
I'm not sure what page it was, but I think when he arrived around like 4:16 a.m.
And the loss of consciousness that you're describing, is where, I'm trying to find it, where in the records, is it notated, in regards to the treatment that, Mr. Poole, received?
I would have to see the chart again.
Your recollection, is it intake? Is it, a physician who is in the midst of treating Mr. Poole, and it says that while I was treating Mr. Poole, he lost consciousness?
No, I don't recall it saying that. I don't recall it giving an exact reason why he had loss of consciousness. It just said positive LOC.
Page 2071. Right, is this what you're talking about?
Yes.
Let me zoom in so you and everybody else can see too. So what section of these medical records for Mr. Poole are we in? You want me to scroll up?
These look like progress notes.
Progress notes.
That's what it looks like.
Okay, so if I scroll up, see where it says.
Or flow sheets, okay.
Okay, so what can you tell the jurors, for those of us who are not familiar with this kind of verbiage, what is a flow sheet and what is it reporting?
Flow sheet is where you chart things about the patient, such as vital signs, their input, output, as far as like receiving medications, using the restroom, basically a measurement of things that they're doing.
And you see, so you said where it says loss of consciousness, or in parentheses LOC, right?
Yes,
And above that, it says responsiveness, right?
yes,
And do you see where at the very far end of the box it says responds to verbal, right?
yes.
What does that mean?
That means when the nurse spoke to him, he responded in some kind of way, whether it be a blink, a turn, or anything.
Well, if he responds to verbal, what is verbal? Are you saying that verbal means the nonverbal cues? Is that a separate notation as it relates to nonverbal cues like you described earlier?
Well, this response to verbal is not speaking of the patient, it's speaking of the nurse. So the nurse is the verbal person and the patient is responding to her voice.
So you would agree if he's responding to, I guess, verbal communication, verbal whatever, making noises by this medical provider, he's alert and conscious, right?
I don't know to what level the degree of alertness.
Well, I guess my question is how are you responsive if you're unconscious?
Well, he's conscious, but I'm not sure how alert he is.
Where it says loss of consciousness, And it says yes, P1 at 4/9/21, 04/16. You see that, right?
Yes,
Same time, right?
yes.
That's because this provider is asking Mr. Poole, did he lose consciousness at any point, correct?
I don't think she's asking. My interpretation is not her asking, but more of her observing he has loss of consciousness.
You would agree, it's, and I'm good, I could be wrong, but it's medically impossible to be responsive and unconscious, right?
Can you rephrase the question or repeat the question? I'm sorry.
Like, how is it medically possible to be responsive verbally? So whether it's he's responding verbally or he is doing something that indicates that he understands whatever verbal communication the provider is asking or giving, but also be in a state of loss of consciousness. Is that possible?
It's unlikely, yes.
So would you agree that the yes is his response, that he had lost consciousness at some point during that evening or early morning?
I cannot confirm or deny. I don't know if it's a mistake on the nurse's part of the charting. I wasn't there, and
But you would agree that on 4/9/21 at 4/16, both of these can't be true.
it's unlikely.
Okay. And nowhere in the records does a medical professional, whether it be a doctor or a professional like yourself, an RN, indicate that in their presence, this defendant lost consciousness at any point.
Repeat the question?
Nowhere in the 2,000 plus records does a medical professional write a note indicating that this defendant, in their presence, lost consciousness, correct?
Not to my recollection.
You would have put that in your report and you would have reported it somewhere, right?
Well, it is recorded here. She charted it here, but as far as a manual, nothing's charted from her. So this was probably like a box that was clicked, as yes,
As in, that's the response that he gave
yes,
when he was conscious and alert.
yes.
And can you tell the jurors at any point in your review of the records, is Mr. Poole's GCS score anything other than a 14 or a 15, other than what's recorded the one time by Mr. Todd Clark?
I can't recall the entire medical record.
You reviewed them all, correct?
I did, and it's a large record.
And if you would have found another instant in those records where a medical provider that Mr. Poole saw through his stay on 4/9 through 4/26 had assessed his GCS score as an 11, you would have notated that, correct?
Yes,
Like you notated what you saw with Mr. Todd Clark's notes, correct?
yes,
Only individual that did not assess or treat this patient, correct?
correct.
Now, one more thing, and I only have a few more questions for you. Do you remember yesterday, there was a response or a question about, we read an area of the defense's aid, the medical records. I think it's page 7, I'm almost there, but that you were asked a question about Mr. Poole's license and who it was given to. I think it was family members was what it said specifically.
Yes,
Do you remember what time that notation was made in the records?
no, I don't.
I think this is it. So you see where it says in the middle of the page, but it's the bottom of page 7. It says patient's driver's license kept with the patient, all other belongings. You see that?
Yes,
Can you read after the comment where it says patient, What does it say about the belongings?
All other belongings taken by patient family as per patient request.
As per whose request?
Patient,
The patient too.
Mr. Poole.
And in order for Mr. Poole to make this request, he'd have to be alert and conscious, correct?
Yes,
And that, the time that this service was provided to the patient, the defendant, Mr. Poole, was it 11:39 a.m., correct?
correct.
Now, you talked yesterday towards the end of your direct testimony about some injuries that Mr. Poole had received. Remember that?
Yes,
And you would agree that Mr. Poole received some serious lower extremity injuries, right?
I think one of his legs was fractured.
Okay. When you say one of his legs was fractured, what was fractured and which leg?
His right femur, I believe.
And that's a pretty serious fracture, correct?
Correct,
Femur, it's one of the toughest or hardest bones in your body, right?
correct.
And it's not easy to break.
No,
And he also had tibial fractures, correct?
I would have to relook at the chart again. I distinctly remember the femur.
Well, I guess when I'm pulling it up, would you disagree that he had tibial fractures? You went through the full list yesterday. It was one of the last pages you were shown was the extensive list describing the injuries that the defendant received. Was one of those injuries, to your recollection, a tibial fracture?
I was actually asked about torso injuries, so that's what I was looking at throughout the chart. So I can't remember everything that was on there.
Okay, so as a part, I guess, the preparation or what you were asked to do here yesterday and today, you weren't requested to look at the lower extremity injuries of this?
Yes, I was, but yesterday when I looked at the chart, I was specifically asked about the torso.
All right. I wanted to share with you page 115. All right, do you see where it says operative procedures?
Correct.
Do you see where it says the operative fixation of the right femur?
Yes,
Won't try to pronounce the next one, that relates to the describing type of fracture. So then it says operative fixation of what?
the left tibial shaft fracture.
Okay, so does that refresh your recollection that the defendant had at least a left tibial fracture?
Yes,
And where is your left tibia?
it's in the lower part of the leg below the knee.
Are we talking about the shin? Are we talking about the ankle?
It's on the inside of the leg. No, next to underneath the knee, sorry.
You talked yesterday a little bit about, I guess, the injuries that you would expect to see in I think it was described as a high-speed motor vehicle collision. We're talking about that?
Yes,
And based on your number of years of experience, and I know you said you've been working as a registered nurse since, I think it was what, July 2023?
correct,
But prior to that, you had been working as a ER tech, right?
correct.
And as an ER tech, you still see patients and things like that.
Yes,
And I think you said that was for at least 10 years, right?
I'm
You've
sorry,
been doing the ER tech position for at least 10 years?
for 13.
And in those 13 years and then plus a little over, I guess, 2.5 as a registered nurse,
Correct,
it sounds like you've seen quite a number of individuals who have been in motor vehicle collisions.
correct,
And of the individuals who you have seen who have experienced a motor vehicle collision, are many of them from high velocity, high speed motor vehicle collisions?
correct.
And you would agree with me that somebody who is seated in the front area of a vehicle, the driver's seat, the passenger seat, who experiences a high speed, high velocity front right collision with a wall, a concrete wall that's associated with the overpass of a highway here at Georgia 400, you would expect to see lower extremity injuries like a femur fracture, correct?
It's likely.
And it's likely that the person who experiences that high speed motor vehicle collision, who's seated in the front, would also have things like a tibial fracture, right?
It's possible.
You talked a little bit yesterday about, I think you said somebody sitting in the front compartment, the driver's compartment, you'd expect to see airbag burns and things of that nature?
Yes.
Okay, tell the jurors why.
Because the airbags come out at an accelerated speed, and so it's almost like getting a carpet burn. The material from the airbag can burn your skin. You have abrasions. The pressure from the bag can cause fractures like eye orbits, nasal fractures, just because of the pressure from the bag. Bruises on your chest, bruises on your face, things of that nature.
Okay, I want to show you page 444 of the record. And in your review of the records, and in the report that you produced and provided, did you notate that Mr. Poole had any airbag burns that were notated by physicians or other medical professionals?
I cannot recall any abrasions from airbag burns on him. No,
No, you did not make that notation.
no.
So on page 44, do you see where it says assessment and plan?
Yes,
You see where the physician, Dr. Malika Zairi, he or she found that Kenneth Poole, 22-year-old male, who experienced a motor vehicle collision, he had airbag burns to his face.
okay, yes,
Okay, so that would be consistent with what you described as somebody sitting in the front receiving the airbag striking them, causing these burns, correct?
well, airbags can be on the sides of cars as well, so there's no way to tell whether the airbag was in the front or the back. That's not my forte.
I don't disagree with that. You remember yesterday, though, you said that you would expect to see somebody who was in the driver's seat to have airbag burns if they experienced a front collision with hero wall
I didn't mention the driver's seat at all yesterday.
in the front compartment of the vehicle.
Repeat the question?
You remember saying something along the line, if somebody was sitting in the front compartment of the vehicle, you'd expect to see that person with airbag burns.
Yes, if the airbags deployed, yes.
And I guess in your review of the materials for this case, did you just review medical records?
I reviewed medical records and also the ambulance report and the EMS, the ME report.
Okay. Did you review any photographs or anything associated with the investigation?
I did look at photographs.
Okay. And when you looked at photographs, were they photographs of the white 2000 Infiniti that had been crashed and was owned by the defendant?
I did see photos of the car.
And in your recollection of seeing those photos, did several airbags deploy?
Yes,
Any point did you review the crash data retrieval report that showed that the front airbags, the driver and the passenger front airbags deployed in stage 1 and stage 2?
I remember that.
So this injury, based on your opinions that you provided the jury in the court yesterday, is that what we just read is consistent with Mr. Poole being in the front compartment of the vehicle at the time of the motor vehicle collision.
I don't know which airbags deployed. I just know airbags deployed. I can't say it was a front seat, passenger, driver, back. I can't.
I understand that. My question is based on what you said yesterday, that an airbag burn is consistent with somebody sitting in the front compartment. You would agree that what we just read is in line with or consistent with your opinion that you provided us yesterday?
Yes.
Oh, I did want to ask about two more things, and I apologize. I promise, it's only two more things. You talked yesterday at the end of your testimony about, is it AO, little x times 3?
Yes.
And you said that that means that a person is oriented with place, time, and what else?
Person.
And I may have missed, so I apologize. Is there something that's higher than AO3?
A&O times 4.
And is that something that's commonly used, the A&O times 4 in the medical profession?
Yes.
And in your review of the records, did you ever see anyone describe Mr. Poole or evaluate Mr. Poole as anything other than AO times 3?
No.
But at the time of his discharge, you would agree the description that was provided was that he was AO times 3.
I would have to look at his discharge information again.
Do you know where it is in the medical record?
I do not.
And when Mr. Poole first arrived, you would agree he received treatment from emergency room physicians, surgeons, orthopedic surgeons, correct?
Correct.
And one of the surgeons who assessed Mr. Poole spoke with him about putting I wrote it down, so I'll make sure I don't get the terms incorrect, but a traction pin into to kind of hold his femur together, right?
If the consent was signed, yes, he did speak to him.
Okay, and I guess that's my question for you. Don't you remember seeing in that section where that conversation happens, that physician notates that he verbally consented to the pin being placed in his femur?
I would
Right.
have to see the medical record to confirm that.
Is that something you notated in your report?
No.
Don't you believe that's something that would be important to notate as it relates to your analysis of Mr. Poole's mental consciousness and alertness upon his arrival and continued stay at Grady SC procedure?
There's a lot of important information that need to be notated. I can't notate the whole medical record. So some stuff may be left off.
But if it was deemed important as it relates to things that you were here to testify to, you would have notated it and you would have provided the information to the jury, to the parties, right? That's what you're paid to do, right?
Repeat the question?
That's what you're paid here to do, is to provide us with the most pertinent and important information.
Correct.
And I know, as the judge said, you're not paid enough to be here now 2 days in a row. Can you tell the jury, I know it was asked, that you have been paid prior to testifying as related to your review of the records. Can you tell the jurors, how much were you paid to review the information that you talked about here today?
I gave that information yesterday, $750 to be here yesterday.
But I'm talking about prior to being here yesterday. I know you said your daily rate is $750, but it also was asked that preparation, you were paid to review the record, correct?
Correct.
My question is, how much were you paid to review Mr. Poole's medical records, the records of Mr. Minor, and whatever other records and things you reviewed?
I would have to look at my invoice. I can't remember the exact dollar.
You have a.
But I do charge $150 an hour.
How many hours do you think you spent?
I think maybe over 30 hours looking.
3 or 30?
30,
30.
So roughly 30 times 150.
roughly.
That's incredible.
Mr. Miller, do you have any redirect for Ms. Freeman?
Yes. Good morning, Ms. Rainbow.
Good morning.
On direct, you were asked about a note regarding airbag burn to the face.
Meaning you asked her yesterday?
I'm sorry, on cross, you were asked about a note regarding airbag burns to the face. Here's that note. What, do you know the date that that note was given?
The date,
Yeah, yes,
at the bottom, it says 4/17.
okay. And I'm scroll, and who's the doctor that put that on there?
Dr. Zari, general surgery.
All right, now. I'm gonna hand you the defendant's exhibit A. I know it's thousands of pages. But just so you have it there, but I wanna do something. In the search, if you can see, I searched airbag.
Oh.
And in those, how many pages you put about? 2,000?
It's a lot.
A lot of pages.
At least probably about 2,000.
All right, now, looking at the screen, how many times does it say, airbag burn to the face? So here, we have the Zier here. This doctor?
I'm sorry.
So are you asked, you need to ask.
So I'll rephrase. All right, so this is the original note where it said airbag burn to face,
Yes.
correct?
Yes.
All right, and we see that, who was that doctor?
The general surgery.
All right. All right, now on page 501, does it say that the airbags, that there's an airbag burn to the face?
It says airbags deployed.
Okay,
Burns, I'm sorry. Yeah, airbags deployed.
all right, and this is the burn console, page 54, does it say airbag burns to the face?
Secondary notable of deep burns to forehead, eyelids, cornea, and suiting nares. Airbags deployed.
Okay, just airbags deployed, that's all it says, correct?
Yes.
All right,
So there's 16 entries. You can let the jurors know, are you gonna have this witness read to the jury 16 separate entries in the medical records?
yes,
You can let the jurors read the medical records.
I'm on redirect.
Understand, but
You want the jurors to read 2,000 pages of medical records?
so tell me how this is a proper use of this witness to say, I will now read. She said she doesn't know how many entries there were in there that say airbag burns or not.
On cross,
Thankfully, there's only one mention of airbag burns by Dr.
Zarai.
Zarai.
Okay, done.
all right. Now, on cross, On cross, Mr. Abate, that's what it was. All right. On cross, Mr. Abate, discussed the different levels of trauma that a hospital has. Do you remember that?
Yes,
All right, now your hospital is a level 3 trauma, is that correct?
yes.
All right. For Mr. Poole, on that ambulance en route information, the trauma activation, what is the trauma activation? What does that mean?
That means they page the trauma team, which means it's a trauma physician. They probably have mid-levels with them, maybe a trauma nurse.
All right, and what was his trauma level?
What was his trauma level 2?
All right, and it's noted that he's a trauma level 2. What are some of the things to take in consideration for a person to be at a level 2 trauma?
For this case, his GCS score, which falls between 9 and 13, and also the intrusion of the car was more than 18 inches.
Where do you see that? Or this is just from your review of the records?
Just from the review of the record.
Tell me what you mean by
As
intrusion.
far as like indentions in the car or how bad the car was crumbled up, per
Got it.
se.
Got it.
And so that would put him at a level 2 trauma, correct?
Yes,
The hospital where you work at, if a patient comes in that is at a level 2, would you all still be able to treat that patient?
yes.
What would be the what type of services or what would your hospital provide for a level 2 trauma patient that came in?
For this particular patient, he needed ortho, so we would page ortho. General surgery would have come down once the trauma team was activated. So for him, ortho would have been paged in general surgery.
At your hospital, on occasions, do you all treat level 2 patients?
Yes,
Would you say that that's regular?
it's common.
Common. On cross, Mr. Abate discussed the loss of consciousness. Do you remember that?
Yes,
And it's noted that loss of consciousness is noted. What time was it that loss of consciousness, according to that report? What time does it say that loss of consciousness was?
4:16 a.m.
All right, and then also there was some discrepancy between responsiveness because what time was that though?
4:16.
All right, now at 4:16 a.m., what medication, according to the medical records, had Mr. Poole had?
I remember him getting ketamine around 4:12, if I'm not mistaken.
I'll take you to the, I know there's over 2,000 pages. All right, so looking at, page,
Oh, it was fentanyl, okay, not ketamine.
looks like 183. What medication, what medication had Mr. Poole had, at the time that that note was by the loss of consciousness?
Fentanyl, not ketamine, my apologies.
And so there's another note underneath that fentanyl that says override fentanyl. Could you tell the jury, what does that mean?
Normally, when we have to override a medication, it's because it hasn't been ordered yet and it's needed in an emergent situation, so it's needed right away. So instead of waiting on a doctor to order it, for it to be pulled from the Omnicell, you can override it, and then the order can be put in later because you need it right then.
And who would have overrided, a, excuse me, who would have overrided that fentanyl? Is it injected or peeled, or how do they get it?
The nurse normally overrides it on the machine, the medication, the Omnicell.
Why would a nurse override, and make sure that a patient had fentanyl?
Why would she override it?
Yes.
If it was needed emergent, like right away. Also a pharmacist can override it, I'm sorry.
But in this case, the person that did that override, what was their position? Or are you able to tell?
Um, it doesn't have her title on here. The nurse gave it, but the person that override it was Catherine Towson. It doesn't have her actual title behind her name.
Okay. On cross, Mr. Abate. Sorry. I apologize. We talked about the override that occurred. What time was that override?
The override was done at 4:12
Is that AM or PM?
a.m.
On cross, Mr. Abate kind of straight that, or stressed that, the driver's license, this note at 11:39 AM, that belongings taken by patient's family as per patient request. Do you see that?
Yes,
Are you able, or do you know how that request was made by the patient?
according to this note, no.
And so can you assume that it was a verbal request?
You can assume that by this.
Do you need more information?
Yes.
He discussed, femur fractures with, individuals that are, sitting in the front seat of a vehicle. Do you remember that?
Yes.
Does every single person that's in a car accident that you've treated, that is in that front seat, do they have femur fractures?
No.
Is, that one of the only indications of where an individual is in a car?
No.
In the EMS report, in the EMS report, you stated that you've never seen a EMS report in your line of work, correct?
No, something like this is not done in real time. It's part of the medical record that someone would pick up, or it'd be added to the chart later. This is not done in real time.
All right, and so where it says position in vehicle, front seat, left side, do you know where the EMS would have gotten that information from?
Possibly whoever showed up at the accident, I'm not sure.
And as EMS is en route and they're radioing to Grady about the condition of a patient, that person is also doing, what else?
The patient taking a report?
The EMS person that is making the radio calls to Grady.
Oh, they're more than likely taking care of the patient en route, some kind of way.
Right, so they're doing a number of things at one time. Is that fair to say?
Yes.
The injuries that Mr. Poole had, can you tell the jury what is the coracoid process? Or the, where it says displaced fracture of coracoid process left shoulder.
Where do you see that? I'm sorry.
Um, eight lines up from the bottom.
Oh, I'm not sure right offhand, but I'm assuming it is somewhere around the clavicle shoulder area.
All right, so there's some shoulder injury, correct?
Yes.
All right.
You almost
Off-
done?
Yes, offhand, do you know the discharge date for Mr. Poole?
Not offhand, no. I want to say it was April 21st, but I'm not sure offhand.
All right, so, here was his
On
discharge
26th.
information. So what date was he
He
discharged?
was discharged on the 26th.
So, from April the 9th until April the 26th, he was in the hospital. Is that fair? Is that correct?
Yes.
So, and during that time, well, no further questions.
Mr. Body, anything else?
Just a few very short questions. The fentanyl that was prescribed, the override, things of that nature, you were talking about that with, Mass Council.
Yes.
The medication, the dosage of the medication you're giving, it's a pain dosage, correct?
I don't even, I need to look at the thing again to see the actual dosage of it. I think it was 50 mics, but it's for pain.
Okay, it's a pain dosage, right?
Yes.
And if the defendant, as a patient that night experienced any psychosis, hallucinations, any sort of reaction like that, it'd be notated in the records, correct?
Not necessarily, depending on if the nurse charted or not.
In your experience, is that something you would chart?
No, unless it's something out of the ordinary. Fentanyl is known to charge dizziness, drowsy, to cause dizziness, drowsiness, or confusion. So if it's something that happens out of the ordinary, I would chart it.
Okay, and then you would agree that as it relates to every patient that is involved with Grady EMS and arrives in the trauma room or at Grady Hospital, the form states that 140, the EMS report is done for every single patient. That's the standard.
I cannot confirm or deny what Grady does.
You don't know that the standard of care as it relates to emergency room procedures, which is what you're here to talk about, that's part of the standard of care grade.
To get a en route report, yes.
And then you would agree that the lower extremity injuries that discussed earlier, as it relates to the femur fracture and the fractures in the tibia, those are well recognized pattern injuries for somebody who's driving and their feet and the footwell of the driver's compartment of the vehicle, correct?
I cannot confirm that it's a driver's fracture.
You don't know if those would be considered well recognized pattern injuries.
Well recognized for being in the car, period, because the front, as I spoke yesterday, the front is usually, we see more torso injuries. Speaking of the lower extremities, I can't speak as far as lower extremities. In my experience, it's been more of torso areas or the upper part of the lower extremities. His femur, possibly, yes. The tibia, that's lower.
You don't say in your report that a femur fracture, it results from side impact crashes or when the lower body slams against the vehicle's center console?
It could, but the femur is higher up. We're speaking of you asked about the tibial fracture. That's in the lower leg. The upper leg is closer to hitting the dash of the console.
The lower extremity injuries.
But it's different parts of the lower extremity. The femur is still the lower extremity. The tibia is lower extremity, but it's way lower than the femur.
Thank you for clearing that up for me.
Mhm.
Jurors, do you have questions for Ms. Freeman? If so, if you would gather them and give them to Deputy Gibbs, please. Thank you. All right, counsel, I will see you out back. Ms. Freeman, we'll be right back.
Okay.
Yeah.
Said Nikki.
Just never in it. Yeah, it wasn't. Then I came over and finished it. That's what I do.
Court will come to order.
Are you related to Mr. Poole in any way?
No,
When Mr. Poole was admitted to the ER, one of the injuries listed in all the records we've been looking at is a right orbital fracture. Tell the jurors what that means and if in your experience, you've seen something like that being caused by hitting an airbag or an airbag failure.
a right orbital fracture, is something pertaining to the eye, maybe a eye socket or something. Um, if the pressure is high enough, I'm assuming it is likely to be caused by airbag. It's not unlikely.
In the operative notes that we looked at concerning the femur and tibia fracture procedures, there was a discussion about Mr. Poole giving consent. Was it from your review of the records that he in fact consented to those procedures?
I would have to look at the chart again to see if it was a verbal consent by Mr. Poole or if they had to contact family because he wasn't able to give consent.
All right, I think someone is looking in the records for a different question. Can we also look for the consent concerning, I think it was putting a pin or a rod in the femur? While they're looking for that, in your experience, Ms. Freeman, can a patient be conscious and then become unconscious in the same time frame that you are doing an assessment, say this person's alert, and then while you're making the assessment, then they're not alert?
True. I actually was thinking about that. So at the time she charted that he was responsive to verbal, meaning her speaking to him, and also loss of consciousness. It could have been a brief moment of loss of consciousness, not lasting long. So maybe that's why she was able to chart both. Or she could have been back charting and just charting that he did have loss of consciousness, but not necessarily at 4:12 when she charted it.
If Mr. Poole was given fentanyl at 4:12 that morning of April 9th, for the first time, why would, not you personally, but why would a medical professional override the medication at the same time? Or was that just they were shifting medications, like you described, maybe the fentanyl wasn't coming soon enough, so they said, well, find what's on the shelf?
Read that question one more time.
Why would there be in the record what looks like an indication that a dosage was administered, but then at the same time, they're overriding the medication?
So some medications are ordered and the pharmacy in the system, they have to approve it. So we'll get like a red check. They have to approve it before you're actually able to pull it. So sometimes if the pharmacy hasn't approved it yet and you need it immediately, you can override it. So if you don't have an order, you can override it. If you do have an order, but the pharmacy hasn't approved it to be pulled yet, you can override it as well. So that may be the case.
Explain to the jurors the difference that we would observe in seeing or trying to interact with a patient who was GCS 11 versus GCS 15.
GCS of 15, they are completely coherent. Anything you ask them, unless they're baseline, like they have dementia or something, then that's different. But a normal person with no kind of neurological issues, they'll be able to answer your questions promptly and correctly. They'll have spontaneous eye movement. Their language will be comprehensible. Their motor skills will be fine. They'll be able to do range of motion. They can respond to pain. If you pinch them, they can move their hands. Someone of 11, based off, I'm not sure what the actual score was, only the nurse or whoever took the GCS knows where those numbers were subtracted from. So it could be they are confused or they're speaking and their words aren't comprehensible. It could be that they're not able to spontaneously blink their eyes or open their eyes. They only open their eyes in response to pain or response to someone's voice. Or it could be that they're not able to move their limbs. Let's say you do a sternal rub, which is often done, and they don't move. Or you stick them with an IV and they don't move. They don't move their arm or anything. So it just depends on which area of that GCS they did the score for.
And it's 3 categories for GCS?
It's motor, verbal, and eye response.
Okay, so if one was a very low score, let's say motor, it's not this case, but because of the injury, you were now paralyzed. You could get a pretty low motor score, but the other 2 could be at the maximum. Your eyes are working just fine and you can have a normal conversation with the person, but I can't move my legs because of the nature of the injury I sustained.
Correct.
That could get you to an 11, a low motor score, but a high verbal and eye score, or does everything have to be lower to get you to 11?
Well, each section has different numbers, and I would have to have the numbers. I don't know the numbers by heart. So each section has like maybe 3 or 4 subsections.
Okay.
And each one of those subsections has a number where you would subtract if they score in that subsection.
But then do you add up each of the 3 subsections to get to a number, the lowest of which is 3 and the highest of which is
Correct.
15?
Correct.
So it sounds like each of those subsections adds up to a 5?
No, on the EMS report, it shows his 15, it shows which section, how much he scored in each section.
Okay,
It's on there
got it. But those 3 together add up to 15.
at the match, yes.
Okay, so if you got the lowest you could for motor, my example, that your legs are paralyzed, you might get a 1.
I don't know the numbers. I have to see the
Okay,
numbers.
but whatever, if you get the lowest,
Uh-huh.
that is gonna be a lower number. You could still have high numbers for the other 2 and get to an 11.
Yes,
Okay, or the other way around. It could be that your verbal is low,
correct,
or all 3 could have been lowered some.
correct.
All right.
And it still speaks for your neurological status.
Thank you. Explain to the jurors the differences between AO times 1, 2, 3, and 4.
Okay. A&O times 1 means you're alert and oriented to who you are. A&O times 2, you always add the 1 before to get the second one. So A&O times 2 means you're alert and oriented to who you are and where you are. So that's A&O alert and oriented to time and place. A&O times 3 is alert to person, place, and time. A typical question we might ask for time would be, do you know what year it is? Or something as specific as, do you know the date? And then A&O times 4 would be person, place, time, and situation, meaning, do you know why you're in the hospital? If you do know the place, which they might tell us, I'm in the hospital, do you know why you're here? Or do you know how you got here or what's going on with you? So that's 1 through 4.
Could someone with an A&O times 3 have a phone conversation with someone and it would be a fairly coherent phone conversation?
I don't see it being a coherent phone conversation because that means that they are not aware of what's going on because they're missing that last portion. So I think they would be able to have a conversation, but it wouldn't be consistently coherent.
Parts of it could. Who are you? That kind of, because it sounds
Yes.
like if you're at
Simple
3,
questions.
what's your name? Robert McBurney.
Right,
Where are you? I'm in the hospital.
right,
But maybe why are you here would be more complicated.
correct.
Okay. I think we've found a couple of the things we need to put up on the screen. Let me ask the next question and then I'll ask one of the lawyers to put up, I think it's page 105 and maybe page 109, but, oh, for the card? I don't know what this is. They'll put it up. The operative notes for the femur repair procedure. Did we find that? Okay, can you put that up, please? And we are on
Page 105.
page 105 of Defense Exhibit 8. And
I apologize, I can't remember first question.
the first question is, why does it appear that there are details from what looks like a different patient on this page? Can you scroll down a little bit? It says at the bottom of the operative notes.
It's on my assessment plan, where it says 150, 114.
Oh, right, the 114-year-old male. Did you encounter in the medical records for Mr. Poole, a different name and an age that would be pretty darn remarkable if he's like, yeah, he's getting better from a femur fracture?
Yes, this was from the alias name that they gave from the field when he was with EMS, when they didn't know who he was yet. So this doctor charted under that name.
And then the last question, in the operative notes, and it may be these, but it may be a different page. There's a question I asked you already, and this is why we're going to pull it up.
Okay.
Can we confirm that Mr. Poole, in fact, gave consent to go ahead with the procedures? Did we find that?
Yes.
Okay, if we could go to that page, is that
And page 105.
105? Okay.
It says it was explained to the patient and verbal informed consent was obtained.
Okay, thank you. Mr. Miller, do you have any questions for any additional questions for Ms. Freeman based on those?
No, Your Honor.
Mr. Abadi?
I did not know.
All right, thank you, ma'am, for your time.
Thank
You are
you.
free to go. So we are going to take our morning break. It'll be shorter because I think some of you wisely said, hey, can we use the restroom while we're waiting on you guys to go through the juror question cards? But we're going to do that now. And I'll have Deputy Griggs keep it a little shorter because we will break for lunch soon enough. During the break, I'm going to talk to the lawyers about timing. I'm trying to get a read of when we're going to be done, but that comes from them. And then I'll share that with you. During the break, don't talk about the case, no outside research. Enjoy the facilities. We'll see you in a little bit.
All rise for the jury. Jury will clear y'all.
Thank you. Mr. Abadi, anything from the state? Mr. Miller, anything from the defense?
Okay.
During the break, I need you and Ms. Bird and your investigator and anyone else to get realistic about the time estimate. It's going to take whatever it's going to take. My point isn't saying make it go faster. It's just it's 11 and we got through 0 witnesses today. This was yesterday's witness. So you need to look at your witnesses, get a sense of long, short, and then give me your good faith estimate so I can manage the jurors' expectations. They're coming back on Wednesday. Are they coming back on Thursday? Are they coming back on Friday? If it's deliberations, that's on them. But if it's on us, I do want to try to manage their expectations.
How
Okay.
long are we planning on going today?
I haven't talked with the jurors. Assume 5. I don't know how open they'll, if they know they're coming back on Wednesday, how open they'll be to staying late. So assume 5. We can try to have lunch be 45 minutes if they'll do that. But giving you an extra 15 minutes, I'm looking at this witness list and there are going to be other witnesses where it's not just your questions. It'll be the state's questions as well. And they're entitled to explore things. So I just want to get your best sense of how long it'll take. Okay?
Okay.
All right. Thank you. We'll see everyone back in 5 or 6 minutes and we will press on. All right, Ms. Rivers, you ready?
Yes.
We are back on the record in State versus Poole. Mr. Poole is in court with his lawyers. Our prosecutors are here. The jurors ready to come back in? All right, hold on one sec. Mr. Miller, anything before we bring jurors in?
No, Your Honor, and, after confirming, I do believe that probably our last witness will need to be on Wednesday.
You think you'll get through all but one,
I do,
including your client, or your client would be your last witness?
we're still discussing.
Working through that. He can always change his mind. All right, got it. Well, let's press on. Who is the next witness? Or if, as long as your investigator knows, you can call in the front of the jury. Just make sure that person's close by. You ready for the jury?
We are.
Okay, Mr. Rao?
Few things, Judge.
Uh-oh, few.
Yes. As it relates to, if the defense wishes to call Dr. Conley back to the stand, the court made a previous ruling.
Dr. Connolly, remind me,
The chiropractor.
this is someone from the first, is this Chris Connolly?
Yes.
Okay, all right.
That the court's previous ruling, as it relates to how he can testify, should still stand, that he cannot opine with a scientific degree of medical certainty that Mr. Poole, was facing cognitive issues such that he could not make verbal statements.
Oh, right, this is a chiropractor talking about what was going on in ER time.
That's correct.
Okay,
And based on your ruling, you'd indicated you could say things that there are factors to be concerned with, such
Sure.
as the GCS score, certain medications,
Mhm.
but that he could not testify to a scientific degree of medical certainty that, Mr. Poole was unable to, make the statements or be in a position to make statements or anything related to that,
okay,
in his testimony.
all right. That's one thing. You said a few.
Yes, Judge. As it relates to Mr. Swanner's testimony, based on the defense's objection, as it relates to Corporal Lee's testimony that he could not testify to injuries that could be sustained as a result of hitting certain objects within a vehicle, given that that's the majority of what Mr. Swanner's report consists of, we'd be objecting to any sort of testimony as it relates to objects that could cause injuries to an individual if Mr. Swainer testifies to strictly kinematics, that if the principal force of direction is going a certain way, that it could be consistent with hitting objects, that may be within his expertise to testify to. I guess we'll find that once that foundation is laid.
Right.
But as it relates to any injuries whatsoever, that could be consistent with the trauma that Mr. Minor's autopsy revealed, that would be impermissible testimony.
Well, one, we'll need to see what his, I guess you have his expert report. Of course, if he is a medical doctor and whatever he is, then he would be firing on both cylinders, assuming he's not, assuming that he is more like Corporal Lee, where his expertise is in accident reconstruction and maybe got kinematics in there. Then I think there ought to be some limitation. But I guess we'll need to see what the foundation is. And again, if his expertise is akin to the non-medical realm that Corporal Lee was in, then that seems like that makes sense. But I'll of course hear from Mr. Miller.
In addition to that, if given that Mr. Swainer did not implement any formulas and per his report did not review any of the airbag control module data to opine as it relates to what his expert opinion would be based on the data, that he should be precluded from testifying as such, given that the state has not been on notice as it relates to what his opinions could be based on that data, which is something that the state would be entitled to have prior to trial in order to accurately assess his testimony and cross-examination.
So I didn't follow that entirely. Give me an example of something that you foresee. Pause. How do you pronounce your witness's last name?
Swanner.
Swanner. How do you, Mr. Rao, foresee Mr. Swanner talking about airbags such that you've got a concern? That they didn't deploy, that they deployed in 2 milliseconds?
It's not that, I think it was with respect to the distance that was calculated, from the airbag control module data.
The distance that the car traveled.
Correct. If he is just simply reading the data, then that's not a concern I believe that the state has.
But if he suddenly has a chart and says, based on my calculations, the car was here and it was doing that, you're saying you never received calculations. And so you wouldn't be in a position to meaningfully examine him on them, nor would you have had the chance to share those with someone like Corporal Lee or a third-party expert to say, that's the wrong formula. We don't use that formula anymore. Or yeah, that is top-notch science.
That's correct.
That is, am I understanding your concern?
That's correct.
Okay, all right.
In addition to that, given that I saw plenty of lay witnesses outside, we are asking the court to strictly enforce the hearsay rules as it relates to what any of the two deceased individuals or any of the other individuals that would not fall within a hearsay exception to be enforced with those witnesses. Specifically, the state's concern would be any out-of-court statements made by Detarius Minor or Devin Jones that could be elicited by any of those lay witnesses unless it falls under a legitimate hearsay exception.
Okay.
We're asking the court to strictly enforce that.
Okay,
And that if any statements are to be elicited, that prior to the witness testifying to those statements, that the state be given an adequate opportunity to object.
so we're not trying to stuff something back in the bottle because the person already said, oh, that's when Detarius Minor said, I will always and forever drive your car,
That's
KP.
correct.
Okay,
To that effect.
all right. These would have been great motions to eliminate before trial for future reference, but here we are.
And I apologize, Judge, I was re-reviewing some of the testimony and realized that some of that was listed. And,
Okay, got it. More?
Just one more.
Okay.
As it relates to criminal convictions of Detarius Minor, that would be impermissible impeachment evidence under 404A and Rule 60. I can't remember the exact rule number off the top of my head right now, but it's not relevant to the purposes of this trial.
Did they come in the first trial?
No.
Okay, all right. Mr. Miller, let's work backwards. Do you intend on seeking to admit any criminal convictions of Mr. Minor?
Criminal convictions, no, but under it's never where you left it, Your Honor.
Oh. Well, how about this? Don't do it until our next break. And I'll give you a chance to find things over lunch, okay? So we'll come back to convictions or arrest history or whatever of Mr. Minor. How about the hearsay? Things that Mr. Minor said or that Mr. Jones said to, I'm making this up, I don't remember, Quentin Patrick. If Quentin Patrick was someone who was at the nightclub and he's testifying, he's like, oh yeah, and then I turned to DT. And that's when DT told me, I took the keys from KP, he can't drive.
So some of those instances, it would be present sense impression for when they like, for example, for the club, present sense impression would be the statement that Mr. Minor would have made to several of them as they were leaving.
What was it that he purportedly said?
We have to make a stop.
Okay. Is that the main one you're thinking? Is there anything that you would be trying to elicit that Mr. Jones said? Because maybe we draw some bright lines that.
Yeah, Mr. Jones, I can't think of any statements that anyone said.
Okay. Well, I'm gonna hold you to that for now. Subject to change, you may be reviewing things, but I'm expecting you not to ask questions of any witnesses. Well, what did Mr. Jones say then? You can't ensure what direction witnesses go for sure, but I think we can be expecting no one's going to be talking about what Mr. Jones said. And I'm always open to real-time objections as well, but we've managed that one. For Mr. Minor, is there anything top of mind, Mr. Miller, beyond the, well, hey, we got to make a stop, or whatever the words were? Or is that it?
Come pick me up. Hey sis, can you come pick me up? Just things that naturally keep the flow of the
Okay.
nightclub. But
So his sister is which witness?
Brandy Jones, not his biological.
That's okay. I'm not seeing that name on the witness list. There's a
Brandy
Brandy
Jefferson.
Jefferson. Okay. So Ms. Jefferson, she might be saying, and then I was at my house and the phone rang. It was my brother and he needed me to pick him up.
Right.
Okay. I'm not seeing an issue with that. That may not be the kind of thing you were concerned with. It's really not even necessarily offered for the truth of the matter asserted that he needed to be picked up. It's explaining why Ms. Jefferson then left to go. I don't think that's what you were worried about, Mr.
No,
Rao.
it's potentially any Instagram posts, because we've received a lot of social media through Discovery.
Okay.
Previous posts, and then specifically as it relates to the one more stop, under the present sense of, or argued, the defense arguing that it's present sense impression. It's not something that Mr. Minor is contemporaneously perceiving, in that particular time such that.
Right. Hey, it's cold out, that kind of thing. Okay.
So that is just being offered for the truth of the matter asserted, and you would therefore ask that those witnesses be instructed not to testify to that statement.
Well, it's just, we wouldn't ask about that, but let me think about that one. And I'll also be on guard for hearsay. But I am comfortable with some of the other examples Mr. Miller gave. I think you are too, where it's just sort of the flow of events. And that's when DT told me we need to go pick him up, that kind of thing.
Yes, sir.
I don't see that you're concerned with that. All right, Mr. Swanner, tell me about his distance calculations.
Everything Mr. Swanner is testifying to is information that was given and is already in evidence by Corporal Lee.
Okay, so he would have
All he's doing is interpreting what's already there. He didn't do his own pool.
okay, it's all based off information either before the jury already, or you might be entering something through him, but that might be something, it would be something that came from GSP.
Correct. And they've been on notice of Mr. Swanner since November of 2024. So at any point in this year, they could have talked to him about that opinion.
So it's not their job to disclose his information. It's yours.
It's in
So,
the report.
okay, as long as you're not going
That
to
was
be,
also disclosed November of 2024.
as long as you're not going to be tendering some evidence through this witness that the state doesn't already have, then I'm less concerned. And what about,
Can we stay on this Swanner for a second? Because
sure, I was going to the medical part, but if you want to,
that's it.
okay,
Entire report, it's not about anything other than the medical part, where he literally, his main conclusion is Minor sustained major injuries from striking the center console and steering wheel of the Infinity during the crash that resulted in his death from his injuries. Mr. Poole sustained facial exposure to oil during that crash, and only oil, in the SCRT photo during the left rear seat of the Infinity. That was fine. But the thing about the specific injuries and the specific things that caused those injuries, he wouldn't have the expertise to testify to those exact conclusions.
That's all a part.
hold on. I'm going to come to you. What about Mr. Swanner saying the injuries that Mr. Minor sustained are consistent with having been in the driver's seat?
Well, unless he's qualified to say that, in the sense that that was the exact objection that was made or about Corporal Lee, and from my understanding from reading the report, that what we were disclosed, that's all
That's the medical piece, that the injury is consistent, as opposed to if you were in the driver's compartment in this kind of collision, these are the surfaces you would hit. And your objection, or who's handling Swanner? It's okay, right now we're having a group discussion, but if Mr. Rao is gonna be objecting to something, it would be, not if one were in the driver's compartment, based on what I've learned about this collision, you'd expect to see contact here, and so injuries consistent with that, but not, I'm telling you, I know about Mr. Minor's injuries because I'm a doctor, and I can tell you that those injuries fit what it would look like if you hit a door or you hit a center console. It's that second piece that I'm understanding the state is concerned about.
Yes.
Okay. Mr. Miller, how do you get to that step two? If step one is Mr. Swanner saying, based on my expertise, if you're sitting in the driver's seat and this is the way the collision worked, here's where body parts might strike different parts of the car, or if there's a loose object in the car, where it would strike a body part. That seems like that is within the scope of his expertise.
It is, Your Honor, and it goes towards his training and experience. It's the kinematic piece that Corporal Lee was also talking about. And so his interpretation of those kinematics would naturally flow. This body part would hit this part would hit this in the car as.
Okay, so if someone is sitting here, then they might hit the stick shift with this part of their body.
Correct.
Okay. I think that works. Haven't heard his qualifications yet. My question, and it sounds like the state's concern, is then Mr. Swanner saying, and now let's look at these pictures of Mr. Minor, and that's the steering wheel, that's the gear shift, and that's the passenger door causing these different things. You could argue that to the jury. How does Swanner have the expertise to say those injuries are consistent with X? He's not a medical anything.
But it would go towards the pattern of injury for the collision. And again, referring back to the kinematics. So if he's able to say, or when he says bodies would have flown this way, like they've been saying,
Yep.
forward and to the right.
Right.
Then where's the injury pattern? What lines up to show evidence that this is what that body did and how that injury could have been caused?
Okay.
It's consistent with the body going this way.
Those are all valid questions. You haven't linked that to a specific body. You are saying if a body were here, this, that, whatever. My question is, how would Swanner be in a position to say, now I'm going to take Minor and put him in the driver's seat and tell you that injury is consistent and that injury. Every time you say the word injury, he's saying the word injury as to Minor. That's a medical opinion. That injury is consistent with X. Unless he's going to tell us as an expert, I've actually done a lot of operations on medical treatment of autopsies of bodies that hit things. How is he going to be able to say that this bruise here is consistent with hitting X?
That will go towards his training and experience and the thousands of calls that he's had and the experience that he's had with these accidents and reconstructing them back, and then referring to those medical records that are in those collisions and how, again, the body parts line up with the injury as it pertains to kinematics.
Okay. I'll need to hear what his qualifications are, Mr. Rao. I think I understand, and Mr. Abadi, your concern. It strikes me as it ought to be pretty parallel to Corporal Lee. I appreciate that Mr. Swanner may have greater training in kinematics, but kinematics is not in the medical profession at all. As Mr. Miller, of all people, established with Dr. Henniger, who said, no, we don't get kinematics training as a doctor. So that's a TBD. Finally, Dr. Connolly, do you want to get on the record your objection to the rule? I'm going to maintain my ruling from before, that he's not in a position to say, let me tell you how Mr. Poole would have been, because of course he wasn't there and he didn't treat Mr. Poole. He's talking about if you've got a, I'm making this up, if you've got a Glasgow of 13, you've got oil burns and you've got fentanyl in your system, then you're really not in a good shape to have a conversation with the state trooper.
So the way that I was planning on presenting it was the way that we had already spoke for, I don't remember which witness it was, but I thought as a whole, we all agreed that we were using the word consistent.
Mhm.
That was the way I planned on presenting.
Okay. Let's try it that way. And then Mr. Rao can object if he thinks that's going too far and we'll manage it. I just plan on ruling as consistently as I can with last time so that Dr. Connolly isn't doing anything different than he did before.
Gotcha. And I
Okay.
found my case law.
Your case law, remind me now, what was that about?
With, regarding.
Oh, the minor and his convictions or his criminal history. What's that?
Defense, unlike the prosecution or the state, does not have to present any documents or does not have to give any notice that we're going to be giving Mr. Minor's history or criminal history out. In fact, several cases point to the defense being in a different position as the state in that reverse 404B allows the defense to present a motive if the, and it's narrowly tailored so that if the only defense, as in this case, is it was not me, it was him, then we're able to present evidence that shows it was not me, it was him, and this is why he had the motive to do what he did.
Okay, I think I get it, that he's a felon or whatever his situation might be. There's a gun in the car. And so by golly, he doesn't want to pull over.
Correct.
Okay,
And so cases, Guest v. State, 264 GA 335. Basically in Guest v. State, Supreme Court rules that in order for the defense to present evidence that the defendant committed another crime, it must be direct evidence that that person had the ability to commit that crime, the opportunity to, and it must be direct evidence.
what is Mr. Minor's criminal history?
He has a felony. He was on probation for robbery, theft by taking, and possession of a handgun,
Is that all one case?
all in one case.
Okay, at the time of the crash, he was on probation out of Tennessee for robbery, theft by taking, and whatever the other charge was.
Correct.
Okay, and that's the only piece of criminal history that you would seek to elicit.
Correct.
And who claims to know that?
Eric Harrington was aware that he was on probation as
Okay,
well as.
so let's just assume that's your witness. I know there may be more. A lot of people are like, oh yeah, buddy's on probation. How is he remembers now that he was on probation for robbery, theft by taking, and carrying a concealed weapon? What's his, how does he know these things as opposed to, yeah, I think he was on probation?
Oh, that's his friend.
Okay, I get it. But you're not answering my question. And so you're telling me that Eric Harrington knew the specifics of why he was on probation,
That's
each
correct.
count.
He knew that he was on probation. I don't know if I can proffer that he knew each count or whatever. And it
Okay,
might be Jerome. He's a lay witness.
okay, I get, that's my point, is that, so you're not, it's one thing for Harrington to say, yeah, DT was on probation. But then if you don't have a good faith basis to ask him, and was he on probation for robbery, theft by taking, et cetera, and he says, I don't know, then you shouldn't have asked that question.
That's fine.
And so that's what I'm exploring is to me, it's credible that Harrington would know his friend's on probation. But having dealt with lots of probationers, they don't always tell their friends specifically, this is what I did, because actually I robbed your friend. So I'm not gonna talk to you about what I'm on. I'm on probation. So I gotta be careful with what I'm doing.
Right.
Okay. But that's it. It's in effect, you would be eliciting testimony that minor was on probation. And maybe they've got some details and maybe you go there. But you're not entering a certified copy of a conviction. It's just people who knew him well knew he was on probation at the time.
That's correct.
Anything about Jones's criminal history?
No,
Okay, if he had one, I'm not saying he did.
I'm not. I didn't.
You're not going there regardless.
Yes, I found some stuff, but it's not relevant.
Okay, so it's minor being on probation is the thrust of what you want to get into.
Correct.
Okay, Did you have another case besides Guess?
Sure. Henderson v. State is the case that most rely on. It is 255 GA 687.
Okay,
And then
I'll read it. You don't, I will look at that. Mr. Rao, we don't need to sort the, Eric Harrington's not your next witness, is it?
No, I got a third case too, Your Honor.
Okay. I'll take
Roberts
it.
v. State 305 GA 257.
All right, thank you.
And that just basically evidence must raise a reasonable reference that someone other than a defendant committed the crime, which that does. And in Henderson, it is reversible error for motive not to be admitted by the defense, especially if the sole argument for the defense is that someone other than the defense committed it.
Okay. It's a little attenuated for you because the motive only makes sense if Mr. Minor is driving. And the cases you're talking about are typically more someone got shot or this or that. And well, who had the motive to shoot this person? And the great debate here isn't who had the motive to drive the car. It's who was driving the car. If you get Mr. Minor in the seat, I mean, if anything, Minor has an motive not to drive the car if he is a probationer, because then if there's a gun in the car or anything else, it's less likely to be his. It's attributed to the operator of the car or the owner of the car. So in some ways, this is a motive to not get behind the wheel and not take the keys. But if you get him in the seat, it certainly is a motive to not want to get pulled over.
Correct. That's what I would argue, is that it's more of a motive of not to get caught
Yep.
in Jordan.
Okay. All right. Mr. Rao, you don't need to get me a case now, but I invite you to send a case or two. You can just shoot an email unless you've got a case citation now, but you've got time. Okay. So I think we covered all of them, and I will circle back on the situation with Mr. Minor. Anything else from the state on that posted? That's it. Okay. Let's bring the jury in.
Oh, I do have a fourth case.
Okay.
Ori v. State 280 GA 588. And again, Your Honor, all of these follow Henderson.
Okay.
All right, for the jurors. Jurors all present.
Thank you, Deputy. Everyone else should be seated. So we had a few legal things we needed to work through, so the next few witnesses can flow more smoothly. I needed to give the lawyers some guidance about what can be explored and what can't. That just required some discussions. So your break was longer than I had hoped. We'll probably break for lunch more like 12:30, so we get some time under our belt before you're breaking again. But some of that will depend on how the witnesses flow and where we are with examinations. Mr. Miller, if you call your next witness, please.
Defense would call Dr. Chris Conley.
Raise your hand. Do you swear and affirm that the testimony you about to give be the truth, the whole truth, and nothing but the truth?
I do.
Have a seat. And if you will, can you state and spell your name for the court?
Chris Conley, CHRISCONNELLY.
Dr. Conley, where do you work?
I practice in Stone Mountain, Georgia.
And what type of practice do you have?
I have a chiropractic practice, also do impairment ratings, disability exams, VA determinations for injury causation. But I see a wide variety of patients from people that just have cricks in their neck to people that have serious injuries that need impairment ratings or disability determinations.
And are you licensed to practice chiropractic?
Yes, I've been licensed to practice for 27 years.
All right, was that since 1998?
Yes.
What are some of the duties, responsibilities that you do at Village Chiropractic?
Sure. So we evaluate patients. We sit down and determine what's the diagnosis. I always like to say a good diagnosis is the first step to a great treatment. We have a couple medical groups that come into our practice as well to see patients because we integrate with medical, and our philosophy is working together to get patients better, but it all starts with a diagnosis. We then focus on what are the treatment plans to help patients. Most of the time it's lifestyle medicine, so nutrition, exercise, different things to help the body function better.
Okay, where'd you attend school?
I went to first of all, I went to, of course, high school, then undergraduate school, Radford University. I have a degree in biology and chemistry. Then I went to Life University and I have a graduated summa cum laude with chiropractic. There I also taught anatomy and dissection for 2 years as a lab assistant.
All right, your undergrad, you're summa cum laude at Life. How'd you graduate at Radford?
Cum laude.
Do you have any certifications?
Sure. So over my 27 years, we have high school, college, then graduate school. So after graduate school, there's other certifications I applied for and I retained for certification. One of the first ones was as an independent medical examiner. So basically, whether you're a doctor of chiropractic, a doctor of osteopathy, or a medical doctor, it's the same certifications and training. But basically, that was in 2005 where I went to obtain certification on impairment ratings, disability exams, how to quantify, serious injuries and how to determine the loss. I received that certification in 2005. That was the same classes and certifications as medical doctors would take. I then received postgraduate training in multiple other areas, but as a certified brain injury specialist from the Brain Injury Association of America. Again, that is a brain injury association that certifies chiropractors, medical doctors, nurse practitioners, PAs. So again, you have your graduate program, and then that qualifies you to be able to sit for the boards. You take a test. The test is about 4 or 5 hours, and then you have to maintain certain certifications. So for the CBIS, brain injury specialist, I have to receive training every year. In fact, I just certified last month. And so there's certain things you have to do to get certification. Another one is a certified impairment rater by the International Academy of Independent Medical Examiners. And that one, I just got my recertification. So that one lasts until 2028.
And what is board certification?
Sure. Again, there's certain qualifications you have to meet, sort of like, college, grad school. And then basically, if you have your certain qualifications for graduate school, then you could then apply for postgraduate certification. So it's like a board certification that you have to take. There's also certain minimum requirements you have to meet. So like testing, like for the impairment rating, I had to take a retest. For the CBIS, I have certain qualifications as well.
Approximately how many patients have you treated with trauma in your 27 years?
Yeah, thousands of patients. I would say over 20,000 motor vehicle collisions, over 300,000 patient visits. So I've been nonstop practice for 5 to 6 days a week for the last 27 years.
All right, and what is a peer reviewer?
So in the state of Georgia, we have something accepted by the Board of Examiners, like our licensing board. And I'm one of 15 providers in the state that's accepted by the board to determine what's in the scope of practice. What is causation, billing, coding, medical necessity. So oftentimes I'm called to testify or to give opinion such as, hey, is this usual? Is this reasonable? Maybe re-review MRIs and go and also say, is the billing and coding usual and customary? So I've done that on thousands of occasions. In fact, even testified live at trial to determine, okay, what is usual, reasonable, and customary. Sometimes that's also involved in malpractice cases, which I've been involved with as well.
All right, are you,
Can you just slow down just a
Oh,
little
yes, I'm
bit
sorry.
or speak up?
Actually, both.
Okay.
A little slower, a little louder. Thank you.
all right,
Sorry.
you discussed the American Board of Independent Medical Examiners. Are you also a part of the American Academy of Pain Management?
That was a certification I received in, I'm going to try and talk a little bit slower. Let's see. That was in 2006. So yes, so the American Academy of Pain Management, which deals with chronic pain. So sometimes it could be things like what we do, like chiropractic or physical therapy. Sometimes it's ingrained with patients that may need medications, sometimes injections, radiofrequency neurotomy, where they actually cut the nerves to certain areas, or sometimes even surgery. So pain management has a wide spectrum, but I was certified by that organization in 2006.
All right, does that also include education and training on opioids?
Yes, in fact, I was appointed and served as in the Attorney General's anti-opioid task force, and that was for approximately 2 years.
All right, your certification for Brain Injury Association, do you maintain that certification?
Yes, I just restarted certified last month.
All right, specifically what's needed to maintain that certification?
Well, first you have to meet the basic requirements. So they only offer to people who have advanced degrees such as chiropractors, medical doctors, PAs, people that deal with patients with brain injury. And then you have to sit on a board examination and you take a board exam. And I believe the exam is about 4 or 5 hours. After you pass that, you have to have a certain amount that either you teach, you write papers, or you attend seminars. So tomorrow, Saturday, I'm teaching a 2-hour seminar on brain injury, on mild traumatic brain injury, that's the most common type. So there's certain qualifications you have to meet. And like I said, it's either attend seminars, teach seminars, read papers, write papers, and it's approximately 10 hours a year to maintain that certification.
All right, you also have a certification in motor vehicle trauma?
I do. So that's post-traumatic stress. So that is, again, one of those postgraduate training. You have to meet certain requirements, but, dealing with patients with motor vehicle collisions, sometimes they're anxious. Sometimes, the tissue damage isn't there, but it's stressful. And so being compassionate and helping them through, bless you, helping them, and I'm going to talk slower, I'm sorry, helping them through difficult times because, again, it is stressful. So that is different coping mechanisms to help patients get through some stressful situations.
All right, with regards to concussions, what type of training, education, experience do you have with concussions?
Sure. Well, the CBIS also as a sports injury chiropractor, that was part of the training for concussions. Complete concussion management is a course out of Canada, and they teach providers on hockey concussions and sports concussions. And, through the NFL and through other things, people have concussions. What do you do? So many times it's reassure them they're okay, give them hope, but then say, okay, these are things we do to help the brain function better. So there's really no medications, there's no injections, there's nothing for brain injury, but helping them to have their brain function better through stress relief, meditation, lifestyle, avoiding sugar, carbs, dairy, exercise, different things that help the brain function better is nice because of the fact it empowers the patient to take control of their health. So that was the complete concussion management course. Also through the VA, because I do also do VA evaluations for disability. So they'll come in either with nexus letters, which is injury causation related to military service. And then we do DBQs, which are the impairment ratings for the military to determine if they qualify for service-related impairment or disability.
All right, Dr. Conley, can you tell the jury about Brain Scope 1?
Sure. Brain Scope 1, I believe it was around 2018. So I was researching because, brain injury is complicated. The brain is complicated and brain injury is even more complicated. So back in 2018, I was searching around to say, okay, what are some of the tests? Because most of the time MRI is normal, x-rays are normal, CTs are normal. So brain injury is complicated and there is a problem with being able to detect it. So I found a company called BrainScope One, and they've been used in the military for about 15 years. And when I researched them, they actually were being used by Grady. So Grady was using them to help assess patients with concussion because it is a functional test to see how the brain's functioning, but also to detect small amount of blood in the brain. So a CT scan will typically miss about 5 millimeters of blood. So if it's a large bleed, a CT scan will pick it up, but less than 5 millimeters of blood, then the CT scan won't pick it up. So BrainScope One was being used by Grady at the time, and I said, "Wow, that seems like a great tool." So the good thing, the representative was here. I wound up purchasing a machine, using it for many years. I also was certified by BrainScope One on assessing for patients who have concussions.
All right. Are you certified by the CDC for anything?
I received postgraduate training by the CDC because, with high school athletes, particularly even middle school, brain injury is very common but missed. One of the biggest factors, I educate local high schools, coaches. I've taught seminars for some of the coaching staff is avoiding a repeat concussion. So after a concussion, putting them on the sideline and saying, okay, let's don't play, let's help your brain get better is an important thing because after a mild traumatic brain injury, if you have a next brain injury or a second brain injury, that's going to cause worsening of the brain symptoms. So that was for the CDC. It's called Heads Up.
All right. Could you tell the jury about brain concussion?
Sure. So over the years, dealing with patients with brain injury, I found that there was a need for awareness. Also, there was a need for neuropsychologists that help patients with brain injury. So I started a company called Brain Cushion, and we provide TBI telehealth care in over 40 states. And through that, we've seen thousands of patients and helping the neuropsychologists help patients, again, naturally get better from brain injuries. That's gone into more of a brain injury awareness company to educating the public, patients, providers on what to do after a brain injury. Because most of the time it's like, okay, you have a brain injury, now what? There's no drugs, there's no surgery. And there's a lot of education for patients and providers to say, okay, let's get them on a good diet, anti-inflammatory diet. Let's get them exercising. Because after a brain injury, the blood flow to the brain could reduce by about 50%. So helping the brain function better through exercise is important too. So, Brain Cushion was a company that I started approximately 2021.
All right. Speaking generally, what is a mechanism of injury?
That's a causal event. So something that you would determine as a cause of a particular diagnosis. Impairment rating, part of the impairment process is injury causation, and that is part of my certification is injury causation through impairment rating process.
All right. Have you taught any seminars regarding mechanism of injury, patient care, injury diagnosis?
Yes, I've taught hundreds of seminars for lots of different audience, whether it be providers, attorneys. I spoke last month at the National Insurance Commission seminar. We're basically talking about healthcare and getting patients with brain injury proper healthcare, because this year brain injury was classified as a chronic disease by Medicare. So it is something where there's an awareness that mental health and brain injury are very common, but often not properly addressed, and then later on lead to problems such as dementia, Alzheimer's, and things of that matter.
All right. Have you written any books, been published?
I did. Like I said, I've been practiced 27 years. So I've written books, one particular that I give patients to talking about what to do after a wreck with self-care and hope, because a lot of times stress leads to avoidance. Avoidance leads to more problems. So getting them back moving, exercising, nutrition, and having a spin of positivity on it. I also wrote a paper that was published in the American Journal of Pain Management discussing neck injuries after motor vehicle collisions, and that's a peer-reviewed journal.
All right. And for attorneys, we have CLEs that we have to take every year. Is there something in your field that you all have to do every year in order to maintain your license?
Yes, sir. So we maintain about 20 hours a year in CE. I actually was certified to teach attorneys 2 hours for CLE. But this weekend, I'm teaching a seminar for 2 hours for providers on their credit.
All right, now have you testified as an expert in trial before?
Yes,
As both a treating and a non-treating doctor?
yes.
About how many times?
Over 50 times with trial and depositions, yes.
What subjects have you testified as an expert in court for?
For malpractice, for injury causation, for determining causation of certain injuries. Sometimes it gets very complicated with injuries. Sometimes there's multiple impacts. And so I've been brought into, okay, what's from what impact? Sometimes it does get very difficult. Also reviewing MRIs to say, okay, what's the actual tissue damage? And that's one of the most important things for an impairment rating is to say, what's the actual loss or what's the tissue damage?
All right, at this time, Your Honor, the defense would move to tender Dr. Conley as an expert in traumatic brain injury as well as injury causation.
So the first I get, the second, injury causation is broad. What kind of injury causation?
Motor vehicle injury causation.
As in what the door does to your arm, or I'm not.
As in injuries that could be attributed to being in a motor vehicle collision.
Do you want to examine Dr. Connolly on his, as a treating ER physician? That's not what you do.
No, not at all.
Okay. Are you comfortable being classified as an expert in injury causation? The traumatic brain injury seems so much down your alley, but this injury causation, listening to the important work you do, seems a little bit afield.
Well, I think I could explain a case I testified in recently. So basically, they had a acute herniated disc. It was massive, a ruptured disc. And then there was a 10-mile-an-hour collision, 20-mile-an-hour collision. I talked about the mechanics that caused the disc herniation in a high-speed collision versus a low-impact collision.
Okay, so generically, if you are going 10 miles an hour, you wouldn't see a herniated disc like this. If you were going 100 miles an hour, you might.
Yes, so
Okay.
general.
That general injury causation. Okay. So what I want to hear from the state.
I'm gonna, on the ground, this is outside the scope of what we were noticed on as it relates to the field and the testimony of these witnesses.
Okay, what I'm going to do is qualify you, Dr. Connolly, for purposes of your testimony today as an expert in the field of traumatic brain injury. You have established extensive medical credentials, and so there may be questions that Mr. Miller asks you that aren't just about traumatic brain injury. I'm not going to find those to be immediately objectionable because of your training background and experience, which are different from the rest of ours. But I'm also open to objections that we're getting into an area where Dr. Connolly is being asked to offer an opinion that's outside the main scope of his expertise. I just think it depends how it plays out. The doctor's example of the herniated disc and a 10-mile-per-hour crash versus a 20-mile-per-hour crash doesn't strike me as objectionable, but I'm not one of the advocates. But if we are getting more specific, we may be getting into an area where I sustain an objection like that.
I understand the court's ruling. I guess my only response is, I don't generally disagree with the sentiment of what you said, that the notice in which he was noticed to the state was that his testimony would be specifically about TBIs.
Okay.
And its relation to injury and causation, nothing more or less than that.
Well, but that last part you said, I just heard you say injury and causation. You're saying the traumatic brain injury causation? Okay. Then what's your response, Mr. Miller, in terms of what you noticed, which certainly limits what you can do now in terms of the scope of the expert qualification you're seeking? And is that in the docket? I'd love to look at it as well. It doesn't need to be in the docket.
It should be in the docket. I was trying to find it myself.
Okay, that'd be great. I don't want you posted notes on the back, so it's void.
That's the report. That's not the notice.
Is that the report or the notice?
I got a report and then I got his CD.
Okay, well, but you were saying you were noticed. Is there also a notice?
I misuse of words. It was the notice to me with the summary of his opinion.
Okay. Is there a separate notice?
Yeah, it was on the witnesses. That's what I was saying. I don't have it readily available, but I'm sure that both of those were placed on that.
Well, if you get it, we'll talk about it. But for now, I'm qualifying Dr. Connolly as an expert in traumatic brain injury. And you could proceed with your direct examination.
All right, Dr. Conley, you're here with us now, which means you're not with your patients at Village Chiropractor. Are you charging us to be here in court?
Yes, for time away from patients.
All right, and how much is that?
Typically, we reimburse about $450 every hour that I see patients.
All right, have you been paid prior to your testimony for reviewing this case?
Yes,
And about how much have you been paid so far for your testimony in this case?
about $2,500.
And what was that previous payment based upon?
Basically, the time to review the file, the time to go over records, review things. So the time spent detailing into the records.
All right, now has that compensation you received from our office, has it in any way influenced your testimony here today?
No, not at all.
Have you been called as an expert? I know this is criminal. Have you been called as an expert in civil cases?
Yes.
And is there one side well, have you been called as an expert on both sides?
Yeah, so I've been for defense, I've been for plaintiff. It's always like, you're an umpire, you call it like you see it. So sometimes, you review a file and someone's claiming a certain injury and you look on the MRI and you say, look, there's no disc herniation, even though they say there's a disc herniation. And then, so I'm called in sometimes to do overreading or to say what's reasonable for a certain type of an injury or event.
All right, and your work as an independent medical examiner, what all does that entail?
Sure. So the process for impairment rating or independent medical examination is you go through what is the history, and that's usually done by the record. So you look at the records to see what's in the notes. You then help to determine, is it usual, reasonable, is it causally related to a said event? And then you determine, okay, based on the AMA guides, or in the case of a VA, there's certain criteria you determine for a VA to determine disability benefits. So, you look at the history, usually reviewing records. You then often talk with the patient. Then you say, is that reasonable for a certain event? So like military service, is it documented in military service that injury was in the military? And is it reasonable that it would cause long-term problems? And then you use the AMA guides. It comes up with a chart to say what the percentage loss is or what the long-term implications are.
Now, as an independent medical examiner, that does not mean that you're actually examining the patient. Is that correct?
Sometimes it does, sometimes it doesn't. So sometimes patients will come in and they say, hey, we want, or the requesting provider or requesting person can say, hey, do an exam and figure out what's wrong with them. Other times it's like, it's pretty clear. There's a lot of diagnosis. We need some clarity. And as an IME provider, it's almost like you're a weekend or a Monday morning quarterback or Monday morning coach. You get to look at the whole file and get a consensus on what's the diagnosis and is it usual and reasonable for a said trauma.
All right. Is this common practice?
Yes, not only is it something that I do, for people requesting, but also with patients as well. It's part of the process to determine, hey, is this serious? Does it need to go straight to the surgeon? I've had patients with broken bones or things like that I send to the orthopedic, or is it something that should respond conservatively? So this is part of my daily practice as far as evaluating patients, but also sometimes as an expert.
All right. Are there times where an independent medical examiner will find things in the record that the treating physician may have missed?
Yes, treating providers, their main focus is treating. And as a treating provider, I understand that. Sometimes someone from the outside may look at records a little bit differently because they may have a more comprehensive approach because they could see maybe records from multiple providers. But the treating provider, their number one concern is to treat the patient and document things. As an independent medical examiner, you look at the whole picture. You're not necessarily treating.
All right. Now, you stated before TBI. Can you tell the jury what does TBI stand for?
So it's a broad definition called traumatic brain injury. And there's many aspects of brain injury. So many times we think of a bleed. So you could have a tear in the brain and that's a bleed, but that only responds, it's only maybe 10% of people have bleeds, which is great because that could be life-threatening. You could have second impact syndrome. You could have penetrating injuries. You could have lots of things that occur within the brain because it is very complicated. For a majority of patients, about 85%, they're called concussions or mild traumatic brain injuries. That's an electrical storm that occurs in the brain. It's almost like a jolt. And so those are all things that long term, especially with repeat trauma, can cause problems. So it's important to create awareness about concussions and mild traumatic brain injury.
All right, is there a time frame after an event has happened where you're still able to diagnose or diagnose that someone has a traumatic brain injury?
So it really depends on the records. So it's really important to have as close as possible to the trauma, the records. So there's been times where I've been an expert or help with a patient and basically sat in there and the records clearly identified traumatic brain injury, but yet they didn't have the technical diagnosis sometimes until years down the road. So basically those symptoms at the beginning are very important to help say, is this consistent with a brain injury? Is the trauma consistent with a brain injury? But it's a clinical diagnosis. We like to think of it like a broken bone, but a broken brain is different. It's more of a functional problem. Just like Alzheimer's, dementia, mental health issues, brain injury is complicated. And so there's many different symptoms, there's many different qualifications. So this weekend I'm teaching a seminar. The Academy of Rehabilitative Medicine took 6 years to put together new guidelines. And so those guidelines, I have a handout here with it, but basically they go over the different qualifications to diagnose someone with mild traumatic brain injury or concussion. So it's important to create awareness. What are the symptoms and then get proper diagnosis and treatment.
All right, specifically this case, when did you get involved in this case?
I believe it was 2024.
All right, you remember the month?
I think April.
And what all did you review before coming to testify here today?
Perfect. There were Grady records, I believe, about, I think, 2,200 pages of records.
We've got them here if you need them.
And your findings in this case, are they consistent with a medical degree of certainty?
Yes.
And did you actually evaluate my client, Mr. Poole?
Yes, we had a consultation, I believe it was April 24th, 24.
All right, did you produce a report
I did.
showing you what's been pre-marked as defense exhibit 7? Do you recognize defense exhibit 7?
Yes, that's the report I produced.
All right, has it been changed, altered in any way?
No.
At this time, defense will move to enter defense exhibit 7 into evidence
Mr. Body, your witness?
with the understanding that it will not go back to the jury.
Any objection to admitting it so that it is at a minimum part of the record?
At minimum, part of the record, there are parts that as it relates to the prior ruling, reason why it would not be displayed on the screen or any of that.
Okay, I will make it part of the record. Let's not publish it, but it certainly can be used to refresh. Didn't need to be admitted to do this, but it could be used to refresh Dr. Connolly's recollection, and it'll be part of the ultimate record of the case.
Dr. Conley, what were your findings when you evaluated this case back in April of 2024?
So again, this is a retrospective review. And then, when you look down the road, we sit down and we talk, okay, what's the most logical conclusion? And so in reviewing the records, there's areas in the records that the Glasgow Coma Scale was 11. So by automatic definition, that is a moderate brain injury. So that's the standard that's been used for many, many years. There are some updated standards. In fact, this year they published guidelines that are going to do away with mild, moderate, and severe. They're just going to call it brain injury. But technically, this is considered a moderate brain injury, and that he didn't get any follow-up care. So we have the Glasgow Coma Scale. It'd be great to have, it's called the Glasgow Coma Extended Scale. So that's something typically you do like every 6 weeks afterwards, or maybe every couple months or years to help say, okay, we have the initial Glasgow Coma Scale, which is just, the Glasgow Coma is just one aspect of brain injury, But the Glasgow coma is basically like it says, a coma, or it's an area of consciousness. So it determines, is someone conscious or not? And so, yes, that's an important thing for brain injury, but that's not an absolute. So that he didn't get any care, any follow-up care. It would be great if he did, but he didn't. And that, especially with all the other injuries that he had, based on the AMA guides for all the injuries, including the broken bones and things, it would have been a 12% whole person impairment rating. Again, the impairment's not necessarily as important for this. Another thing I found is that the medications that he was on, the opioids, would also affect his conscious level as well.
Now, a person that is involved in well, let's do it this way. Are you aware of the effects that adrenaline or shock would have on a Glasgow coma score?
Yeah, so adrenaline is like a survival mode, and it is something that's very common to see after trauma. And basically, it's a heightened awareness, a automatic blocking of pain, and the adrenaline is a fight or flight type thing. So the adrenaline would block someone's initial consciousness because of the fact it's a survival mode. So sometimes patients have a heightened aware of consciousness because of the adrenaline, and that may affect the Glasgow coma score. Remember, the Glasgow coma score is the level of consciousness.
All right. Did you find Mr. Poole to have suffered from a concussion?
Yes, based on the definitions of persistent post-concussive symptoms, particularly the post-traumatic amnesia that he described, that is consistent with someone that would have had a brain injury.
And you said the amnesia. Is that something that was disclosed to you when you evaluated Mr. Poole back in 2024?
Yes, and studies show that post-traumatic amnesia, whether it be before the collision or after the collision, are some of the most telltale signs of concussions. And so even with athletes and sports players, when you have a concussion, sometimes they don't remember the game. And so, but brain injury, post-traumatic amnesia is one of the worst prognoses for someone with brain injury.
All right. What is the typical recovery time for a person with a concussion?
Sure. So it's called the symptom recovery, which sometimes the symptoms get better very quickly. Sometimes they linger on. Most of the time it's within about 1 month, 3 months. After 3 months, it's no longer called a traumatic brain injury. It's called a persistent post-concussive symptoms. So those are continued symptoms as a result of the brain injury. It's important, and I'm not going to get too deep into this, but you have a primary injury, the primary effect on the brain, and then the secondary effects. So one example is maybe mitochondrial dysfunction or blood flow. And those are all things that when those functional changes occur in the brain, then you start seeing like dementia, Alzheimer's, mental health issues, sleeping problems, a whole basket of different symptoms. But you have the primary injury. After 3 months, it would be considered going into the secondary stage of injury, which is the neurodegenerative stage.
All right. And what is acute brain injury?
That's something usually within the first 4 weeks.
All right. In your review of the medical records, well, how long does it take to recover from an acute brain injury, typically?
Everyone's a little bit different. I've seen some people with some patients that have very mild symptoms and they have long-lasting problems. I've seen other people with horrific symptoms. I did one review recently. It was a Glasgow coma scale of 3, which is very, very significant. And they have very mild symptoms at this stage. So it is something where the initial injury is not necessarily a good predictor of the long-term outcome, unless there's hematomas, unless there's internal bleeding, unless there's penetrating injuries. But on average, most people recover within about 4 weeks.
All right. And from your review of the records, how long was Mr. Poole at Grady?
I believe it was about 3 or 4 weeks, I believe. 17 days, I think.
17 days. Would his time at Grady, from your review of the medical records, would it be consistent with someone with an acute brain injury during that entire stay?
It would. In fact, on release, some of the notes say monitor and follow up for mild traumatic brain injury and PTSD.
All right. Were there any neuro or cognitive tests done on Mr. Poole to show how his brain was functioning while he was at Grady?
No deep severe like neurocognitive assessment. Basically, they went over the basic functions such as, do they have feeling in their hands? Are they conscious? Things like that. So there was nothing that was really extensive or deep that you'd expect. Like I said initially, the Glasgow Coma Extended Scale would nice to do about 4 weeks afterwards.
All right. Mr. Poole, of course, was in pain, according to the medical records, but was given opioids, specifically some ketamine, oxycodone, and fentanyl upon immediately getting to the hospital. Can you tell the jury about some of the effects of these opioids, those specific drugs?
Sure. So particularly fentanyl, it's of course a problem in our society now, but on this level, it's used appropriately. That's what it's for, is to be a very powerful pain reliever. It is 100 times more potent than morphine. It's 50 times more potent than heroin. So it is very, very powerful and quick acting. Like I said, I think Grady did an amazing job, and this is the purpose of fentanyl, is to help patients with severe pain. Ketamine also is something that helps to sort of help patients disconnect from the stress, the anxiety, the pain. So basically, ketamine is something also used to help patients with these type of severe traumatic injuries.
Would you trust someone under the influence of opioids or ketamine, any of those, to drive a car?
No, I think it would be against the law as well.
Would you trust that person to sign a will?
No.
In addition to the pain relieving properties in those drugs, do they also have psychedelic functions?
Particularly the ketamine does, yes, like hallucinating and things of that nature.
What other medications did you see in your review of his Grady records that Mr. Poole was administered of significance that you can tell the jury?
Well, I believe those were the most important. He did also get tramadol and cyclobenzaprine later on, Flexerol. And those are all things, again, the initial very severe traumatic injuries, the more extensive medications would be. Then later on, they would try and weed them off and do things like Flexerol or things of that nature.
All right. In the medical records, there was a note about mumbling by Mr. Poole. Is that consistent with someone who has a brain injury?
And with the medications, I mean, those are all things that they complicate. We like to compartmentalize things, but in reality, it's one whole patient. So the combination of the head injury as well as the medications could have caused lucent consciousness. So at one state, it could be maybe opening the eyes. The next state, it could be like maybe asleep, and that could also explain some of the variations in the Glasgow Coma Scale as well.
All right. In your review of his Grady medical records, did you see any evidence or indication that his family members were at the hospital?
I believe they came to the hospital, and I think that next day they took some maybe a driver's license or some of the belongings.
In your review of the hospital records, did you see any hospital records of law enforcement going to the hospital?
I believe it was around the 17th. I believe that there was some indication of that.
All right, the 17th of April?
Yes.
Okay, and along with that visit of law enforcement on the 17th of April, what do the records indicate Mr. Poole's response was?
I believe there was an increase in blood pressure and, more of like stirring or more of awareness or alertness.
Did you also see an indication in those medical records that he became emotional on April 17th after that visit?
Yes.
With regards to the 20,000 plus patients that you've seen in car accidents, are you able to tell the jury what type of injuries you typically treat from collisions?
Well, fortunately, most patients we see get better. A lot of patients get better, which is great. And that's our job, to help them get better. We typically will see a wide variety of patients. Some it is horrific injuries, and some it's minor injuries. So it's a wide variety of things. We also see people with falls, work injuries, lots of different things.
Okay, now with regards to the 20,000 plus patients that you've seen, and a lot of which have been involved in car accidents, are you told or are you made aware of their positionings in cars?
That's not really something that we focus on as the position in the car. We basically focus on what are the injuries and, what do we do to get them better?
Are you able to tell this jury what injuries are typical for someone sitting in the front seat of a car?
I'm gonna object. I think you look at the notice. I found it, the notice on April 23rd for traumatic brain injury
Okay, can I see the notice, please? Or is it in the docket?
in the document.
Okay, I will look at it, and you should ask a different question for now, and we'll come back to that.
In your review of the records, were there fluctuations in the Glasgow Coma scale, while Mr. Poole was at the hospital?
Yes.
What is that indicative of?
Well, the Glasgow Coma Scale is a level of consciousness. And Glasgow Coma could be from brain injury, could be from medications, but it's a level of consciousness. So we'll think about it like this. This is an easy way to think about it. So if someone's laying there and they're just laying there normally with their eyes open, looking around, okay, or maybe closing them and opening every once in a while, that would be Glasgow Coma Scale 15. Say that they close their eyes and they're laying there still. It looks like they have all their motor function, but someone says, Chris, and I open my eyes and maybe close them again, but open them and close them. I respond to voice. That would be Glasgow Coma Scale 14. Say that I'm laying there and someone says, Chris, and I don't respond, and then they shake me, and then I come conscious or awake. That would be Glasgow Coma Scale 13. Say that I'm laying there, Chris, nothing. They shake me, nothing, and then they invoke pain. So they may pinch me or do something like that. That would be Glasgow Coma Scale of 10. So Glasgow Coma is a great acute indication of brain function and trauma to say, look, this person, like I said, the one patient, well, I've had a couple, but one patient, particularly Glasgow Coma Scale 3, she was basically sort of, I don't want to say brain dead, but not functioning very well at all. So that's a great acute level to say how's their not cognitive, but how's their consciousness?
Curious, if it takes a pinch or we've learned a sternum rub to arouse someone who's at 10, what's the point of 3 through 9? Like what if you have it? That just seems that 10, you're already to this person's basically unconscious unless you poke at them. How would you get a 9 or an 8 or a 7? Because it's going to be the same thing. The only way you can get them to respond is because you shake them or you poke them or you pinch them.
Well, and the Glasgow Coma was developed in the 70s. Okay. So particularly this year, they've released new guidelines. They're even going to do away with mild, moderate, and severe after the acute stage, because that is a good indicator to say, look, they're not responding at all. It could be a bleed. Let's do a lot more testing. So it's really more of a red flag to say, look, they have so for instance, if you see someone with a brain injury and their arms are stuck like this, or they have no motor skill.
Right. I'm following that, but we've been told that there are 3 things get measured to get your total score. And so help me understand if you're saying a 10 is someone who has to be poked to respond, what's an 8? How is an 8 different from a 10?
It's just a general thing. In fact, even patients with Glasgow Coma scales of 15 would still be qualified as a potential concussion because.
I'm not asking about, I hear you with the concussion. You could have concussion at a 15, you could likely have one at a 3 because you're catatonic. But if a 10 is someone who scores a 10, scores that 10 because the only way you can get their attention is by poking them. How would you score a 9 or an 8 or a 7? What's different in terms of how that person would interact with me? If I'm the paramedic running up to the scene and there's this guy lying there, that would cause me to give someone a 7 rather than a 10. If a 10 is, you're not doing anything unless I poke you.
And there's also been some inter-provider studies showing about, hey, there's a little bit of, inconsistency. One person may give a 9, one person give a 10. So it's not an absolute, but then you look at the whole picture to say, look, in general, this is a sign of reduced consciousness.
Okay.
I don't know if that answered your question.
It didn't, but I'm gonna let Mr. Miller take back his job. Sorry.
Your Honor, that was really all that I had. The rest was moving towards his experience as a chiropractor and dealing with the tens of thousands of people that have been involved in car accidents.
Okay, the notice you provided was that he was an expert on traumatic brain injury. So if you want to ask him more about that, or obviously work that he did with your client, because that is case specific, we can do that.
Yeah, we've covered that. I don't really have anything else. It would just be towards that. And I would also argue that being a chiropractor, it is a naturally occurring flow towards his job, given his training and expertise, that a chiropractor that's dealt with over 20,000 patients is well aware of mechanisms of injury of individuals that are involved in motor vehicle crashes.
Okay, thank you. Mr. Body, do you have questions for Dr. Connell?
Good afternoon, sir.
Good afternoon.
Just so I guess it's clear that you're a chiropractor.
Correct.
Can you tell us yours as I guess it pertains to your practice? How many of your patients are specifically those who have I guess TBIs and traumatic brain injuries?
Well, the good thing is a lot of patients don't have brain injuries, or they have considered mild traumatic brain injuries. So I would say maybe 5%, 10% would be somebody that would have a brain injury.
Okay. And as it relates to your treatment of an individual with brain injury, are you giving them CT scans, or are you treating them with point?
Yes. So again, functional medicine, through education on nutrition, exercise. I wrote a book for patients on, lifestyle medicine to help the body and brain function better. Sometimes I call it neurobics. It's called neurobics. We're helping them instead of using the right hand, the left hand. So there's different things we do from a functional standpoint. There's actually no FDA approved medication, surgery, or injections to help with persistent post-concussive symptoms from a brain injury. So it is important to help them through natural ways through functioning.
There are medications that are prescribed by neurologists and people who study and operate on the brain as it relates to concussions and traumatic brain injuries, correct?
For the symptoms, but actually there is no FDA approved specifically for brain injury for function of the brain. It is actually for the symptoms. There are definitely medications that help with the symptoms, but technically there's none to help with the brain function better.
Symptoms caused by traumatic brain injury.
Correct.
Medications would lessen the symptoms and make the person potentially more functional or have function more normally during the day or whatever they're taking the medication, correct?
Correct. So like even if they have a dysfunction of the blood-brain barrier, that could cause problems with headaches, and that could definitely help with the symptoms, but also it's important to help them functionally so that way the brain functions better to normalize the blood-brain barrier.
Those are things that you would not be able to prescribe as a chiropractic profession, right?
We could do anything externally as long as it's no drug, surgery, injections. So we do laser for the brain. So laser helps with mitochondrial function and penetrates through the skull. So there are things that we could do, but definitely no drugs, surgery, injections. We would refer out for that.
Say laser, what kind of laser are you talking about? Like red light?
Well, there's a class 4 laser that penetrates to the skull. It has to be more than 12 watts. And then that will go through the cranium, and that could actually help with blood flow. It also helps with mitochondrial function.
Is it similar to, it's not sarcastically, but the helmets that someone would wear to create blood flow for male pattern ball?
No, not at all. That wouldn't penetrate deep enough. So the laser we have is about 60 or 70,000. So it's very, very powerful, and it actually would go through to help with the brain as far as increasing blood flow and also mitochondrial flow.
Okay. And as it relates to, I believe it's your company, it's called Brain Concussion, correct?
That is, yes. In 2021, I believe I started that.
Okay. And can you tell the jurors as the owner?
Yes, and I'm considered the chief CEO, chief education officer to help create awareness about brain injury.
Can you describe the people that you have on staff who work for your company, Brain Coach?
Well, we basically, over the years, have used neuropsychologists. So basically, they help again with the function of the brain. Neurologists, we would refer out to, but neuropsychologists typically are people that would deal with the function of the brain. And again, you have PTSD and anxiety that go with that, but neurologists, neurosurgeons, we would always refer out for. We don't have any of those.
And those are people, or those are physicians, correct?
Correct.
They can prescribe medication and things of that nature, correct?
I'm a big fan of surgeons, medical doctors. I always believe in working together to get patients better. So we refer out whenever needed.
Agree that their area of expertise is very different than what yours is, correct?
Yes.
And when you say neuropsychology, explain what do you mean by that term?
So how the brain's functioning. So neurologists and neurosurgeons are great at structure. So if you have a bleed, I don't want a neuropsychologist, I want a neurosurgeon. You know, if you have a neurologist, that's great maybe for MS or other problems. But neuropsychologists deal with how is the brain function and how to get the brain function better. A lot of that is lifestyle medicine, self-care, things of that matter. So neuropsychologists are wonderful in that matter.
Now, I want to bring out but let's just talk about your review. You said you reviewed Defense Exhibit number one, the large stack of Mr. Poole's medical records, correct?
Correct.
And you reviewed that for I guess potential for some sort of traumatic brain injury, mild, moderate, whatever it may be, right?
Correct.
And in your review of these records, you would agree that Mr. Poole was seen by many different types of physicians, correct?
Correct.
He was seen by neurologists, right?
Correct.
Orthopedic surgeons,
Correct.
some of the best in the level one trauma center.
I believe Grady is one of the best, yes.
You would agree that in his time that he was there from April 9th to April 26th, no one diagnosed him with any sort of traumatic brain injury, whether it be mild, moderate, or medium, right?
Well, in the records on release, it said basically follow up for potential mild traumatic brain injury. So again, his injuries are very severe. Mild traumatic brain injury or, even brain injury in general with those injuries are considered like a by the way injury, because a broken bone, you're going to do surgery. When someone's having cognitive function, which again, he didn't really get any tests. There was no Glasgow Coma extended scale. So most of the time, brain injuries are considered a by the way injury. And that's why even with sports in the NFL, it's created an awareness of it, So most people think you have to lose consciousness. In fact, Brett Favre, when, they said how many concussions you had, he said, well, I lost consciousness 3 or 4 times. Once they told him the definition of concussion, he said it's been thousands of concussions he's had. So again, it is something where they did a great job. It was a non-bleed, non-life-threatening traumatic brain injury. That's great. But based on the definition of mild traumatic brain injury, on the post-traumatic amnesia, that qualifies for mild traumatic brain injury.
That's a diagnosis you're looking at post care that Mr. Poole received from Grady, correct?
Well, that was diagnosed in the notes, say follow-up for mild traumatic brain injury or considered mild traumatic brain injury.
The notes actually say that upon discharge, they will continue to monitor to see if there is a moderate or mild brain injury, correct?
Correct.
Prior to the time he was discharged, not a single physician had diagnosed him with any sort of brain injury, correct?
Correct.
And is it your opinion that he didn't receive the appropriate test and examination by the number of physicians that he saw from 4/9 to 4/26 at that level 1 trauma center?
I think they did everything they're supposed to do for life-saving measures. But like I discussed earlier, for persistent post-concussive symptoms, you want to do follow-up testing 3 months afterwards. In fact, the definition says that you have onset of symptoms within 24 hours, and then you have persistent, ongoing symptoms for more than 3 months. So if there was follow-up care, that would have been great. Obviously, there wasn't. But again, you look at is it biologically possible and what's the most likely symptom? The post-traumatic amnesia, based on the guidelines, would qualify him for the definition of mild traumatic brain injury.
Qualified him, but he was never diagnosed, correct?
Well, I would have loved if he had some testing, but based on, again, the timing, it's far removed.
And you mentioned, the GCS extended, I guess, scale or extended evaluation. What do you mean by that?
So Glasgow-Coma started in the 70s, which is, again, a great entry-level tool, but they found the need, well, that's only great really for acute care. It's good for early on care, but what do we need to do long-term? So they typically recommend 4 weeks, 8 weeks, 12 weeks. You do something called a Glasgow-Coma extended scale. So that's basically say, now how are they doing?
How do you evaluate that it's, I guess, extended glaucoma scale the same way?
No, it's similar, but there's different functional things. Like for instance, number one is, and it's a little different grading scale, but number one, be they're in a coma. Okay, because if it's 4 weeks and you're not going to use the Glasgow-Coma scale, you'd use a Glasgow-Coma extended scale. And so if they're in a coma, that would be 1. If they were the absolute best, where they're like, I have no symptoms at all, my brain is pretty much the way it was before, that it's considered a good prognosis. And at that point, then they would rate an 8. So it is something where there's a different sliding scale based on the patient's symptoms. And also, what is reasonable? Is it reasonable, like, say someone has, I don't know, I'll use an example. I use low impact collisions. It's unlikely to cause a brain injury. Okay, so I testify, look, this is a low speed rear end collision can't physiologically cause an acceleration brain injury. So maybe there's other symptoms. Maybe it could be cervical spine trauma. Maybe it could be PTSD. But you look, is it reasonable that the trauma would cause a brain injury? And the answer is yes. Are the symptoms there that he has the untreated brain injury? Again, post-traumatic amnesia is listed as, if they have that for more than 1 day, that's considered a diagnosis of persistent post-concussive symptoms.
Sorry, I should have asked a more pointed question. So the GCS scale is during his trauma stay, the 3 is the lowest you can get, 15 is the highest, right?
Correct.
And on this extended scale, you're saying the lowest someone can get is 1 and the highest they can get is 8?
No, so it's actually a completely different paradigm. So basically with the Glasgow-Coma extended scale, but there's an entire different process. So there's different forms you fill out. I did bring a sample of the Glasgow-Coma extended scale, but basically it's more of a, how are they functioning? Oh, doc, I'm having headaches. I didn't have headaches before. I'm having this problem, that problem. So there's a whole gamut of things. And so even endocrine problems, I've been involved with seizure cases. Seizures after brain injury may not show up until a year afterwards. So, looking retrospectively, you get a clear approach on some of those symptoms from a brain injury because some of those are not immediately identifiable.
I understand all of that, I guess. So if it's a scale, you have to have, like you said, a 1. What's the highest you can get to show like you just mentioned a few minutes ago, that they have no brain injury?
That'd be good prognosis, yes.
Good prognosis means 8?
Yes,
So it is 1 to 8?
yes.
Okay. When you get to 1 day are all the things that you just said in between that.
Well, let's do a neuropsychological evaluation through questionnaires, just going through to say, look, there's a whole gamut of tests that you would do, and physical tests, because you do see patients where they say, wow, I've had headaches ever since an injury. And then you qualify them.
You saw Mr. Poole, you said April of 2024?
Yes,
Did you, in your report, it doesn't say anything about your evaluation as it relates to his GCS extended score, correct?
exactly. Because again, the qualification, the most significant finding is post-traumatic amnesia. So that automatically, again, there was no need to do the extended that far removed, but it was more or less, did he have a brain injury at that initial time? And so, but there's no reason to really do the Glasgow-Coma extended that far along after the treatment or after the initial injury.
Okay. And you said you reviewed the records, correct?
I did.
And you would agree that a number of times throughout the day, many of the different providers did a Glasgow-Coma evaluation for Mr. Poole throughout the stay, correct?
Correct.
And you mentioned earlier that at one point you saw that someone had notated that his GCS score was 11. Do you remember that?
Correct.
And you would agree that that number 11 is only shown in the records 1 time.
Correct.
And at 1 time, it's recorded by somebody named Todd Clark, correct?
I don't know who did it, but I'll take your word for it.
Recorded by who I call the dispatcher, but the person who receives the call from the EMT, from the paramedics, as they are bringing Mr. Poole, the defendant here, or to Brady for treatment, right?
Correct.
And so you would agree that that person never assessed Mr. Poole, correct?
I mean, that's what they report in the records. I think one of the things that I saw that was most finding is the medical doctor that was, I believe, the day when he came in, where said there was a neurological decline in his function and reduced Glasgow Coma Scale by more than 2. So I believe that was Dr. Savannah, and it was like maybe later on in that day when he came into the ER.
And so what did Dr. Savannah find his Glasgow coma score to be?
So it was at 1850, which I guess is 650, and it says other comments: neurological deterioration, decrease in Glasgow Coma Scale of greater than 2. And so
What page is that?
165. So again, Glasgow Coma Scale can fluctuate, but it's just a level of consciousness, and especially with the medications, you would expect it to fluctuate.
You said with the medications, you expect it to fluctuate.
It could definitely, yes.
Okay, and as it relates to the medications, how would you expect it to fluctuate? And how is it, I guess, referenced, or how is that highlighted in the records?
Well, even like right when he first got there, I believe it was 12 minutes after he got there, he got fentanyl. And then I think 5 or 6 minutes later, or a short time later, it was loss of consciousness. Well, that's, again, a pretty big finding, but it is something where it's complicated when you have medications along with a head injury. But like I said, the post-traumatic amnesia would definitely be signs of having at least a mild traumatic brain injury.
So I'm going to pull up into page 165.
Yes, on the bottom is Dr. Savannah Smith.
So it's your opinion that where Dr. Savannah Smith, she says what you just said, that's the order comments that we're talking about neurological deterioration, decrease in UCS. That's what you're talking about.
Yeah, again, that was one of the findings that I
This box right here.
correct.
Like that. Okay. So it's your testimony that you're saying that Dr. Savannah Smith is saying that he had a decrease in his GCS of greater or 2.
Well, again, you take there's many providers that documented Glasgow Coma Scale 14. Again, that's a level of consciousness. But again, that's something where, it's not an absolute. It's not like you're looking, say, a broken bone. It's more of a clinical picture. Again, with the medications and with head injury, those are all things that was one of the things I remembered or pointed out, is that there was a neurological deterioration.
So my specific question though is the note that we're reading that it says the checking provider, Savannah Smith, you're saying that that note means that she saw a decrease in GCS of greater than 2.
Well, again, this is one picture. So this one snapshot, that's what it says.
Well, my question is a yes or no. Is that box where Dr. Savannah Smith had typed what she order comments, neurological deterioration, and in parentheses, decrease in GCS? You're saying that her comment, based on your medical training, is that she's saying GCS has decreased by 2.
Well, I would say the neurodegeneration or deterioration is the thing I was most looking at.
That comment doesn't mean that she actually saw the deterioration by 2, correct?
Correct, and that's in parentheses, so I don't know what she saw, but she documented, for whatever reason, neurological deterioration.
You agree what she's saying is if you see a GCS deteriorate by greater than 2, to notify her, the physician, correct?
That is something where, again, it was something in the notes, but, that was something that I remembered.
Well, I appreciate that you remembered it, but is it your opinion, based on your experience with you guys, your medical training, that that note is saying that she saw a decrease in GCS of Mr. Poole by 2 or more?
No, I would not. And
based on all the training and the thousands and thousands of pages of medical records that you have reviewed, you would agree, all that is saying is, if you see a decrease of 2 or more in his GCS, to call me or another treating physician.
Objection, Your Honor, mischaracterization of that.
He can say, the question is, basically, is Mr. Abate characterizing it the correct way? You can say, no, you're not, or yes, you are. Overrule.
I think you're probably correct, but again, I saw deterioration, neurological degeneration, but it's just part of the clinical picture.
And then in all of the records that you reviewed, you would agree that Mr. Poole's GCS score on the GCS scale was never lower than 14, other than the one reported 11 by Todd Clark, correct?
Correct.
And can you tell this jury, someone's GCS is 14, what does that mean?
Well, that's the Glasgow Coma Scale, so it's a level of consciousness. That is not the level of brain functioning. That's a level of consciousness. So basically, again, that's just something that it's not 15, which would be considered to be relatively normal.
15, you would consider relatively normal, or 14, you would consider relatively normal, or both?
Well, no, 15 would be more or less, I don't want to say normal, but it's average or fine. 15 would be more considered fine. 14 would be just less than 15, so it would be, in that scale, considered mild traumatic brain injury.
Other than that, the jurors may be a little sleepy because we've been going for a while. Is there any reason why any of the jurors wouldn't get a 15 on a GCS? If we brought in an EMT and said, I'm worried about these people, EMT, and she evaluated them. Any reason? I'm trying to understand the baseline. Wouldn't everyone who hadn't just been in a car accident get a 15?
Yes, unless I keep talking and put them to sleep.
Right,
But-
or me, or someone, or the lawyers. So 15 is, there's really nothing going wrong with you right now.
Well, technically 15, you could still have problems. In fact, they've had Glasgow Coma Scales of 15 people actually have bleeds. So that just means it looks like you're conscious.
Right, and you are approaching this from a unique perspective with the traumatic brain injury. Assume no one in this room has a traumatic brain injury. Everyone's doing well on that front. We all ought to get a 15.
Correct.
Okay, got it. And we're not hiding a traumatic brain injury. So then if you're 14, you're one notch down from 15.
Correct.
And that's going to mean subjectively something different to different people.
Correct.
Okay, I understand that better. Thank you.
And then, I'm gonna abbreviate where I was headed, but did you review the, I want to pull it up because I'm sure maybe it's in front of you, the EMS records of Mr. Kenneth Poole?
Yes, the EMS records, yes.
And in the EMS records, Mr. Poole's GCS was checked, scored 2 times, correct?
Correct.
And it was done at 3:48, right?
Correct.
And 4 a.m.
I believe you, yes.
And in each one of those times, his GCS score was a 15.
Correct.
And you remember reading the narrative section of the report that was done by the treating EMT, Mr. Barrett.
I remember, but can you refresh me?
Remember seeing this page, so this would be for the record, states 140, page 3 of 7.
Yes.
Okay, and do you have a reading, or do you need a minute to refresh your recollection as it relates to Mr. Poole's reported alertness and consciousness?
Yes, I remember seeing this, yes.
Okay, and do you remember the report said that the patient, the defendant in the pool, was conscious and alert and was able to communicate and no difficulty speaking?
Yes.
Okay, and at no point in Mr. Barrett's report does he ever put in the record that Mr. Poole had slurred speech, correct?
I didn't see that in there, no.
And he had difficulty understanding questions, correct?
Correct.
And he had any inability to understand the questions that were being asked of him.
Nothing like that's documented.
And you also, in the medical record, you said you reviewed all of the treatment that Mr. Poole received, right?
Well, yeah, the 2,000 pages, yes.
Right. And you're here to talk about the 2,000 pages, right?
Yes.
So in the 2,000 pages, not once did it indicate that Mr. Poole needed intubation due to being unconscious or inability to breathe on his own. Right?
I didn't remember seeing anything in there, no.
And in fact, isn't it true that throughout the medical records, and specifically on page 107, they indicate that they see 0 or no neurofeedback, correct?
Correct, and that's great. There was no signs of any severe brain injury or life-threatening brain injury. But again, as I discussed, mild traumatic brain injury is something a little bit different than the life-threatening severe brain injury typically we're looking for in a center like Grady.
And at no point do the records indicate that Mr. Poole ever had any diminished decision-making capacity, correct?
I don't think they evaluated for it, but I didn't see anything in there either.
You would agree that there were some times that Mr. Poole had to listen to the doctors and had to verbally consent to some serious things, correct?
I wasn't there, so I don't know his state, but there was nothing in there saying that he wasn't able to.
I didn't ask you about what the state was. My question was, you would agree there were times when Mr. Poole was verbally told about serious procedures that he was going to receive, and he verbally consented to them.
That's what the records state, yes.
And at no point did the records ever state that he didn't understand the procedures he was consenting to,
Correct,
and that he didn't have the ability to make the consent.
correct.
And you would agree that the only, I guess, indication of the potential for a mild brain injury was on page 396, when they said they would monitor only for a mild possible TBI, right?
Yes,
That means at the point of discharge, again, nobody had found him to have any sort of brain injury, right?
yeah, they just, well,
No, you keep going. We've covered this a lot.
Yes, I know.
As in Mr. Bata, you've covered this a lot with Dr. Conlon. But if you want to do it one last time, now's the time.
That was the last question.
Okay.
And I guess the last area I want to kind of talk to you about is it relates to the medication. You talked about different types of medication he received, right?
yes, the fentanyl,
And, well, fentanyl is not the only medication he
Yes.
received, right?
correct.
And did he receive medication, like opioids upon discharge?
Correct,
It's not uncommon that people would be taking things like tramadol and other pain relieving medication upon discharge from a hospital, correct?
correct.
And based on your knowledge and the profession that you're in, most people operate or function normally taking those medications on a daily basis, correct?
It depends on the level. So, I mean, everyone's unique, but I can't really speak to their ability to function or, but like I do know that in the state of Georgia, like if you are on opioids, you shouldn't be driving.
Okay. And at no point in your report does it report that Mr. Poole, on his discharge and taking those medications, that he experienced any hallucinations, things of that nature, correct?
No,
And that's because he didn't tell you that.
correct.
And at no point during his stay at Grady, when he was taking things like fentanyl, he was taking other medications like ketamine, he never reported any hallucinations or psychosis, correct?
There's nothing documented in notes, no.
And in fact, he is consenting to serious surgeries and procedures under the influence of a pain dosage amount of either ketamine or fentanyl, correct?
Correct.
So the physicians at this level 1 trauma center, based on their observations and their conversations with this defendant, believe that he had the ability to consent based on what they observed.
Objection, Your Honor, cause for speculation.
Sustained.
Let me ask this question. If the doctors believed that the medication was affecting Mr. Poole or any patient to the point where they didn't believe that they could consent to a procedure, they would put that in the record, correct?
Objection, Your Honor, again, speculation.
Different angle.
Well, let me ask this question. At any point in the records, do you see that Mr. Poole couldn't consent to anything due to the medication he was prescribed?
There's nothing documented like that, no.
And if it would have been documented had a doctor had that opinion.
Objection, Your Honor. Speculation.
Would you expect the medical records to reflect that someone had the inability to consent because of medication that he prescribed?
You know, I don't know the doctor, so I couldn't attest to their ability to write it or not, so.
What would you do?
Yeah, I would definitely write it in there if it was me and it was something that they, said, no, of course, you don't do.
I don't have further questions. Sorry.
Mr. Miller, any follow-up for Dr. Connell?
Dr. Conley, the effects of tramadol versus fentanyl, are they vastly different?
Yes, fentanyl, like I said, is very, very powerful and fast acting.
Right, so, the someone being prescribed tramadol, on their discharge from the hospital, would doctors ever prescribe fentanyl upon discharge?
I'm sure there are doctors that may, but I doubt that they would. Yeah.
All right, no further questions.
All right.
Oh, there is one. I'm sorry. I'm very sorry. I'm hungry too. With respect to shock and adrenaline, does that affect a person's ability to evaluate someone's Glasgow score?
Yes, and anything, again, the level of consciousness. And so if it's shock or adrenaline that's going, particularly for probably the first 24 to 48 hours, that may affect it.
All right, no further questions.
Sure. Okay, Mr. Body, anything else? All right, jurors, questions for Dr. Connell? Deputy Griggs, if you would, please. Thank you. All right, I'm going to talk briefly with the lawyers. While we're out there, talk amongst yourselves about the shortest amount of time you need to have lunch. Okay.
I apologize for talking so fast. I know, especially with adrenaline, I could.
Right down, okay, we're there.
Oh, okay. I apologize.
Right. And you exit the port. And it's a pretty land. Oh, you're right. Yeah.
It doesn't matter. Just like cheaper. Yeah, that's right. Yeah. Or it's better. Well, my grandmother's actually had less.
Oh, they make you.
So I don't know. They just on. These? No. Yeah. Yeah, they're like. That's the one. Yeah. Yeah. I know that's what I'm worried about. I mean, I like it. I don't know. Yes. No. 4 years. Where's the next first? He's been one.
The teacher has financial assistance.
Court come to order, remain seated.
Did you guys enjoy the lunch we just had out in the hallway? Not really. We were working. Dr. Connolly, a few more questions and then we'll see if there's any very brief follow-up. When you had you conducted an assessment of Mr. Poole, some interaction with Mr. Poole, did that result in any follow-up treatment that you either recommended or provided?
We did talk about like self-care, exercise, nutrition. I recommended that, but also recommended to get, as much help as you can, because after a head injury, there are some functional things you could do. So, as far as nutrition, exercise, we would have talked that. Particularly exercise is one of the most important things for a brain.
Okay. So you made recommendations, whether Mr. Poole followed them or not, you didn't
Correct.
consult later with him.
Correct.
Okay. Share with the jury everything that you were able to identify that supported your diagnosis of persistent concussive symptoms or your identification of persistent concussive symptoms for Mr. Poole when you examined him.
Perfect. So first you look, is it biologically probable or possible that there would be a head injury based on the vehicle damage and the impact? It'd be actually unlikely that he wouldn't have a head injury. Because that was a very serious impact. And then, you look at the history and talk a little bit about the symptoms. But again, the Academy of Rehabilitative Medicine guidelines talk about post-traumatic amnesia is the #1 factor to say there's a long-term problem. And that was the biggest factor from my standpoint to say, look, when you lose, when you don't remember it, again, think of a football player, if they play a game and they don't remember it, that's a sign of a severe dysfunction in the brain.
Are concussions, let me finish the question before you say, no, that's a crazy question. Are concussions all the same? And here's what I mean by that. If it is diagnosed that someone has received or experienced a concussion, does it matter that it was from a sports injury, you got hit helmet to helmet, versus I was in a motor vehicle accident? Does the mechanism of causing the concussion matter medically?
Yes.
Explain.
So what happened is our brain is actually viscoelastic. So we like to think of our brain, and I taught dissection for 2 years. We like to think of it as like, we're solid. It's actually more of like a soupy combination of blood, of axons, neurons, of oligodendrocytes, astrocytes, lots of different stuff in there. There's over 100 billion neurons and trillions of other cells. And so what happens is our brain has something called viscoelastic properties. So just like shaken baby syndrome, when someone moves it around very quickly, that's acceleration, deceleration. If somebody hits the skull like a boxer, Muhammad Ali he said he didn't lose consciousness ever, but he had 29,000 impacts. So the multiple impacts can affect too. But brain injury is very complicated. But from a motor vehicle injury versus a sports injury, the science is very clear that the speeds and forces are involved are a lot greater in motor vehicle collisions and sports injuries. Now, I'll use an example. Say this weekend, 2 players are coming 300 pounds, they hit each other going 20 miles an hour versus a car going 80 miles an hour hitting a brick wall. The forces are exponentially greater for motor vehicle collisions and sports injuries, but sports injuries tend to have multiple traumas leading to the effects. The acceleration, deceleration from motor vehicle collisions typically are a lot faster and more significant to the brain.
Your ultimate diagnosis of Mr. Poole in connection with a traumatic brain injury, based on your interaction with him, was post-traumatic amnesia.
Well, persistent post-concussive symptoms would be the technical diagnosis, but that was classified with the post-traumatic amnesia. He had other symptoms as well, such as sensitivity to light and other things like that. But that was the biggest factor for me, was the post-traumatic amnesia.
Okay. And how do you assess post-traumatic amnesia? And what I'm getting at is, how do you confirm it's not just the person saying, I don't remember because he doesn't want to think about it or talk about it, but in fact, there really is amnesia? Or, hey, it was 4 years ago. I don't remember what I was wearing that day. I don't have amnesia because I don't remember what I was wearing that day. don't remember.
Correct. It's complicated and there's lots of variables. I mean, there's some cases I've been involved with, which we're able to get DTI scans, which that shows small little areas of neural tracts that are broken and they leak water out. So in one case I'm involved with right now, the interesting thing, the area of damage of the brain on DTI is exactly relating to the symptoms that they're having. So if you match the area of the brain that we found problems with, it matches particularly their symptoms. So there are specific tests, but also there's a lot of them complicated, but it's, again, the brain is a very complicated structure.
Okay, but in this case, your work with Mr. Poole, none of these sophisticated, complicated tests were performed. It was a person-to-person interaction that led you to conclude that the post-traumatic amnesia was part of the set of symptoms.
It was a clinical diagnosis based on the guidelines.
Okay, last question from the jurors. The post-traumatic amnesia diagnosis is yours, and that's not anything that would be found in the medical records from Grady, because as was explored many times with you, there was just that reference at the end as he was being checked out, you may want to look into a brain injury. My words, not the words of the.
Right, yeah,
Okay.
there's nothing else in it.
Okay. Mr. Miller, do you have other questions for Dr. Connolly based on that?
No, Your Honor.
Mr. Abadi?
Yes. So the fact that it's not in the records doesn't mean that they didn't evaluate it for post-traumatic amnesia, correct?
There's nothing in there saying that they specifically evaluate for him for that, no.
So you would agree there's nothing in the records, all 2,000 pages, that Mr. Poole indicated to them that he didn't have memories of things before and after, correct?
Correct.
Because post-traumatic amnesia could mean that you have a difficulty remembering things that happened before, right?
Correct.
And it could also mean you remember everything that happened before, but when you come to the next day, you have an issue remembering the new things, correct?
Correct, yeah, there's nothing saying that that was evaluated or addressed in any way.
But there's nothing saying it wasn't evaluated, correct?
Correct.
He was seen by neurosurgeons and neurologists, correct?
Correct.
And they commonly are going to evaluate for things like post-traumatic amnesia, correct?
Neurologists and neurosurgeons, they look for structural injuries. Functional injuries are different. So, but basically, the structural injuries, again, they did a great job, but they're looking for anything bleeding, life-threatening, anything like that. But, you know, they didn't look at the function.
Well, you would agree that somebody's brain not functioning correctly could also be an indicator of structural issues, correct?
Sometimes, yes.
That's how a neurologist or a neurosurgeon has, you know, the specialty to diagnose or to see that and then do the appropriate evaluation afterwards.
Structural injuries usually could be life-threatening or lead to more severe brain injury, like, you know, where they're basically like almost like a vegetable. But the structural injuries definitely are more serious, more severe, and more important to identify.
Who identifies functional injuries to the brain?
Clinical providers, neuropsychologists, you know, follow-up testing.
And psychologists that you saw at the hospital, correct?
I don't know if he saw neuropsychologists.
I'm asking neuropsychologist, you're not a neuropsychologist, right?
No,
And you diagnosed post-traumatic amnesia, correct?
but that was, yeah, based on the clinical. Yeah, chiropractors can as well. So,
Psychologists could also be.
Objection, Your Honor, he's not allowing him to.
Let him finish his answers.
so they did a great job with preventing life threat, you know, making sure he was fine. So,
Psychologists could also diagnose post-traumatic amnesia, correct?
I guess it is true, correct? Yes.
And he was seen by several psychologists, correct?
You know, I believe he was, but again, I didn't see any type of follow-up after he left Grady.
And your only interaction with the defendant was one time, correct?
Correct.
And it was through telehealth,
Correct.
internet connection, correct?
Correct.
And since April 2024, you've never spoken to him as it relates to his medical condition again.
Correct.
Dr. Brenner.
Doctor, thank you for your time.
Thank you.
Appreciate it. If you gather up your stuff and leave behind anything anyone handed you.
Thank you.
You bet. Happy holidays. This was almost 1:15. It's definitely time for lunch. How much time do you all want for lunch? Yes, ma'am.
Before we answer that question, Your Honor, what time do you think we're gonna be leaving for today?
What time would you like to leave today? Don't say right now, because that's not in the cards.
So we had two options. We were like, if we go for 45 minutes, then we thought we were leaving at 5, but we're willing to stay to 6 if we can get the whole hour.
Done. You get an hour. All right? We'll see you at 2:15. Enjoy lunch. Don't talk about the case.
All rise for the jurors.
Remember how cozy it is in here when you're out there and it's cold.
Jurors will clear your honor.
Thank you, Deputy Griggs. So that was a net 45-minute gain. Mr. Miller, you will have witnesses, it sounds like, to fill the afternoon and they'll be ready to go at 1:15? Great. Anything else from the defense before we break?
No.
Mr. Rao, anything from the state? You had that look, that scowl that there's something coming. No,
No.
not right now? All right, don't save it for after the break if there's something I need to be thinking about.
No.
No? Okay. All right, I'll go look at some of those cases. Who are you starting with, assuming you don't change your mind over the break? Well, let me ask it this way. I think are you gonna call Stinson? He already testified, and you may have had him on the list in case the state didn't call. That's the APD sergeant who was at the scene.
No, we're not calling.
Okay. Do you have other, I'm gonna call experts that you're gonna call, or are you pivoting now to lay witnesses?
Right.
All right, then you don't need to tell me who you're calling next. We're to the, here's what was going on the 8th and the 9th. That's gonna flow as you have it flow. Thank you. Yes.
show myself completely in the courtroom, that and so.
Rivers, are you ready? Okay, we're back on the record in State versus Poole. Our late day lunch break has ended. Are all 13 jurors back?
Yes, Your Honor.
I bet they are. We've got Mr. Poole here with his lawyers, our prosecutors. Mr. Miller, anything we need to discuss before the jurors come in?
No, Your Honor.
Your next witness is ready?
Yes.
Yes, okay. Mr. Rao, anything from the state?
Nothing, Judge, not unless, or not until you have the opportunity to address the objection to the prior conviction.
Okay. Your next witness, is that Eric Arrington?
No.
Okay, all right. I'll keep working on it.
Yes, sir.
Let's bring the jury in, please.
Judge, just to direct, our objection is going to be based on the rules. That there's no specific case law that we would cite to.
Got it. And you are relying on 404B and you threw a 6 at me as well.
609, but I know that's involving impeachment by conviction. It'd be Rule 404B, Rule 801, and Rule 403.
Okay.
Ours would also be the rule, reverse 404B.
Okay, which is 404B. There's not 404B prime. Got it.
And ours comes with case law.
Okay.
All right, for the jurors. Yeah, I'll do the first one.
Thank you, Deputy. Everyone else should be seated. Welcome back, ladies and gentlemen. Do we try anything new for lunch today? Same old Fuda? Well, Fuda would be something different. They don't bring back the same. What did Fuda have today? Or was it too late and Fuda was empty?
Yeah, that's what happened, yeah.
So it was vending machine? Everyone had Snickers?
No, I had the right, but it was.
Where did you find, where were there arepas?
Downstairs.
Oh, so that was what Fuda had?
Yeah, that's what they had.
Okay, all right. That sounds kind of bougie for Fuda, but excellent. Arepas it was. We are gonna press on with the defense case. The state's rested, so we're hearing the evidence that Mr. Poole is electing to present. And I'll ask Mr. Miller to call the next witness.
Your Honor, defense would call Andrea Poole to the stand.
Raise your right hand. Do you swear and affirm that the testimony you about to give the truth, the whole truth, and nothing but the truth? Yes. Allowing clearly from the station and spell it report.
Andrea Poole, Andrea Poole.
How do you know, Ken Poole?
He's my nephew.
Is this on your mother's side or on your father's?
His mother's side.
And is he one of how many nephews?
He's my only nephew.
Only one.
Mhm.
And did you used to, how was your relationship with your nephew?
It's pretty good. I've been there all of his life, raised him at the beginning, so we have a pretty good relationship.
And the age difference between yourself and Mr. Poole, what is that?
I'm 41. I don't know how old he is now. Oh, he's 25, I think.
Is this a situation where you used to, kind of look out for Mr. Poole?
Oh, yes, babysit, help with homework, walk home from school, all of that.
What is it that you do for Poole?
I'm a recruiter for a major appliance company.
What, I'm sorry.
I'm a recruiter for a major appliance company.
And, where are you from?
Memphis, Tennessee?
Do you currently stay in Memphis, Tennessee?
Yes.
Alright, no real affiliation with Atlanta, correct?
Oh, no.
Alright. I'm gonna take you to this case, for April the 9th, 2021. Do you remember that day?
Yes, I do.
Why do you remember that day?
Because I received a call from his mother, frantic, screaming in the phone, something has happened to Kenny.
Okay, now, before we get into all of that, what are you relying on as far as your memory, of that day, April 9th, 2021?
Just fear in my sister's voice, the pictures of the car, and just the day-to-day behavior of him, like I could see it on his face, like he's still hurting.
Now, you didn't write any reports, is that correct?
No,
So it's just basically the memories, all going on.
correct.
All right, now, that morning, you said that call came in around what time?
Between 4 or 5 o'clock
AM?
a.m.
All right, and what did you do in response to that call?
I immediately got out of the bed, got my kids situated for the day because I have 2 daughters to make sure they was okay. And I got in my car and headed to Atlanta before I stopped to pick up his other aunt on his father's side.
Who all was in the car with you headed to Atlanta?
Me and his other aunt, Atoria, she's on his father's side.
Okay, and the drive from Memphis to Atlanta, how long is that drive?
About 5.5 hours.
And in order to complete that drive, you have to make a stop.
Yes, I always stop in Jasper to get gas, like halfway,
Where's Jasper?
Alabama.
Alabama? And who all was in the car with you when you left?
Just me and Atoria.
You know approximately what time that you all made it to Atlanta?
It was around 12, close to the 12 o'clock hour.
All right, and where did you go upon arriving to Atlanta?
Immediately, we went to Grady Hospital.
Right. And once you got to Grady, where was Mr. Poole located?
He was inside. They were saying he was in ICU. We pulled up, his mom and his sister and his grandmother had pulled up right before us. So all of us was kind of outside the hospital trying to figure out how to get in and what we needed to do.
Okay, were you able to get in that day?
I wasn't, but his mother was.
Okay, and this is April of 2021. Were there protocols that the hospital had in place during that time period?
Yes, due to COVID, only one person can go in per day, and visitation was from 1 to 5. And it's only for an hour.
And was it 1 to 5 or did it go to later?
It was 1 to 5 or 1 to 6. I really can't remember, but I know it was like a short time frame, and you only got 1 hour, 1 person per day.
Now, while Mr. Poole was at Grady, was there any time where there wasn't a family member that was present?
Only in the evenings once visitation was over.
And what was his condition when you got there?
On the 9th or the 10th, because I seen him on the 10th.
What was his condition on the 10th when you got there?
When I walked into the room, he was just laying there. He wasn't moving. His eyes were closed. I asked the nurse, why his eyes closed, why he can't look at me. And she was explaining.
Stop for a second.
I'm sorry.
No, it's okay. He's objecting.
Oh, I'm sorry.
I was not fussing at you, man.
No, you're fine.
The attorney had an objection, so we need to
Okay.
pause so I can hear him out.
He's having a bus.
Or Mr. Miller, I'm equal opportunity.
My, you're saying there's, thing.
Right. So Mr. Miller, if you could just make sure, you're welcome to lead in this respect, that you're making sure your witnesses aren't talking about what other people said to them, unless there's an exception for that, which I don't think this would be.
Right.
So you were answering the question and that's fine. You may ask it a little bit different. Without talking about what people said when you went into the room, what did you see when you
where I
went
was
into the
at?
room?
Oh, is that where I was at? Okay, all right. What did you see when you went into the room without telling me the discussion that had with anyone?
He was just laying there, not moving, eyes closed.
All right. I'm showing you what's been already entered into evidence. Actually. When you saw him, is this this is defense exhibit?
You'll press stay muted,
Okay.
the white button. Thank you.
Yeah, when I got there, the mask wasn't on his face anymore, but he was laying in a like a regular hospital bed with his eyes closed, covered up like that.
It's either defense 9 or 10. I think that's enough for the record. It's either 9 or 10.
Either defense 9 or 10. I'm also going to show you what's been labeled as, that's 10. Defense exhibit. I'm showing you what's been marked as the defense exhibit 15. You recognize the, turn it over.
Okay.
You recognize the defense exhibit 15?
Yes.
Does it accurately reflect the way Mr. Poole looked when you observed him that next day?
Yes.
Any changes or alterations to defense 15?
No.
All right, this time defense would move to enter defense 15 into evidence.
Any objection to defense 15? It's admitted.
All right, so when you arrived, this is kind of similar to the appearance that Mr. Poole had at that time.
Yes.
Is that a phone, his phone? Got a bandaged arm and then there's a black rectangle in the sheets.
Yes.
That appeared to be a remote control to a TV.
No, not what's in the crook of his arm.
No, that's my phone right there.
That's your phone?
Yeah.
Okay. Why did he have your phone?
I laid it on the bed.
Oh,
I was touching him, trying to wake him up, and then I laid my phone down and used another phone to take the picture.
got it.
Now, as you were touching him to try to wake him up, was he responding in any way?
No.
As you touched him, what was his reaction?
He just laid there. I even sat on the corner of the bed, like to kind of nudge him. He wouldn't move.
Did you talk to him?
Yes, I was talking to him. Mhm.
And was he responding?
No.
How long were you with him that day?
Just an hour.
All right, and that's all the hospital would allow you to be there at that point. And during that entire hour that you were with him, did he ever say anything to you?
No.
During that entire time that you're with him for that hour, did he ever respond to you, touching him at all?
No.
How long did you all stay in Atlanta, once you got here?
Me and my mother, we left that Sunday, which I think was the 11th, because he had a surgery the following day. So we left the day before and we returned on the 14th. But his mom stayed here the entire time.
What was the reason why you had to leave?
To go take care of my kids and to get some paperwork because we were trying to obtain information about the vehicle because we didn't have his information. The hospital didn't have the information that we needed, like they lost his wallet. So
All right,
we
so,
needed to get some information from the insurance company to verify the ownership of the vehicle.
all right, what was the only information that, you all, the family had, or not information, but what were the only belongings that you all had, of Mr. Poole's at that time?
Just the driver's license.
While you were here in Atlanta during that time period, where did you all stay?
It's the hotel. I know it's over there by the Coca-Cola place. I can't think, it begins with the C. It was a hotel.
All right, and the entire time that you all were here, or, when you left, you said that his mother remained in Atlanta?
Uh-huh. Yes.
Okay, and did you eventually find out where that vehicle was?
Yes, on the 14th, I began to call around. I called Atlanta Police Department. I called Highway Patrol. I called state troopers until I spoke to a young lady and she was able to tell me where the vehicle was towed and gave me their contact information.
All right, did you go to that location?
Yes, me and my niece
All right,
and his mother, she drove
what day did you all go?
on the 15th.
And when you went to that location, what happened?
When we walked in, the young lady buzzed us in. We went in, signed the paperwork and showed proof of the registration for the vehicle, his driver's license and our information to prove that we were relatives. And at that time, a gentleman came in and escorted us to the vehicle. When we went into the yard, he asked if we needed any assistance. And we told him no at first. So he was like, do you want us to scrap the unit or you gonna get it towed back to Memphis? So we were like, you could just, looking at the vehicle, you can scrap it. So he had us to sign a paper to confirm they wanted to scrap the vehicle. And upon going to the car, we realized it was a lot of stuff. So he allowed his mother to come in with her car to help us load.
Okay, and when you say that there was a lot of stuff, what all was in that vehicle on the 15th when you all went?
Besides the rubbish of the wreck, in the back seat, it was a Nike duffel bag. I remember that because I gave him that duffel bag. It was a Nike duffel bag. It was backpacks. It was shoes. It was clothes. I think it was a ring light. It was some rubber from a tire. It was glass. It was a lot of stuff in the back seat.
Was there barbering equipment in that back seat as well?
No, but we did notice that in the trunk because the trunk was open. It was some barber cases.
What's a barber case?
That's where they keep their clippers and combs and other.
It's like a toolkit, but for barbers.
Yeah.
Okay. Did you all retrieve those barber cases?
Yes.
At any point while you were there on the 15th, were you all told that you couldn't go to the vehicle?
No, he escorted us to the vehicle and asked if we wanted to get it towed back to Memphis.
All right. Now, the paperwork that that record gave you all on the 15th, what was the purpose of that paperwork that you signed?
To give them to approval to scrap the vehicle.
Okay, and so you all signed that paperwork?
Uh-huh.
So on the
Yes.
Yes, I'm sorry.
So on the 15th, there was paperwork signed by the family that said it was fine to scrap that vehicle, correct?
Correct.
In addition, did you take pictures while you were there?
Yes, we took pictures of the vehicle.
And what was the purpose of you all taking pictures while you were there?
One of the purposes for the insurance company. The other purpose is because his grandmother wanted to see the condition of the vehicle as well.
Oops. What? Can you look through, I'm showing you. would have been marked as defense exhibit 11, 12, 13, 14, 16, and 17.
Okay.
Okay, they're all admitted. She doesn't need to identify, but you can certainly share them with her and publish them to the jury if you want. Can I have those numbers though on the exhibit list I don't have? So.
So 11, 12, 13, 14, 16, and 17.
11 through 14 and 16 through 17.
Yes, Your Honor.
Okay, all photos of the Infinity at the
So you are.
Kudo yard? They are all admitted.
All right, Ms. Poole, I'm showing you defense exhibit 11. These photos that you all took while you were at the tow yard, were they taken before you took those items out of the car or afterwards?
Before,
And how were you able to gain access into the car?
that back passenger driver door,
All right,
we were able, because it was kind of cracked, so we were able to just go ahead and pull it open.
okay. And we see the front here. What all did you see in the front when you all went on the 15th?
Pieces of the door, scrap metal, rubber, tape, all type of debris, fluids, oil, all type of like extinguished. It was a lot of like, fluid and everything in the inside and a lot of glass.
Was there anything, I'm showing defense exhibit 13 now. Was there anything that you saw when you looked at the video that would have been kind of emotional for you to see?
Yes, because looking at it, I mean,
But objective relevance.
What's the relevance of whether days after the situation, something was emotional for Ms. Poole?
I could rephrase. Emotional might not be the right word. Ms. Poole, was there anything that you saw in the vehicle that was very memorable for you?
But objective again to relevance. Yeah.
Sustained.
Was there a lot of blood in that vehicle?
like I said, it was blood, oil. It was just chemicals. It was stuff everywhere. So I was like blood, chemicals, oil. It's a lot of fluids.
All right, I'm showing you defense exhibit 13. Is that the tape that you were talking about?
Yes,
And that tape, was it located inside or outside that?
it was some in the inside as well.
In exhibit 14, there's some white stuff that's kind of on the ground as well. All of that was there when you all went, is that correct?
Correct.
And what view are we looking at the vehicle in defense exhibit 16?
That's the passenger side.
All right, and is that how you all were able to gain access into the car?
No, we did the passenger driver, the back passenger on the driver's side.
So the back driver's door is the door
Back
that you
driver
got
door,
in?
yes.
All right. And then just showing defendants exhibit 17. Now, whose items did you retrieve from the vehicle on the 15th?
I know it was Kenneth's, and his two friends. I don't know what belonged to who, but I know it was some piece of everybody in there.
Okay, and once you all retrieved those items, what did you do to them or with them?
I gave them to his mom to disperse.
His mom, meaning?
I'm sorry, Kenneth's mother to disperse.
All right. Now, did you go through any of those duffel bags or book bags to see what belonged to?
No,
You did, though, recognize the duffel bag that you gave your nephew.
correct, and his barber case, yeah.
When was the next time, or after that, how long or when was the next time you went to the hospital?
That following Friday,
And what happened while you were at the hospital, that following Friday?
when I went into the room, he was actually sitting up, and he was able to speak. Um, he was kind of concerned. He was saying, "Hey, how you doing?"
Stop.
Seriously.
Let's not get into what people were saying.
It's
I'm
a
sorry.
statement made by a party opponent.
Exactly.
Right, you don't get to get in anything Mr. Poole said.
Okay.
No, if you didn't know, you're getting, it's a Mr. Miller thing.
So once you got there, what happened?
We were talking, he was asking me questions, and I was telling him, I love him. And I was, kissing on him and hugging on him, just trying to make him feel better. He was really distraught. So he was asking me a lot of questions that I couldn't answer.
Based on how you felt, did he know what happened that day?
So don't answer that question.
Also speculation, hearsay.
Right, sustain.
The questions that he asked you, would they give you the impression that that person knew what happened?
Also speculation.
Sustain.
No, he didn't.
Sustain means you can't answer
Oh,
the
sorry. I
question.
thought
That's
he was
okay.
just
It means Mr.
asking.
Miller needs to do something other than ask you about things that Mr. Poole said or what he said, the impact it had on you.
Did you know, when you saw him that day, how was his speech?
It wasn't the best.
How would you describe it?
Choppy, confused. Just wanted to know.
Okay, thank you.
Mr. Body, any questions for Ms. Poole?
I just there. Good afternoon, ma'am.
Afternoon.
You said you're from Memphis,
Yes, sir.
and I'm gonna fast forward to the second time that you came to Atlanta, when I guess you went home to get the paperwork, correct?
Uh-huh.
And just so Ms. Rivers,
Yes, you gotta say yes or no.
I'm sorry,
That's
yes.
okay.
yeah, very well. Now, can you tell me what paperwork did you actually get when you went home?
I got the insurance paperwork to verify the insurance on the vehicle. I got his birth certificate as well. And I brought some mail with his name on it.
And then you said that you went to, it sounds like a tow yard, correct?
Right, correct.
And when you went to the tow yard, did you also buy a power of attorney that Mr. Poole had signed and gave to them?
No, I didn't. I gave them the paperwork that I got from Memphis, and I gave my ID.
Okay, and you said you were with Mr. Poole's sister?
Correct.
What is her name?
Shanterica Kendrick.
And did Ms. Kendrick, did you see the documents that she brought and provided to the tow yard?
I didn't. She did have paper in her hand, but I don't know what the documents were.
And after you guys provided paperwork to the employees of the tow yard, correct?
Uh-huh.
They let you,
Yes.
they gave you access?
Yes.
And at any point while you were there, did any member of law enforcement, whether it be GSP, Atlanta Police Department, anyone in the police uniform show up?
No.
And the people who, I guess, gave you access to the car, did they work for the tow yard or Fudos, or did they work for law enforcement?
From my knowledge, they worked for the tow yard.
People who gave you access were the people who worked for or owned or were part of the towing business, correct?
Yes.
And when you got access to the car, you said y'all took some bags and things of that nature?
Yes.
And you described that there was kind of fluid all over, kind of mixed together, correct?
Yes,
Blood was mixed with oil, you said?
yes,
And other fluids were mixed with all the fluids, sounds like.
yes.
And can you tell the jurors how many bags from the back seat compartment did you take?
I took a Nike duffel bag and 2 backpacks.
Did one of the backpacks in the back, did it look like kind of like a shark was kind of on it?
I can't recall.
Okay. Do you remember if any of the bags had designs on it?
It could have, I'm not sure.
Okay. And you
I just remember the Nike bag
that's the only one that you knew?
because that was mine. So that's what I knew for a fact, you know.
That's the one you knew. Oh, that was the only one you could associate with your nephew, correct?
Yes,
The other bags that you took were not associated with your nephew, Mr. Poole, correct?
I couldn't at that time, no.
Now, what did you take from the trunk?
Barber cases.
How many?
It was 2.
Okay. And after you took any of the items from the car, did you tell or provide law enforcement with the items that you took?
No,
And you said, I'm sorry, I missed this. What do you do for a living?
I'm a recruiter for a major appliance company.
Okay, so you don't do anything that involves, you don't work for any medical services or things that provide that? Okay. Well, thank you for your time.
You're welcome.
Any redirect?
Ms. Poole, did you believe you needed to notify law enforcement about anything at that time?
No,
And while you were there, initially, when we saw Defense Exhibit 15 with the cell phone, Mr. Poole wasn't on that phone, was he?
no, he didn't have a phone.
Thank you.
Jurors, any questions for Ms. Poole?
Oh, yeah, we need.
Okay. Thank you. I'll be right back. Gotta talk with the lawyers for a quick second.
Okay.
All right, see the questions. This way, please, lawyers.
Court will come to order, remain seated.
Do you have defense 15 in front of you? The one that was only, yeah, that one, okay. Can you tell the jurors when that picture was taken?
On the 10th.
On the 10th. So April 10th, and would it have been morning of the 10th, afternoon of the 10th?
Afternoon, because we couldn't go until after 1 o'clock.
Okay, then that's a great segue into, what was your recollection as to when you were allowed into Mr. Poole's room?
We could visit every day, but it has to be after 1 o'clock. It either was between 1 to 5 or 1 to 7, I can't remember, but it was only for 1 hour per day.
Okay, so when you were there, you could only be there for 1 hour max, and it was within some window of 1 to 5 or 1 to 7.
Correct.
So afternoon, evening of a particular day.
Yes.
Did you go back again, or that was the one day you visited him?
No, I think I visited again that following Friday after we left the vehicle, so I like the 17th or something, 16th or 17th.
Okay, same constraints, you could only be there at some point in the afternoon and only for 1 hour?
Yes.
Okay. Mr. Miller, do you have any questions for Ms. Poole based on that?
No, Your Honor.
Mr. Abadi? Okay, thanks so much for your time. You can leave all that stuff there, the lawyers will come get that. Appreciate it. Mr. Miller, next witness, please.
Defense would call Randy Jefferson.
Do you want the photos of the car and things up there, or do you want to grab are you going to use them with that witness?
Raise your right hand. Do you swear and affirm that the testimony you about to give be the truth, the whole truth, and nothing but the truth? I see. Allow you to clearly go ahead and you're gonna state your name and spell it for the court.
Brandy Jefferson, BRANDI JEFFERSON.
Ms. Jefferson, first, good afternoon. The chair doesn't have wheels. It does move forward. You kind of have to keep it, but that way you're not going to have to lean real uncomfortably into the microphone.
Yeah, I'm already a barber, my back be.
There you go. Thank you.
Ms. Jefferson, how you doing today?
I'm good, I can't complain.
You know Mr. Poole,
Of course,
and how do you know Mr. Poole?
working in the barber shop.
And at this point, how long have you known him?
At this point,
Yes.
oh, it's been a couple years now.
All right. Now, back in 2021, in April, how long had you known him at that point?
About a year.
All right. And did you meet him did you meet him at the barbershop, or you knew him prior to him working there?
No, at the barber shop.
Devin Jones. Do you know Devin Jones?
Of course,
And how do you know Mr. Jones?
barber shop.
All right, did you know him prior to working at the barbershop?
Nope.
Mr. Minor?
Mhm.
Deterius Minor, do you know him?
Yep.
And how do you know Mr. Minor?
Barbershop. And before I came to the barbershop where we came, I knew him from another barbershop too.
From another barbershop?
Mhm.
How, out of the three, who had you known the longest?
Deterius.
All right. How did you see Mr. Minor?
Like a brother. He was like a little brother to me. Okay.
How did you see Mr. Minor?
Like a little brother.
Okay. And how did he view you?
How did what?
How did he view you?
Like a big sister.
All right. What was the name of the barbershop that you worked at in April of 2021?
In the game cuts.
All right. Can you describe in the game cuts to the jury, please?
Yeah, I know. It was very family oriented. We all were, of course, came in under the same umbrella as friends, but we initially became family. So it's really family oriented, for real. We did everything together. We kicked it together. We cut together. We joked together. We stayed late. We stayed just, it was a family, for real. It was a barber family.
And how many barbers could cut in the game at one time?
8.
And so in April of 2021, who were the 8 barbers that were working there at that time?
Me, Scooby, House, Jay Jones, Zorro, KP. At that time, Devo had just came. Who else did I might miss? It could have been John. Spud. That's the 8.
All right. Now, when you refer to House, is his name Corey Williams?
Oh yeah, my bad.
And when you say Scoob or Scooby, is his name Quentin Patrick?
Yes.
When you said Jay Jones, are you referring to somebody by the name of is it
Jamarcus.
Jamarcus Phipps?
Yeah.
And when you say did you say Rob or Spud?
Spud.
What's Spud's name?
I can't think of Spud's real name right now.
Is it
I
Larry
know his name,
Underwood?
but I can't think of it right now.
Larry Underwood?
Larry. That's exactly his name.
Now, around that time, when in April of 2021, how long had Devin Jones or Devo, as you refer to him, how long have you been working at In the Game Cuts?
Couple months, not too long.
All right. Whose place did he take at In the Game Cuts?
DT.
All right. Was there ever a time, and when you say DT, are you referring to Deterius Minor?
Mm-hmm. Yes, I'm sorry.
And was there ever a time where Deterius Minor and Devin Jones worked at the same, worked at In the Game together?
Oh no.
All right.
He replaced him.
Why is that?
He replaced him.
All right.
So DT had left and then Devo came in and replaced his seat.
Okay, so there were 8 chairs at the barbershop?
Correct.
And the chair that Mr. Minor had was the one that Mr. Jones took over once Mr. Minor left,
Right.
correct? In that time, April of 2021, what kind of plans were you all making in the game?
Just to up our level of, our career level. We was already the hottest barber shop in the city of Memphis. So it was just like, all right, let's take our talents to Atlanta type thing. So everybody wanted to, take it to the next level.
Okay, and so for you all, did you believe that that would mean opening up a shop in Atlanta?
Correct.
All right. And on April the 8th, so it's the you remember, the incident that you came here for, correct?
Right.
All right, now on April the 8th, the day before, how were you all going to get to Atlanta from Memphis?
Oh, we drove.
All right, and driving, who was in your car?
Rob and EJ, Eric
All right, who was EJ?
Harrington.
Eric Harrington. And who all was driving down to Atlanta that weekend?
Everybody from the shop, or who was like with me.
Yeah, just who was everybody from the shop was coming from Memphis to Atlanta?
Yeah, but everybody left at different times. But yeah, everybody was going the same place.
All right, was there ever like a caravan where a few people would follow somebody else?
What you mean? You said caravan.
Caravan,
I'm
like,
not objecting relevance.
What's the relevance of this segment of your line of questioning?
just going into the story of what happened that day, how they got to where they were.
Okay, how is it relevant how they got there as opposed to April 9th? We're on April 8th now, so compress. Unless you can tell me how it's relevant, how they got from Memphis to here.
It's going to be a question of one, the time that it takes to get to Atlanta.
How long does it take to get to Atlanta?
5 hours.
Next question.
All right, can I finish my questions?
Nope, I'm asking you to focus on what's relevant, and this whole caravanning thing, I find is not relevant.
Who was riding in your car to Atlanta?
Me, EJ, and Rob.
All right, and what time did you all leave Memphis?
Roughly around 5:30.
All right, did anybody else leave with you all?
Yeah, KP and Devo.
All right, and who is driving that car?
KP.
Did you all stop before getting to Atlanta?
How is
Yes.
that relevant? I'm the one who asked the question. Don't look at Mr. Abate.
Well, I don't understand why you're objecting for Mr. Abate.
I'm not objecting for him. I'm managing the flow of the case. That's my job. And I'm asking you how whether they stopped on the way from Memphis is relevant. If you
I
can
wouldn't like
educate,
to answer that in front of the jury right now.
then ask a different question. Let's get to Atlanta, okay?
It's relevant, Your Honor, but I can't say that in front of the jury.
Ask your next question.
Ms. Jefferson, did you all need to get gas before getting to Atlanta from Memphis?
Yes, we did.
Did you also need to stop for gas in between getting to Atlanta from Memphis?
Yes.
Approximately what time did you all get to Atlanta?
It had to been around 10:30.
All right, what happened once you got to Atlanta?
Once we got to Atlanta, I went to Rob and EJ Airbnb. Went to go check it out, see what it looked like. Just really like kick it. Then we came to Scooby's Airbnb because that's where I was staying. So we came there and not so long after I get there, I get a call from DT to come pick him up. And he texted me the address and all that. Then I left. I went to go pick him up.
All right, tell me this. Your memory of this incident, what is it based off of?
My memory?
Yes.
My brain? Not just messing. My memory. I mean, and screenshots from my gallery.
All right, and so you've got photos that you took to remember this incident, is that correct?
Correct.
All right, showing you defense exhibit 19A through H and 21A through D. Have you had a chance to view the contents of those?
What I said?
Right.
Yes.
All right, and they accurately reflect the photos and screenshots and everything that you took during that time period?
Correct.
All right, would they have they been changed, altered in any way?
No.
At this time, the defense will move to enter defense exhibit 19A through H as well as 21A through D into evidence.
What are the letters on 21?
A through Delta, Alpha through Delta.
Got it. Any objection?
Just to 19H. I think you can use it to refresh your recollection, but I just will get to your side.
Okay. 19H is a photograph?
It's a
It's a screenshot of her phone.
text messaging exchange.
Oh, it's not a photograph of a room or something like that. Your thoughts about 19H, Mr. Miller?
Context of language. Context of conversation. Part of you still.
It would go towards the context of the conversation that she had.
Why don't you get me a hard copy of H and I'll let you know I'll admit all of them, but please don't publish H till I can see a hard copy of it, please. Thank you. You can keep going unless you're starting with H.
The pictures, photos that you took, are they on your, are they timestamped?
Yeah, it should be.
Okay, and the time that's stamped on those, does Memphis have a different time zone?
Yes,
What is Memphis's time zone?
an hour.
An hour behind Atlanta?
Yes,
All right, the times that are on the photos, are those Memphis or Atlanta time?
Atlanta.
All right, we see here April 8th at, what time was that picture taken?
This video
Correct,
in 20.
at 10:20. And where were you all at that point?
Had to be in the Airbnb.
All right, which one?
Scooby.
And while you all were at Scooby's Airbnb, at that time, 10:20, had you already picked up Mr. Minor?
I don't think so. I don't know. Can't remember. I have to watch it to remember. I haven't watched it in a long time.
Now showing you Defense Exhibit 19B. Do you see 19B?
Mm-hmm.
Yes?
You have to,
Yes, I'm sorry. My bad. I didn't know if you was asking me personally or everybody.
who is this in 19B?
That's Scooby.
All right, and was this while you all were at Scooby's Airbnb?
Correct.
And was that video taken shortly after that first picture that we saw?
Yes. So yeah, no. I hadn't went and got DT. I think I just came in playing around and then left right back out.
All right, in 19C, who all is in this picture here?
That's me and House.
All right, and can you tell who that is behind house to the right?
It look like BT, it's good.
DT and Spud?
Yeah,
And was it still at that Airbnb?
yes.
All right. Tell the jury what happened as you all continued to hang out at the Airbnb that night.
We all were, kicking it.
Well, I'm sorry, before we get into that, you said prior to that Mr. Minor asked you to come pick him up.
Mhm.
Yes?
Yes, I'm sorry.
Where did Mr. Minor ask you to pick him up from?
Fifth place. It was over there off Prior Street.
If I this is 1980, Your Honor. Have you been
Okay.
rolling?
Well, now that I understand how you're using it, you could use it to refresh your recollection, but you can't publish it.
All right. It's entered into evidence of it.
It is, it's in the record.
All right. Showing you 19H. What is the address where you were picking?
Nope. She doesn't remember.
Refresh her
You're refreshing her
Oh,
recollection.
okay, yeah.
All right. Now, after having looked at 19H, where is the address that you picked up Mr. Minor?
Kingsborough Road.
All right. And what area of Atlanta? Well, let's do this. Do you live in Atlanta now?
I work in Atlanta.
All right. And how long have you been in Atlanta at this point?
About 5 years.
Okay. Have you become more familiar with the
Now, yes.
places in Atlanta now?
Yeah, now.
All right. At that time, were you as familiar as you are now?
Not at all.
All right.
Not at all.
That apartment where Mr. Minor was, where is that apartment located?
Like Lenox area.
And what's the name of it?
What's the name of what? The apartment?
The apartment.
Time, fifth place.
Okay. And also on that, do you remember where the Airbnb was?
Prior Street, I got it confused.
All right. What was the address to the Airbnb?
210 Prior Street.
All right. So it's right around the corner from the courthouse.
Right.
Now, when you got to Phipps Place where Mr. Minor was, what happened?
When I got to pick him, DT,
Right, to arrive to picking him up, what happened?
I was kind of lost or whatever. So I called him again. I was just like, bro, where you at? Type thing. And he was like hanging out the window, like, hey, this round, I'm finna come down type thing. So I'm like, all right, well, I'm gonna sit here and wait. So I waited and he came down
All right, and once he came down, where did you all go?
to the Airbnb.
Okay. And so you got to the Airbnb, and what's happening at that point?
Everybody was just still turning up or whatever, but school being house decided they want to go to sleep. And me and DT weren't having it. So we was trying to get them to get out and just enjoy some time out.
All right, Scooby and House, age-wise, where are they relative to the rest of the barbers?
Oh,
And how do you all refer to House at the barbershop?
House is like the granddad. Nah, he ain't no granddad. I'm just playing. He's just like, like the manager, like the biggest brother type thing. Like.
And Scooby, how do y'all refer to him?
The boss, basically. Boss,
Boss.
BOSS.
All right, and so you stayed House and Scooby were trying to go to sleep, but you all weren't having that. I'm showing you 19D. Can you see it?
Yes.
All right. What are we looking at in 19D?
That's me, me and DT trying to get Scooby out the bed. Scooby, get your, bruh, get up!
All right. Was that you on the voice we heard?
Yes, it was. Scooby, get your, bruh, get up!
And that person laying in bed, that was Scooby, correct?
Correct.
All right. I'm showing you Defense Exhibit 19E. Now, in 19E, this is another video, but there's some writing in there. What is that writing that's there on 19E?
Scooby tag,
All right, tag for what?
Instagram,
All right, and what time was that video taken, according to your phone record?
126.
AM?
Yes, my bad.
All right, and so at 1:26 AM, you all are trying to wake up Scooby in house. What's happening next?
They eventually give in, and so we all get ready to head out. Well, Devo and KP came in, and
Okay.
then we all decided we let them know what was going on, so we ended up getting in the cars heading to the lounge.
All right, now, before, when you all everybody was there, was Mr. Poole and Mr. Jones at the house, initially?
No.
Do you know where they were?
At that time, no, I did not know. I just knew they was going to do something else because we had split when we got to Atlanta because we trailed each other, but when we got here, we had split. So,
All right, and so, eventually they get to the house, you all get house for Corey Williams and Mr. Jones up, and then what happens next?
Scooby. You said Jones, Scooby. We got Scooby up.
Oh,
But,
that's right, yeah, Mr. Patrick.
yeah. So
What happened?
we all once they came in, we let them know we was finna go. And then we all got to our cars and we headed to the lounge.
All right. Do you know approximately how long it took for you all to get to the lounge from where you were?
I can't remember verbatim.
All right. I'm gonna show you Defense Exhibit 21. In Defense Exhibit 21, who was that on the screen?
That's DT.
All right. And is that once you all got to the lounge?
Yes.
All right. The tags that are all on Defense Exhibit 21, who are all those tags?
EJ, Eric Harrington, Devo,
Do it this way. The @ eclipse, who is that?
EJ, Eric,
And the @ Devo Cuts, who is that?
Devo,
@ DT the Chopper 1907, who is that?
DT,
And the @ Scooby's World 01, who is that?
Scooby,
@ Brandy _ what is that? J the female barber?
that's me.
Did I say that right?
Yes.
Okay. And then @ Rob Marley 901, who is that?
Rob.
All right, now were all those individuals at the lounge with you at that time?
Yes.
All right, and was this on Instagram or Facebook?
Yeah, Instagram.
And the way Instagram works, do you get a notification on your page that shows that you've been tagged in a video.
Yes,
So in this video, you are tagged in it. So you would have received the notification at the time that tag occurred, correct?
correct.
All right, now, in defense exhibit 19G, do you know the name? Is that once y'all finally got to that restaurant, bar, lounge?
You said what?
That video, that's when y'all finally got there, correct?
Right.
And do you know the name of that place?
Yeah, Encore.
All right. Do you know where it's located?
Yeah.
Where?
I can't think of the street right now. Right there by Sweet Lounge and the aquarium.
All right, so right around the corner from the aquarium,
Right.
correct? I'm showing you Defense Exhibit 21A. In Defense Exhibit 21A, at the top where it says Scooby's World, who would have been notified of whose tag was that?
Scoobies.
All right, and for April the 9th, for that mention, what time was that mention done?
2:05 a.m.
All right. This is yours, hottest female barber, correct?
Correct.
And on April 9th, where it says you mentioned Brandy J, what time was that?
2:05 a.m.
This is DT the Chopper 907 on April the 9th, where it says you were mentioned. What is that time?
2:05 a.m.
And then this is Young Risk God, who's Eclipse _ Eclipse, where it says you were mentioned in the story on April 9th, 2021. What time was that mentioned?
2:05 a.m.
All right. So you all are at, what's it called, Eclipse?
Encore.
Encore. You all are at Encore, 2:05 a.m. What's going on while you're there?
We all just kicking it, getting lit. And then short while after, it's like a little window you could see out the out the patio. And House was telling everybody like, "Oh, we getting tickets on our cars, y'all." So he told everybody we was getting tickets and stuff like this. So everybody was like, "I ain't okay now we gotta go," type thing. So everybody, gathered themselves, left or whatever like that. I was about to leave out, and then KP was like, "Sir, I had ordered some wings. Wait on me, right quick."
You said, sir. Is that kind of how they refer to you?
Right.
Like
Like sister. Right.
Okay, go ahead.
So he was like,
Well, before we get there, while you were in there, did you and Scooby get a video?
yeah, we did.
All right, taking you back to 19E. In 19E, what do we see?
Me and Scooby.
And that's inside that restaurant, correct?
Correct.
What time was that?
2:25 a.m.
All right, so at 2:25 a.m., you all are still inside that restaurant, correct?
Mm-hmm.
And
Yes.
That's,
and at this point, Mr. Williams has not said anything about the cars, right?
At that time, no. That was my last video right before he did though.
Okay. What happens next?
Like I said, he was just saying like, all right, everybody from the car type thing. And everybody left out. And I was leaving out and KP was just like, hold on, so I ordered some wings. I'm like, okay, I'll wait on you type thing. Cause once I get lit, I totally forget to even order food. So totally forgot to order food. So I was happy he did. I was gonna eat his food. So we did that. Then when I waited on him, we got the food, we walked out or whatever.
Some of this, while you were waiting with Mr. Poole, did you see where Mr. Minor or Mr. Jones were?
Nah, they was already gone. We was in the lounge still waiting on his food at the bar.
Okay, and Mr. Williams, was he still in the lounge or had he left?
Nah, everybody was already gone.
All right, so what happens?
So it was me, KP at the bar, and we was waiting on his food. Once we got his food, we came out, we was eating his food or whatever like that. Scooby joined, and then
And when you said you came out, where were you all at when you came out?
it's like a side. It was like out to the side street. I don't know exactly the side street, but we came out. It's like a side entrance. It was never a front entrance, so we came out the side.
All right,
So you have to walk around to even come to the front.
and then what happened?
So we was like I said, we was walking around. Then came Scooby, being fat, eating the food too, whatever like that. And then so I was good. So I had ended up walking off. It was a couple females outside and stuff who was, entertaining. I ain't gonna say a couple of us was entertaining. And we ended up getting in our cars.
Okay, at that point, do you know where your car was?
It was parked on the street.
And
I was like the furthest car back though.
do you where did Mr. Poole go?
I left him and Scoopy standing right there.
And then did you see Scooby get into any car?
Nah,
Did you see Mr. Poole get into any car?
nah.
But they were the last two at that restaurant when you
Correct.
walked off, correct?
Correct, because we was last.
All right. What happened next?
We ended up getting in our cars. And like I was telling EJ and them, Rob and them, come on, get in the car, because we was ready to go to the next spot. Well, I think they was ready to go, but we was ready to go to the next spot.
All right, so what'd you do?
We ended up getting in the car, heading towards the next spot.
All right, did you drop off EJ and Rob?
Yeah,
Where'd you drop them off at?
at their Airbnb.
Where she dropped off DJ and Rob.
help me out, Mr. Miller.
Establishing a timeline, Your Honor.
Next question.
You dropped them off at the Airbnb?
Mm-hmm. Yes,
All
I
right.
did.
What's the next thing you remember?
After that, we left and we
Who was we at that point?
well, me, I went back and met Scooby Spud House and all them. We met somewhere, but we ended up going deal with some strippers. And it was a club actually. Ended up going to the little club or whatever, meeting them, and ended up coming back to the Airbnb with the strippers and all that.
All right. What's the next thing you remember?
We was just having fun, and then the sun was coming up. Next thing I know, Scooby was like, hold on, y'all. Like, I got a lot of missed calls, basically from DT mama and I guess Devil mama. And I guess when he called back, like he got he just had the shock face and like broke down and like we all was like
just historic, like, through, so.
What did you learn happened at that point?
Two people were dead, but we didn't know which two.
So where did you all go?
We ended up getting in the car going to, the hospital.
All right, who all went with you to the hospital?
It was me, it was House, Hedman Spud, Scooby. Yep.
All right, were you able to see anyone while you were at the hospital?
No, I did not.
What did you all learn while you were there?
Objection, hearsay.
What did you all do while you were at the hospital?
We just waited outside. We was just crying and waiting. We didn't even know what we was waiting for, but Scooby ended up going in, and we was basically waiting on him to come back out, tell us what it was like.
All right.
But by that time, we had found out.
So don't talk about what you found out unless that's in response to a specific
Okay.
question, so that we can process all that.
So, what did y'all do next?
I don't even know where I just left our feet. We was just waiting.
All right, did y'all eventually leave the hospital?
Yes.
All right, and where did you go then?
When Scooby came back, we ended up going back to the Airbnb, gathering our stuff to leave or whatever like that. And I left my rental car with EJ because I didn't want to stay. They were gonna stay, but I didn't want to stay anymore. I was ready to go back to Memphis. So
Why didn't you want to stay?
I was heartbroken.
Excuse me?
Heartbroken.
All right, so who, EJ now has your keys
Right.
to the rental car? And who drove back to Memphis?
Objection, relevance.
Help me out.
Goes to the dynamics of the, goes to the dynamics of the barbershop.
Okay. Who drove back?
Who drove back?
House.
And whose car was House driving?
Scooby's.
And what happened on the way back?
Nothing. We just was crying. I don't even see how House drove, but he did.
All right, did you ever come back to Atlanta to see Mr. Poole in the hospital?
No, I did not.
When was the next time you saw Mr. Meyer?
When we went to go cut his hair for the funeral.
All right, who all was there?
Me, Scooby. I think Jay Jones. I can't remember who it was, who else it was. But I think it was Jay Jones.
Was Mr. Corey Williams also there?
I don't
I
remember.
don't understand the relevance who went to Mr. Minor's funeral and what they did.
Foundation for some evidence coming in through another witness.
Next question.
So you all went to the funeral, correct?
Yes.
All right.
That was the day before though.
The day before what?
Yeah, that was the day before. They was just going to cut his hair.
All right. And that was your last time seeing Mr. Meyer?
Correct.
Thank you. No further questions.
Mr. Biden?
Good afternoon, Ms. Jackson.
Hi.
Many of the videos that we watched, and I will bring them up, but many of them didn't have timestamp, correct?
Correct.
And you said that you went to pick up PT at some point in the night, correct?
Correct.
You remember what time?
Not the exact time, but it was short after I was at the Airbnb. After I dropped EJ and Rob off. So it wasn't that long after.
And you said something about beginning, y'all were gonna have another barbershop here in Atlanta, right?
Correct.
And prior to this evening, have you been to Atlanta to either cut hair or enjoy the city?
You said before coming?
Yes, prior to that night.
No, I had never. I came a couple times, but not really.
Nothing crazy.
Yeah,
Now, you picked up DT, correct?
yes,
And you drove you and DT in, either, it sounds like it's either your car or the rental car back to the Airbnb.
right.
And, while you're at the Airbnb, before you go to a lounge, does either, does Mr. Poole and, Mr. Jones arrive at the Airbnb?
Later, yes.
At what time?
Right before we walked out to even go to the lounge. So it was literally like right before, literally.
That would have been after, I guess, you guys were messing with, I think it's Scooby, right?
Right,
And, y'all go to the lounge, right?
correct.
And, in the video that you, I guess it's you and I think it's Scooby is my recollection, it's just the two of you guys, in the lounge, remember that video?
Right,
Mr. Poole's not in that video, correct?
right,
And, Mr. Jones isn't in that video?
right,
You don't see, DT or, Mr. Meyer in that video, correct?
right.
And, when you leave the lounge, you don't see where anybody goes, what car anybody gets in, correct?
No, everybody else had already left. I was waiting with KP at the bar.
But when you and, the defendant, Mr. Poole, separate, you go off on your way, and he goes off on his, correct?
Well, no, he didn't walk off. Him and Scooby was still standing right there.
Yes. You don't see Mr. Poole or Scooby get into a car before you leave, correct?
No, because there was too much going on.
It's the only person, or I guess the only people you knew which car got in is yourself, correct?
Right.
Anybody you rode?
And everybody that was with me.
And, you said, and I apologize, you said, once you got lit, you forgot about food?
Yeah.
What do you mean by once you got lit?
We was in the club, so we was drinking and smoking, I guess.
Okay, and so had you been drinking a pretty good amount that night?
A little bit.
I mean, Rob, you're over 21, right?
Right.
And, you, during that night, had you had some drinks prior to going to the lounge?
No, not really.
Nobody drank at the Airbnb?
I'm sure they did, but I wasn't there long, remember?
I'm asking you, did you drink before you went to the lounge?
I said no.
Okay, and, did you smoke marijuana?
I don't smoke.
No,
Mm-mm.
okay. So I guess what were you said once you get lit, what were you using to get lit?
Alcohol in the club.
And, after you, I guess, get finished having wings, you don't see anybody else but the people who ride in your car, correct?
Right. After me and KP and Scooby was standing right there?
Yes.
Yeah, no, I went and kicked it with everybody else that was on the side, like Spud and, everybody else, but they was on the way to the car.
Not KP, right?
Me and KP?
Not KP after y'all separated, right? You
Uh,
didn't with KP after you separated,
No, we did not.
or Mr. Minor?
No, they was already gone.
No.
No, Devo and DT was already gone. I hadn't even seen them no more. They was already gone. Cause his car was somewhere not even parked by our car. So it was gone. They were gone.
Ms. Jefferson, may I ask questions, Judge, on redirect?
Yeah, I was about to say any redirect, but
Ms. Jefferson,
popped up.
Mr. Minor and Mr. Jones, did they go to the car while you all were still in the lounge?
Yeah, everybody had already went to the car. And first of all, it couldn't have been KP because usually KP had his little tassel thing around his neck with his keys on it. Anybody really know KP? He didn't have it on there, so
So when you all were
they were already gone.
when you all were standing outside that restaurant, the I guess the lanyard tassel
Right.
thing that he has his keys on was not on his neck.
Correct.
Thank you.
Jurors, questions for Ms. Jefferson? Oh, okay. Ms. Jefferson, thank you for your time.
All right, thank you.
Next witness.
Our defense would call Jamarcus Phipps.
Stand over.
Raise your right hand. Do you swear and affirm that the testimony you're about to give be the truth, the whole truth, and nothing but the truth?
Yes, sir.
Go ahead and see it. Allow me to clearly go ahead and speak into the mic, state your name and spell it.
Jamarcus Phipps, JAMARCUSPHIPPS.
Mr. Phipps, how you doing this afternoon?
Doing good.
Mr. Phipps, do you go by another name?
Jay Jones.
Would you prefer I call you Jay Jones or Mr. Phipps, or does it matter?
It doesn't matter.
All right.
Let's go with Mr. Phipps.
How do you know Kenneth Poole?
From the barbershop in the game. We was barber brothers.
All right. Prior to him working in the game, did you know him?
No, sir.
How do you know Devin Jones?
This DT, right?
Devin Jones, Devo.
Oh, Devo. I know him from, came in a little bit toward the end. I just know him for a couple months.
And Deterius Minor, DT, how do you know him?
We worked at a couple shops together. World Class, The Cut, and we worked at in the game.
All right, so you've known Deterius Minor for a while.
Right.
And in the game, what were the plans? Why was in the game coming to Atlanta?
Just relocating, just trying to open a new barbershop, just try to, make it, just trying to go to the next level with it.
And did you already have a relationship with Atlanta?
Yes, I lived out here from I was like 19 till I was like 26. And I got a son out here.
So this incident occurred April the 9th, 2021. Do you remember what day you came to Atlanta that weekend?
I don't remember exactly what day. I just know it was a couple of days before they came
And why was that?
to visit my son and the girlfriend I had at the time. We was just taking a little trip.
Where were you staying that week?
Embassy Suites, Far Road, Buckhead.
And when did you learn that everybody from in the game had came down?
I don't remember the exact date, but they just, we keep in touch with each other. They just told me the day they came down. It was like a couple of days after I got here.
All right. What do you remember from April the 8th? What happened that day? Did you go to? Go ahead.
That's the day that they came down.
Right.
Me and Charlotte, which is my ex, we pulled up to the Airbnb they had downtown, and house was standing outside. We went in. Scooby, Brandy, all those that in. DT ended up coming a little later. We was on the rooftop playing little games and stuff for a little while. Then Charlotte stayed in the car, and then I told them I was gonna come link back up with them and I'll take her back to the hotel.
All right. So while they were all there, you left at some point to take your girlfriend at the time back to the hotel on Far Road.
Right.
All right. Do you know approximately what time it was that you left?
I can't recall its exact timing. I don't know if it was like probably 11, 12, something like that.
Okay. And as we sit here today, all of your memory of April of 2021 is based off of what?
What you mean by that?
Do you have any reports or did you write any journals about this incident?
Oh, no.
Any pictures that you remember or that you have from this time period?
Nah.
All right. So it's just strictly your memory is all you have, correct?
Right.
Now, once you left the Embassy Suites, did you meet back up with everybody else?
Yes.
All right. Where did you meet back up with them at?
It was at some like little hangout spot. I don't know the name of it. It's just a little spot where everybody just linked up to hang out at. They sell like, you know, food and drinks, stuff like that.
I'm showing you,
Mr. Phipps, can you bend the microphone down a little bit closer to you?
Yes, sir.
Soft spoken, I'll make sure. we
Okay,
can hear you.
okay, I can talk up a little more.
Appreciate it.
All right.
do you have an Instagram, Mr. Phipps?
Yes, I do.
What's your IG?
It's JJONESMTF.
All right. I'm showing you a video of them, of you all inside the lounge. It's 19G. Oh,
It should be on the screen in front of you. It's ready.
can you see it? Is that club lounge restaurant area that you all were in that day?
Yeah. So,
All right. Do you remember what time it was that you arrived?
probably like, it was late because I didn't stay long. I got there right at the end, probably like 2 o'clock in the morning, something like that.
All right. So that video was when they originally got there at 2:05.
Okay.
How far after?
Objects to the council testimony. Either the witness knows or doesn't know the times.
You know better, Mr. Miller. Don't do something like that again, okay?
Something like what?
I need you all to take an early break. If you would step into the jury room, please.
All rise for the jury.
And Mr. Phipps, when the jurors leave, I need you to step outside.
Okay.
All right, we'll get you right back in here. Just step outside, please.
Jury declared.
Thank you, Deputy. Everyone else can take a seat. Sit down. So let's air it out, Mr. Miller. I don't understand why you have to fight everything. First, tell me what you don't understand about the issue with a lawyer telling the jury. So the evidence is that everyone arrived at the club at 2:05. Does that mean you were there after 2:05? How's that okay?
Just asking a question, Your Honor.
So I just asked a question. Are you going to answer it?
I answered it. I asked a question.
Did that seem like an appropriate question?
To ask that witness, yes.
Tell me how that was an appropriate question to act like that's an evidence, something you know the jury's going to hear when you ask that question.
Because it is an evidence. We've already established through Ms. Jefferson that they arrived at 2:05. He said that he had got there afterwards.
So you don't know what's been established. That's for the jury to decide. The evidence about 2:05 is that a bunch of people were tagged and there was something made at 2:05. Not that that's when people arrived, how long they had been there, but you, through your question, spoke as if it were so. And you know that that's not appropriate. But the bigger issue is the sniping, and it needs to stop.
I've never heard that term before. I'm being serious.
Okay. If I make a ruling, your job is to say, okay, and move on, and not in front of the jury push back on that. You can disagree, that's okay, we can have a discussion about it, but I'm just trying to present my case, that kind of thing. isn't productive, isn't helpful, and isn't the way a lawyer should conduct himself in court, okay?
Your Honor, I've never had a judge continuously interrupt my case as I'm trying to present it. It would be one thing if Mr. Abate was objecting, but Your Honor is simply, I don't understand why you won't let me present my case. And
So what I won't
same
let
thing
you-
with the last trial, I'm trying to assist my client, and Your Honor is stepping in the shoes of the prosecution and not allowing me to do that.
So once today, I interrupted you. I'm not expecting the state to have to object to relevance every single time so that they seem like they're obstructing. I'm free to stop either side if I think something isn't relevant. So you need to roll with my finding that something's not relevant and not pout because someone's interrupting you.
You saying I'm pouting? Come on, Judge.
I don't know what you're doing other than,
Don't characterize me as pouting. I'm representing my client.
okay, well, I'm asking you to do it in a professional way. And right now, that's not what's happening.
I'm trying.
Okay, try harder.
All the evidence that I'm presenting is relevant, or else I wouldn't present it.
So that's not your call. It's not. You think it's relevant. I'm telling you it's not. Okay? And me telling you it's not relevant doesn't mean I'm taking a side. The record should show that Mr. Miller just rolled his eyes and balled his head and looked to the side, but he's not pouting. Mr. Miller, do you think you can comply with my instructions, or do we need to hand the baton to Ms. Bird?
Your Honor, I'm the attorney for Mr. Poole. I will represent Mr. Poole,
Okay. Will you do it consistent with the rules of evidence?
as I have been. Yes,
Will you do it with the rules of decorum in a courtroom?
as I have been. Yes.
Well, you need to do it a little better than you have been because you haven't been doing it consistent with the rules of evidence. Are you ready to start doing that?
Now I'm ready to continue presenting my case.
Anything from the state? You ready for the jury to come back in?
Right, yeah.
All right. Let's bring the jurors in, please.
Before we do that, can we take a break?
No,
You want me to continue after we've just had that?
I do.
You don't want me to calm down? Go to the restroom, get some water.
I'm ready to keep going, and we're going to keep going. If you want Ms. Bird to take the baton, we can do that. Otherwise,
I've
we've got
already
this.
began questioning. I'll continue.
All right.
All rise for the jurors. Your Honor, your call, Griffin.
Thank you, sir. Thank you for your patience, jurors. If we could bring Mr. Phipps back in, please.
Stand here again.
Nope, you can take a seat. Sorry for the interruption.
No
You're
problem.
still under oath, and Mr. Miller is going to continue with his examination of you.
Mr. Jones, do you remember all the exact times during this time period, as we sit here today?
I mean, I don't remember nothing exact. I mean, that's been years. You know, I'm just everything I'm doing is approximate.
All right. Now, when you got to that restaurant lounge bar area, what happened?
None just wrapped it up with them a little while. It wasn't even that long. Then we ended up getting ready to leave because it was something about some parking tickets or something. And then we ended up leaving, but I wasn't there long at all.
All right. So somebody said something about some parking tickets. And then did everybody leave at that point?
Yes, I mean everybody getting ready to leave. I know how I dipped out.
Who did you leave out with?
Well, I shook up, you know, how you I shook up with everybody and left, but then when I was going out, uh Devo and DT was going to get the car and I was heading to go get my car.
All right. Did you end up talking to them as you left?
Yeah, when I was heading out talking to them because they was intoxicated. I don't know what they was on or whatever, but they was and I was just telling them to be careful, you know, because I lived in Atlanta for a long time, so I know how the police is out here.
All right. Where did y'all go? Where did y'all walk to?
Well, we went opposite directions. They car was parked a different spot than I was because I came later than them. So, but I just seen them drive. They came back past me with DT and Devil in the driving the car. Well, DT was driving. Devil was in the passenger.
All right. Did you see Mr. Minor driving the car at that time?
Which one is minor?
DT. I'm
DT.
sorry.
Yes, sir.
And where was Devo or Mr. Jones seated?
Passenger seat.
And why were you telling them just to be careful?
I mean, because, you know, Atlanta police is very strict, you know, and they some, you know, they young guys, so I be just trying to look out for them, make sure they on point.
Before Mr. Minor got into that driver's seat, do you remember laughing and joking, playing with them, anything like that?
Yeah. Just, you know, just because I be trying not to, when, you know, with the young guys, you can't come to them straightforward, like trying to tell them stuff. You got to kind of do it in a way to where they accept it, where they won't, you know, take defense. It's like,
And so what was your approach to that?
I can't remember directly, but I just remember I was just, you know, just kind of joking with them, telling them, no, make sure they just be careful and, you know, get to the house safely.
All right. Where'd you go that night?
I went back to Far Road Embassy Suites.
All right. And how did you, what happened or what did you do once you learned of what happened?
I was actually on my way back to Memphis, so I had to take my girl back, and I ended up coming back out here. But I don't remember exactly what day. I don't know if it was a couple of days or the next day, but I know me and Scooby came back out here together.
All right. And when you all came back out here, did you go to the hospital?
Yes.
And were you able to see Mr. Poole at that time?
Honestly, we didn't. I don't know why we couldn't go up there or whatever, but we had snuck up there to go see him.
All right. And what did you see once you snuck up there?
Well, I heard him, they was changing his bandages and stuff, and he was like hollering or whatever. You know what I'm saying? 'Cause I guess he was in a lot of pain. Yeah.
All right. About how long was Mr. Patrick with you when you snuck up there?
Yeah.
And about how long were you all up there, with Mr. Poole at that time?
I don't want to give no direct time. I'm not sure. I can't. I don't want to give no direct time. We was up there for a little while. I don't know exactly the time.
All right. And that time you went when they were changing the bandages, that was the only time you went to the hospital and was able to see Mr. Poole?
Yes, sir.
All right, thank you.
Mr. Rao?
Yes, sir. Good afternoon, Mr. Phillips.
How you doing?
All
right.
So, Mr. Phillips, I'm gonna be complete with you. You were in Atlanta, 2 days before meeting up with everyone, from the crew in Memphis.
Yes, sir.
Okay. And you were with your girlfriend?
Yes, sir.
You weren't staying at the Airbnb?
No, I always do my own thing. You ask everybody in the shop, like I always, I always do my own thing. So yeah.
But that night, you went to the Airbnb?
Yeah.
And you don't remember times, it's been a minute.
No, I don't remember no exact times.
Right?
Right.
So you went there around 11, 12 PM, or
Yeah.
11 PM, 12 AM, as you previously testified?
Yeah, because I probably was there about longest, probably about 45 minutes. I had to take her back to Buckhead. Then we went to wherever that bar. I went wherever that bar was. So right.
You didn't go straight back to the Airbnb, you went right to the lounge or bar wherever you all met up later that night, right?
Right.
And, when you got there, you didn't stay there too long.
No, sir.
That was because everyone was like, oh, the parking people are coming, booting, towing cars, right?
Right.
And, eventually you, saw, who you described as, DT and Devo, go off to a car, right?
Right.
Okay. You didn't see, the person you know as KP, the defendant, with them at that point?
Nah, he wasn't with them.
And, you just had some conversation, you don't have to get into any of the contents of the stuff that you said, but you all had a conversation. And eventually you saw DT, in the driver's seat and, Devo in the front passenger seat, right?
Right.
Okay, and after that, you left.
Right.
Okay, and you left by yourself, you didn't have anyone else with you?
No, I by myself.
You didn't see KP go into that car, right?
No.
You had already left at that point in time.
Yes, sir.
Thanks, sir, I appreciate your time.
Mr. Miller, anything else?
No, Your Honor.
Jurors, questions? Yes. Thank you. Counsel?
How are you? Hello. That's bad.
Did I say that? I said.
Court will come to order.
Mr. Phipps, you had mentioned that when you saw DT and Debo, is that? Devo.
Yeah.
When you had seen DT and Devo, this is on your way out of the club, you encountered them, they were going to a car and you're going to yours.
Right.
That they had seen, that I don't remember the words used, they were intoxicated or tipsy. You were concerned that maybe they shouldn't be driving. Did you see what they would have been doing inside the club to have been in that state, whether they were drinking or smoking or whatever?
No, I was just, I mean, somebody, somebody just got, intoxicated or something,
Yeah.
so that's all I knew. I don't know I don't know if they were smoking weed or drinking. I don't know what it was.
Okay, you just saw the consequences of whatever they had been doing. Said, look, you guys, be smart, be careful.
Yes, sir.
Okay, thank you. Mr. Miller, anything else for Mr. Phipps?
No, yeah.
Mr. Rao?
Okay.
All right, Mr. Phipps, thank you for your time.
All right.
Next witness?
Yeah, this witness does have the potential for
The Henderson situation?
Correct.
Okay, I'll allow you to explore that with that witness.
Thank you. Defense would call Quentin Patrick.
Although, Mr. Miller, this would be an area where instead of asking a question with some content in it, if you're not certain what he knows about the situation we've discussed, the Henderson situation, it needs to be very open-ended so we learn what this person knows and it's not you filling in the blanks about what that situation was. That make sense?
No exploring?
No, you're
Or
welcome.
no prompting?
No prompting.
Can we, either outside the presence of the jury back there or in here, get clarity, because the state has some objections.
Sure. I know we just brought you in here. I'm gonna have you sit tight for 1 second. I gotta talk to the lawyers about something that just came up, okay? Sorry about that. That's is that. Someone else do.
The court will come to order for Mr. Kennedy.
All right, I'm sorry for the little disruption, but we had to talk about something that we sort of worked through, but we're gonna now get started with your testimony. So if you could stand up and the deputy's gonna administer the oath.
You swear and affirm that the testimony you give. Now, go ahead and state your name and spell it.
Quentin Patrick, Quintin, Patrick, Patrick.
Patrick. Good afternoon, sir.
How you doing?
How you doing today?
I'm all right.
Patrick, how do you know Mr. Jones, Mr. Devin Jones?
He was one of my former barbers in my shop.
All right, and you said one of your former barbers. Are you the owner of In the Game?
Yes, sir.
Can you tell the jury about In the Game?
In the Game is a shop in Memphis, Tennessee. Had like 7 barbers, 8, including me. Young, most of them young. Me and my manager, Corey Williams, he's the oldest. Me and him, we pretty much the oldest. Everybody else young, talented, just a fun group of people.
And what were the kind of clientele that, tell them about your barber.
Oh, yeah, we range from having anywhere from celebrity clientele to all the way to, I'll just say like normal, regular, everyday people, working 9 to 5 people. Celebrity clientele, we had pretty much everybody, all races, black, white, Chinese, Mexican, whatever, whoever needed a haircut, they were welcome in my establishment.
How long has your shop been in business back in 2020? When did you open? Let's do it that way.
Opening, when did I open? He had been in business like 4 or 5 years at the time, I think. 4 years, I want to say.
Now, Mr. Jones, how long had he been working at your shop?
A couple months, probably like a couple months. Yeah, prior to the incident.
Do you know Kenneth Poole?
Yes.
How do you know him?
I've been knowing Kenneth for some years prior to him working in my shop. He was like just a barber that, upcoming barber that kind of, I would say, looked up to me. I think I cut his hair for his prom, and you know, just hearing her like that.
What did you call
KP.
All right, was that the name that most people refer to him as?
Yes, sir.
All right, now, Mr. Poole, do you know Deterius Minor?
Yes, sir.
How do you know Deterius Minor?
This is my cousin.
All right, now, Mr. Minor, that's your cousin. How long have you known Mr. Minor?
Ever since he was in his mama belly.
All right. What was your, we haven't heard a lot. Jury hadn't heard a lot about Mr. Minor. Can you tell the jury who Mr. Minor?
Mr. Minor was, this my little cousin, he was smart, mannerable, respectful, talented, just a cool relative, a cool cousin.
He look up to you?
Yeah, he looked up to me. I was more of his big brother figure to him, more than versus a cousin.
Did you kind of look after him?
Yeah, I looked after him a whole lot, like a whole lot.
Now, how many barber chairs were in the game?
8.
Was there ever a time in the game where Mr. Minor and Mr. Jones worked there at the same time?
Nah, by the time when Mr. Jones came, DT had already transitioned to Atlanta, so he kind of like took his station. He replaced his station.
So the station where Mr. Minor had previously worked at was the one that Mr. Jones was working at this time?
Yes, sir.
Now, do you know Miss Martin?
Ms. Martin.
Yes. Mr. Jones's mom.
Yeah, I know of her.
All right. How do you know of her?
Once I got to know her after the passing of Mr. Jones.
All right. Prior to the passing of Mr. Jones, had Ms. Martin ever came to your barbershop?
Not as I can recall.
All right. Prior to the passing of Mr. Jones, had Ms. Martin ever brought Mr. Jones's son into that barbershop?
I can remember a time she did.
Okay. And was there a time where she was not allowed at the barbershop anymore?
Yeah, honestly.
Can you tell the jury what happened, why?
It was just a situation where I feel like it would be more appropriate if she wasn't there, because due to the fact of the situation that happened, that was going on, that we here for now.
Now, when you were during this time, what was your plan for in the game?
Really to relocate, for everybody to like come out here to expand our, just expand the business.
And was everybody from in the game going to come to Atlanta together to open up this new shop, or what was the plan?
Yeah, we was everybody, but a couple of them were gonna not move, but a majority of everybody else was. We all gonna move here.
All right, and the weekend of April the 8th, 2021, did you come down to Atlanta?
Yes.
All right. Who was in your car coming to Atlanta?
Me, House, and in my truck. I drove my truck. Me, House, and Spud.
All right. Did anybody else take turns on that ride down?
I think House I think we probably swapped out. We always pretty much do that all the time,
And
especially on the road trip. So
how long is the drive from Memphis to Atlanta?
5 hours.
Where were you all staying?
I had got an Airbnb.
You know where that Airbnb is?
I think it's not too far from here actually. I think Pryor Street or Trinity Pryor, something like that. I remember saying Pryor Street.
Why is it stuck in your head that it was somewhere close to here?
Oh, because of that Fulton, the little bridge walkway thing where it say Fulton. Because I remember seeing it like I just remembered it because that's one of the main like things I remember seeing. Of course, it's big with lights, so.
What happened once you all got here?
Once we got here, I don't know if we went to get something to eat first or we pulled up to the barber shop where my little cousin was working at. It was in one of those orders. But I know.
Your cousin, are you talking about Mr. Minor?
Yeah, Mr. Minor.
Do you know? So, he was already working in Atlanta when y'all were coming here this weekend.
Yes, sir.
All right. Any idea where that barbershop is?
It was I don't know to consider it north, south, east, or west, but it was like in the Chambly area. Chambly, yeah.
And what happened once y'all saw Mr. Minor at the barbershop?
We kicked it for a little minute. We just lounged around and he kind of like introduced everybody to the barbers that was in the shop. And I had a partner work there, so I already knew somebody worked there, which is actually how DT ended up working there.
How long were y'all there?
I can't recall. I can't recall the time, but we kicked it for a little minute.
All right, were you waiting on something?
Yeah, we were kicking and waiting on my Airbnb to get ready.
Check in?
That's the thing. We was trying to get a room, but we weren't able to. We were stuck in between getting a room and getting the Airbnb, but the room had ended up, we weren't able to get it. So my Airbnb plug kind of came through for us. And once he finally called and said everything was arranged and everything, then that's when we finally hit it on over there.
All right, you know approximately what time y'all got to that Airbnb?
Nah, it was a little later out through the evening though.
All right, and what happened once you all got there?
Well, really kicked it. We just chilled because we had been out on the road all the day and just out and about. We were really ready to settle down and just, chill for the night and get ready for the next day.
Showing you when y'all initially got to that Airbnb, who all was there?
Me, Spud, and House.
All right, and then did people just kind of start trickling in at that point?
Yeah, that was later on though. That was later on through the night.
All right, so approximately how long were you all there before everyone else showed?
Maybe a couple of few hours.
All right. And you were there for a couple of hours. Tell George what's going on. What happened?
We was at the me house, Spud. We was at the Airbnb. So as I remember, Spud, if you know Spud, you know Spud. He I ain't gonna say wild, but he Spud. he ended up meeting some chicks that was at the Airbnb. So come to find out they worked at a club with them. I don't know if it was Magic City, but y'all know what Atlanta about. So they worked at the club. So I end up by this time I done got tired. So I done end up dozing off, me and House. Cause we like the older guys, you know what I'm saying? Plus we had been out all day. So I end up dozing off. I went in my room, I ended up dozing off, going to sleep, and I think House had ended up going to sleep too. And Spud, I guess he was just sitting up players or doing whatever he was doing. But I ended up dozing off and Brandon, I think Brandon had ended up calling me or something like that, trying to ask me to go out. But I was like, no, they ended up popping up anyways. So they ended up popping up anyway.
You said they, who was that?
It was Brandon, my little cousin.
Brandon
and DT, they ended up like popping up. Cause Brandon, she was gonna stay at the Airbnb. She was gonna be staying at the Airbnb too. So Brandon had already knew what Airbnb was at. That's how they ended up just popping up. So they came and I remember Brandon trying to get me she was trying to wake me up. And I'm like, man, I ain't with it. I ain't going. I ain't finna go nowhere. So her and my little cousin, they kept on shaking me, and they like literally like pulled me out the bed. And I'm like, man, okay, I'm gonna go. If House gonna go, if Corey Williams gonna go. So Corey decided he was gonna go too. So we ended up, putting our stuff on, but we were waiting on KP and I think it was was EJ with them? No, KP and Devo and them had pulled up. I'm trying to see if EJ was with them too. Anyway, it was like at that point it had become the meeting area for us to go and get to go out and everything. So we ended up leaving. I don't know which order we left. I don't know like who left first and how everybody left, but I know I ended up
When you said leaving, at that point, y'all are leaving to go where?
to a lounge. We ended up going to a lounge that Brandon them said, that they had looked up or whatever for us to go to.
I want to show you Defense Exhibit 19D.
Scooby, get your, bruh, get up!
Yeah.
Remember that?
Yeah, that's it. That's exactly it right there.
Oh!
That's me under the blanket.
All right, so that's you, and that voice we hear, is that Brandy?
Yes, sir.
Okay. Now, at this point, approximately looking at Defense Exhibit 19E. In this, I stopped the video, but that writing that's on there, who was that?
The writing is on the video.
Yeah, what does it say?
The date, as far as the date and the time.
Well, that's actually inside the video,
Okay.
the @ sign.
Oh, I can't see on the screen. Oh, this is my name. This is my this Brandon say I'm lame as hell for not wanting to get up. That's my Instagram.
Okay. And at the top, what time was it that she was waking you up?
1:25 a.m.
Mr. Patrick, you press the stay muted button. That's what the jurors were trying to tell you.
My bad. Okay. All right. I can see it now.
All right, you're able to see it on your screen?
Yeah, I can see it now.
All right. Now, you said that you all eventually left. Where did you go?
We went to the lounge.
All right. Do you have any clue what the name of that lounge is?
Nah.
All right. What happened when you got to the lounge?
We was in there just vibing out, just kicking it, just doing what we doing.
But how long were y'all there?
It wasn't that long because when we got there, as we in there chilling or whatever, I know House ended up recognizing some the way we were parked, we weren't supposed to be parked there, obviously. So House, he was like, man, it's some cops outside putting tickets on cars. I don't know if they were cops or if they was like the ticket people. But I know we weren't trying to get booted or get no ticket. So when House said that, everybody, we were like, man, we finna roll. We were late anyway. So I don't know how long this spot stayed open, but I know it was pretty late anyway. Then I was kind of like, didn't want to go anyway. So I'm like, okay, bet this is my excuse to go on here to get back in the bed or whatever. So we just gathered up. We gathered up, got ready to go to get ready to go to our cars and stuff. But I remember Brandon them, they was over there about a little bar thing where you can order.
Yeah, who?
Brandon KP. Okay. Where you can order the food at. They over there. And I think Jay Jones, he finna get to tell us he was finna get to go. Cause I know he was by himself. So Jay Jones, he ended up like standing to the side or whatever. Like I think kinda like walking off. He was like walking out. But they were standing there waiting on, they was at the bar ordering that stuff. At that time, I didn't know what they were ordering, but I guess obviously they were ordering some food because that was KP came out with his wings. He came out with some wings.
Okay. So when he comes out with the wings, where are you standing at that point?
We were standing in like it was kind of like the little front thing because we had to go out the side. So we were standing like in like the front of the building, like.
All right. And where is Mr. Minor and Mr. Jones at that point?
At that point, all of us was like at the group that we was at, it was some girls, it was some chicks right there. I never forget they had like these chicks. And they was,
Hey, you're talking about Mr. Minor and Mr. Jones.
yeah, they were walking on with the girls. They were walking towards the cars with the girls. And House had got my kids and went on so he can get my truck. Cause we had to go ahead and move the cars, you know what I'm saying? Because we weren't supposed to be right there. We were trying to get no ticket with them. So we standing right there waiting on well KP. By the time KP had got his food or whatever. So we out there eating. I'll never forget, I'm all in KP box, you know what I'm saying? And me and Brandy. And we kind of like playing around. He like, man, watch out. Like, move, bro. You know what I'm saying? I'm like, man, let me get one more wing or whatever. So I don't know what the piece was. I don't know if it was no 5-piece, 10-piece or whatever it was, but you know, I was trying to get some wings because I had, you know, wanted some wings or whatever. So they had DT them, they were gone to the car. So right there, it was me, Brandon, and KP standing right there. I know Jay Jones had walked on. He had walked on like on somewhere else. He had went on somewhere else. So
Okay. So in this video here, Defense Exhibit 19E. Who's in 19E?
I see Brandy right here.
That's who?
Brandy.
All right. And who's that behind right there?
This me.
All right. And at what time was this when Brandy took this video?
2:25 a.m.
All right. How long after that video, if you know approximately, was it before
We started to leave out.
said it's time to go?
It had to be like shortly after that. It was shortly after that.
All right.
Because I don't even remember getting me another drink after then. Because I had that one drink right there and I don't remember getting another one. So
okay, so at that point, is that when Mr. Poole went to go order his wings?
yeah.
All right. And so you all walk outside, you're playing around with the wings. What happens next?
Last thing I remember is we standing out there, House pulled up in my truck. House pulled up in my truck. I got a black Yukon. He pulled up in my truck and KP had a white Infinity. He pulled up, the Infinity pulled up. So by this time, I just went hopped in my driver's seat. You know what I'm saying? I'm ready to go on, get on there. Now I hopped in I hopped in the passenger seat. Spirit kind of hopped behind me. So when the car pulled up, at this point, I can't see, like, I ain't gonna say I wasn't paying attention to it, but I just know, I know the car, whatever. I know these my people right here. So once everybody gathered in the car, we rolled to the light. I rolled my passenger window down. My little cousin rolled the driver window down. And he be like, where y'all finna go? We asked him, what we finna do, what we about to do, because Spud, remember earlier, Spud had the girls with up, the strippers. Spud had been setting up a play for us to go back to the Airbnb and I guess have a stripper party or whatever. So we trying to ask them, is y'all coming back with us or is y'all finna go do what y'all do? But they were like, they finna go do what they do. So told my little cousin them, told them we gonna holler at them and everything. They went their way, we went our way. And that was the last I heard from them. The last thing I remember is getting a phone call, some missed phone calls from my auntie. And that's when, why we here now.
Now, when you all pulled off from the restaurant lounge area, you said you stopped at a light.
We stopped at a light. It was a light. I'll never forget, we pulling up to the light and we rolled the windows down and we were just telling saying we were finna go, trying to figure out what was the next move.
All right, you said your cousin rolled his window down.
My cousin rolled the driver window down because the truck facing this way and the car we facing this way. So I'm on the passenger side. So this is my window, which means the driver window is on the same side that I'm on. So we rolled the windows down and we just, politicking. What y'all finna do? What's the move? What's the next move? Though? So we did that and that was that on it. And That's all I remember.
You know approximately what time it was when y'all left that restaurant lounge?
Probably, I don't know, probably like, I have to say probably about 3, or probably a little after 3 or something, like 3 or somewhere around the time, cause
Okay. And then the next thing you remember is getting that phone call at 5.
yeah, that's next thing I
Not the next thing you
remember.
remember, but
Yeah,
now, when you received that call, what happened?
man, I started going, man, nuts, cause I didn't know who passed. I just heard 2 people pass. I didn't know who it was. All I knew, I just lost 2 important people. Then no matter who it was, I just know I lost 2 important people. And I'm like,
You were close with everybody that was in there.
yeah, absolutely everybody.
All right. So, what'd you all do next?
We ended up going outside. That's another why I remember that Fulton sign, because we were pacing up and down the street. I was pacing up and down the street. We were hollering. We were crying, going crazy. And I just remember that Fulton sign right there. So we end up, once I finally got the call of who it was, we ended up going to the hospital. We ended up going to Grady. We ended up going to Grady. Pulled up to Grady. About this time, it was getting light. The sun was coming up. So it's kind of like brighter outside. So I was trying to go in the hospital, but I couldn't go in the hospital. So once everything, was found out or whatever, who was who and who all had passed, my auntie asked me if I could identify my little cousin's body because she was in Memphis. And I was just like, I was like, I can't do it. Not being in a, rude way, but it was like more of a mental thing. Cause like this my little cousin. I've been knowing him my whole life. So I'm like, nah, I can't do it right now. At this moment, I couldn't do it. I just couldn't do it.
Okay. So, did you all eventually leave the hospital?
Yeah, we left and went back to the Airbnb.
Were you able to see Mr. Poole while you were at the hospital?
Nah, not that time.
Do you know why?
I guess because he was the condition he was in, whatever.
And so you go back to the Airbnb, and what do you all do next?
Started to get our stuff so we can get to go back. And Brandon, she ended up riding back with us because Brandon, all of us were hurt and going crazy. But Brandon's a female, and her and DT, they were like her, look, they were like this. So she ended up riding back with us.
Okay. And who drove on the way back to Memphis?
House drove my truck on the way back.
All right. Did you ever come back to Atlanta?
Yeah.
Who came with you?
Me and Joe Jones. One time, me and Joe Jones came back. I came back twice.
All right. And what did you come back for?
To CKP to check on him.
Did you get to see Mr. Poole?
Yeah.
What happened?
Yeah. We went to the hospital. They told us we couldn't go in. But if y'all know how great has made, it's like some double doors. We was able to wiggle our way in there some type of way. And we already knew what floor was on and everything. So we ended up going in there. So once we snuck, we snuck in there, I'm be real with you. We snuck in there, and once we got in there, the lady, she was like, y'all know y'all, I ain't supposed to be here, but she said, well, since y'all in here, I'm gonna let y'all go, just stay or whatever. So we sat there with KP for a while. He was just laying there though. He had some grease stuff over his eyes or whatever. And all the other stuff. And then a nurse came in there and he had it was like a big old thing on his leg, like a wide open scar or something like that. So I don't know if they put the bandage, the cloth part directly on his skin, but it was like it had kind of like dried up on his on the soil, and they were trying to peel it off, and it's like KP was like he was just going crazy, like you can hear him hollering, you can hear the pain in his voice, put it like that.
While y'all were sitting in there in the room with him, was he talking a lot?
Nah, I don't even remember him even talking, cause he was
All right, and do you know about how long y'all were there in that hospital room with him?
I know probably like 4 to 5 minutes, then the lady ended up coming in there telling us, she was like, all right, now y'all got to, you know what I'm saying, probably, y'all got to, you're leading up. She said we had to leave because they was going to get her to switch the shifts, and it was going to be somebody else recognize us in there anyway, so.
So you left the hospital, was that the first or second time you went to see him?
That was the first.
All right, did you go back to the hospital?
Yeah.
What happened that second time?
Well, the second time I went, he was still in the hospital, still in a bad condition, but his eyes was open. You know, his eyes was open then, but he still was like in and out of it.
That how much time had passed from that first time you went to the hospital to see him to that second time?
I don't know, probably like, I don't know, I'd say 2 to 3 weeks or something like that.
And that first time that you all went to go see him, did he open his eyes at all while you all were there?
Nah, cause that was like kind of like right after it happened.
Now, when was the next time that you saw Mr. Minor?
Alive. Well,
In the sequence of events that happened.
when I cut his hair at the funeral home.
And who was with you at that time?
Me, Brandy, I think Jay Johns were in the house.
Did you take a momentum with you?
Yeah, I had cut some of his locks off. I could like.
Sustained.
Now, as we sit here today, the story that you just told this jury, any reason for you not to tell them, any reason for you to lie?
I'm gonna object to improper bolstering.
Sustained.
Nah, I don't have no reason.
I sustained, so he's gonna ask you a different question.
Okay, my bad.
All right.
If you saw someone other than Mr. Minor driving that car, would you say something about it?
Yeah.
Thank you. No further question.
Mr. Bynum?
Yes. Good afternoon, sir.
Good afternoon.
I'll keep it brief. You saw a shop in Memphis?
No, so I'm in Atlanta, Georgia now.
Did you open a shop in Atlanta?
Yes, sir.
Decent free advertising with them.
Okay.
Now, you said you came into Memphis with all your friends at the barber working in the shop, correct?
You're correct.
And during that night, you and your friends had been drinking and smoking other things, correct?
Everybody else was. I had to drink. I don't smoke.
Okay. So everybody else who was there was partaking in the activities and fun.
Yes, sir.
Including the defendant.
I don't know.
Objection, Your Honor. Relevance?
I wouldn't know anyway, because
Well, don't answer yet. Overrule.
You can answer. You wouldn't know anyway.
no,
How come?
because I wasn't just paying. I was paying attention to me, and
we saw. I think it was Brandy. You said it was your cousin waking up, right? Yes.
Yes, sir.
And do you remember? Did you guys go directly to the lounge?
I think we did.
Okay.
I don't just remember we stopped and got some gas. I don't remember we stopped by the store to do this or that, but I remember us going. We surely went to the lounge.
You'd agree. You're, I guess, remembering at the time. It's all approximation, right?
Right.
And you'd agree it's been several years since you came to Atlanta and I guess spent time with everybody at the lounge, right?
Right.
Now, you said later, after you guys were leaving, you said you were in the passenger seat of your truck, correct?
Yes, sir.
And you said your cousin DT rolled down the driver's side window, right?
Yes, sir.
And you had some sort of exchange, right?
Right.
And after you looked in your car,
Me, Spud, and house. Corey. Yes, sir.
and after your car, I guess left and drove away, you never saw the white Infiniti again, correct?
Right.
You don't know where that car went after you saw it stop, correct?
Correct.
You don't know who was driving that car after you drove away, correct?
Right.
And when the vehicle, the white Infiniti was in a high-speed chase with the Georgia State Patrol, you have absolutely no idea who was driving that car.
Right, correct.
Can you, isn't it true, you also, you don't know how much time passed from when you saw, the white Infiniti with everybody in it to when, the white Infiniti crashed into a wall on Athletics Road, right?
Right.
Now, the information that you, told us about, DT rolling down the window, you never, a month later, called, any members of law enforcement, correct?
No.
And, you own the shop in Memphis, right?
Correct.
And in June of 2021, Mr. Poole, the defendant, was arrested inside your shop, right?
Right.
And after Mr. Poole was arrested, and you learned the reason for his arrest, you've never called police and told them about what you just told us as relates to your cousin rolling down the window, right?
Right.
And you didn't tell them a year later, right?
Right. Because there wasn't like no information that I felt like I should I say volunteer, or I didn't even know that I would be part of an investigation that's going on like this. So, you know, all I know is I lost my little cousin, I lost my close friend, and my other friend was in an accident. That was I was in a bad accident. So this is more like of a mental and emotional thing for me versus, you know, the point you're trying to make. So it's kind of like, it kind of weighed on me a little different.
Mr. Miller, any redirect?
Yes, Mr. Abate asked you on cross if you had ever went to law enforcement and told them that Mr. Minor was driving that car when they were leaving. You remember that?
Yeah, he's an expert.
Did you think that you needed to go to law enforcement for that?
No,
Did you think that this was gonna go this far?
not at all.
Thank you.
Jurors, anyone have a question for Mr. Patrick? Thank you. Counsel?
We'll be right back.
Court will order, remain seated.
Mr. Patrick, do you recall if there was a logo or some kind of writing or something on the hood of Mr. Poole's white Infiniti?
Nah, he had a logo on the rear window.
On the rear
I
window?
can remember.
Okay, and what do you remember being on the rear window?
It promoted his barber brand.
Okay, so it was like an advertisement
Yeah.
for it, okay.
Yeah.
But it was on the rear window?
Yeah, there's
Got it.
like one thing I always used to talk to them about, like doing anything to promote their business, and that was like something he took in consideration and ended up doing.
Okay. Explain to the jurors why Devin Jones replaced Detarius Minor's station in the shop.
DT, we had ended up taking a trip out here before, and he liked it, and plus he was just ready to switch it up. He ready to get from Memphis and come down here, and he was just ahead of the game from what everybody else was trying to do.
So he stopped working there and you had a spot and
Yeah.
Devin took that?
Yes, sir.
Okay. On a scale of 1 to 10, 10 being the most intoxicated you've seen them, 1 being not at all, what level of intoxication would you say that Mr. Poole had the last time you saw him that night?
Like I said, I don't even remember, because I don't even remember the sequences of the drinks and smoking, what everybody was doing in the lounge we was in.
Okay.
It was late. I was there, but I wasn't, I was ready to go.
Okay. Same question about DT, Mr. Minor. How would you, on a scale of 1 to 10?
I wouldn't even know.
Same answer.
Same answer.
Okay. And how about Devin Jones?
Same answer.
Okay, thank you. Mr. Miller, do you have other questions for Mr. Patrick?
No, Your Honor.
Mr. Abadi?
That's it.
All right, Mr. Patrick, thank you for being here.
All
I
right, thank
appreciate
you.
it.
All right.
Ladies and gentlemen, I need to give the lawyers a quick break. You've had a couple because we've taken some breaks, but it's going to be your break as well. We've got at least one more witness we can get through in this bonus hour you've given us. We'll see if there is an additional, if we can get to the additional one and if that person gets here. But let's take about 5 minutes so the lawyers can refresh. If you need more time, let the deputy know. But while you're taking this break, please don't talk about the case or do any outside research, and then we'll reconvene. Okay.
All rise for the jurors. Clear, yes.
Thank you, sir. Mr. Miller, anything before we take a quick break?
Nothing from the fence room.
Mr. Body?
There.
All right. We'll be back shortly.
Just thank you, everyone. I know we're after 5. We've got Mr. Poole and his lawyers here, our prosecutors. Mr. Miller, are you ready for the jury?
Yes.
Okay, and you are calling Mr. Underwood next?
Corey Williams.
Mr. Williams next. Okay. Is he around?
Yes, you're on.
Yes.
Yeah, he's right.
Okay, great. Mr. Body, you ready for the jury? All right, let's bring him in, please.
All right, for the jury.
All right, we've got everyone. Mr. Miller, if you'd call your next witness, please.
First, we call Corey Williams to the stand.
Please try to face me and raise your right hand. You swear or affirm that the testimony you give today is the truth, the whole truth, and nothing but the truth, so help you.
Yes.
And take your seat. I have you state and spell your name for the record.
Corey Williams,
And spell it.
Can you spell your first name?
Cory. I go by Big House at the shop.
Mr. Williams, how you know that?
Good.
When you told us that you go by Big House, how do they refer to you at the barber shops?
OG or Unc.
And kind of what was your role at the barber shop other than cutting hair?
Part owner, manager.
And while you were there, did you know somebody by the name of Deterius Minor?
Yes,
Did you know somebody by the name of Kenneth Poole?
yes,
And someone by the name of Devin Jones?
yes.
All right, can you tell the jury how you knew Mr. Jones?
Well, he took DT's place after he left. He was a newer barber, but him and KP were friends.
And Mr. Poole, is that who you were referring to when you said KP?
Yes,
How did you know Mr. Poole?
I've been cutting hair with him for a while.
And Mr. Minor, what was your relationship with Mr. Minor?
It was the same as most of them. He was another barber, but we was pretty close.
You referred to him as your nephew.
I did.
Going to April 9th, 2021. We kind of talked about the barbershop, but if you could give your impression of the kind of service and what that barbershop brought to the community of Memphis.
I'm gonna object to relevance, Your Honor.
Sustained.
Going back to April of 2021, where were you working at?
In the game,
Are you do you live in Atlanta or where do you stay?
no, I live in Memphis.
All right, and where were you coming to Atlanta that weekend?
Yes,
And what was the purpose?
just hanging out and scouting out new buildings for another shop.
Who did you come to Atlanta with?
It was myself, Quentin Patrick, and Larry Underwood.
All right, and when you say Quentin Patrick, what's his alias for Mr. Patrick?
Scooby.
And for Larry Underwood, what's his alias?
That's Spud.
All right, how long is that drive from Atlanta to Memphis? Or from Memphis to Atlanta?
About 6 hours.
What happened? What time did y'all leave that morning or that day?
Roughly around noon.
And what did you do once you got here?
We went checked in the Airbnb, and we had end up going to see DT at the shop he was working at.
You remember where that shop was?
No, I don't really know my way around Atlanta.
And who went to the shop to see Mr. Minor?
It was Scoop, myself, Spud.
And how long were y'all there before leaving?
Probably about an hour.
All right, what did you do once you left?
We got something to eat and headed back to the Airbnb.
Okay. What happened while y'all were at the tell the jury? It's your story. Tell the jury what happened that day.
Well, we was hanging out at the Airbnb. Man, we was kicking back, we drank, smoked a little bit, and we're just waiting on everybody to assemble so we could, just kick back at the Airbnb. We was kicking it. What I mean by kicking is just hanging out.
Who all was there initially at that Airbnb?
Me, Spud, and Scooby.
All right, eventually, did people start showing up to the Airbnb?
Yeah, the rest of the team started to pull in a little bit later.
Okay. And what happened next? And before you get started, your memory of these events, what is it based off of?
Just based on my feelings, how it make me feel now. I mean, it was a big event in my life. I can't just forget.
All right. So you all go to that Airbnb, what happens?
Like I said, we was just kicking it, having a good time. I laid down probably about 11.
What was it that woke you up?
When Brandy and DT got back, she had left to go pick him up from somewhere. I don't know where they went, where he was rather. But they came in and they was ready to go out. I was ready to lay down. But they were persistent, teenagers, they act like teenagers, but they were younger. And they wanted to go out telling me how Thursday night is a vibe in Atlanta and we can still go out. I was like, it's late. We already been doing whatever we gonna do. But they were persistent. They got Scooby up out of his bed and they were pulling in my foot off the couch. I caved. I went on ahead and, okay, if we gonna do it, I'm gonna get on up.
Did you want to go out there?
No, like I said, I was ready to lay down. I was already laying down. But 11 o'clock to them is like 7 o'clock to me.
What happens next?
We go to the bar. It was I don't know what the name of it is, but it was down the street from, you could see the Mercedes-Benz Stadium. So we were still downtown.
All right, and are you familiar with Atlanta?
Not really.
So what you do remember is seeing that Mercedes-Benz on the way to the bar, is that correct?
Right.
All right, and so you all get to that bar, and what happens while you're there?
Just some more drinking, more smoking, listening to music, and just kicking and having a good time.
What is it that interrupts what you all are doing?
I look out the window and I see a cop putting tickets on cars where we park. I know it's where I parked the truck, so I gathered the guys and said we need to roll because we out of town. Don't need the car getting towed,
Whose truck? Did you drive to that restaurant?
I don't remember driving there, but I definitely drove away.
So you see somebody putting, and whose car was it?
It was Scooby's truck.
So while you're there, you see somebody putting tickets on the car. What do you do next?
I get the guys together, tell them that we need to go ahead and head out.
All right, and what do you leave?
Yeah, I left to go, and me and Spud left to go get the truck. I pulled the truck around. Just pulled up to the curb. DT and Devo, they left out right behind us. They went to go get KP's car.
Who do you know who had Mr. Poole's keys at that time?
No.
All right. Did you see what happened next?
I mean, DT and Devo pulled up. DT was driving. He pulled up. I pulled up. And a couple of the guys came out that was straggling behind on the sidewalk. I think KP had some wings. He was waiting on some food. He was the last. That's what they was straggling, waiting on his order. So,
You remember who was waiting out there with Mr. Poole?
Scooby and Brandy, a couple young ladies they were just talking to, just small talk.
And then what happens next?
We all loaded up, and when we pulling off, we stop at the light. It's a light right there at the end of the block, rather. And I rolled the window down because I heard the toot toot. DT tooted the horn. I looked over. He was like, "What?" I asked.
Stop for 1 second.
Object to the issue that you previously discussed.
Okay. We've discussed a lot of issues.
Hearsay, Judge.
Okay, just a hearsay objection. So, don't talk about what other people said unless Mr. Miller says, what did that person say? And then the state will have a chance to object if they want to, and we'll go from there. Okay?
Okay.
Thank you.
All right. So you heard a toot toot from DT honking the horn, and then what?
Scooby let the passenger window down, and we asked where were they going, and they said,
Don't get into what they said. Next question.
Where was Mr. Minor located when you rolled that window down?
he was driving.
How do you know Mr. Minor was driving at that time?
I was talking to him. I looked at him.
Okay. Was that the last time you saw Mr. Minor?
That night, yes.
All right. What do you know approximately what time it was that y'all left that lounge restaurant?
About 3 a.m.
And what did y'all do next?
Well, Spud had linked up with a couple of young ladies that lived in the condo where we rented the Airbnb, and we went to pick them up from their job, which was still in the downtown area, and we came back to the same building.
What is the next thing that you remember?
Scooby phone rang, and him telling everybody to be quiet, and then he rushed to the sink and vomited. I was like, "What's up? What's wrong?" And he kind of hysterical, like it was a bad car accident.
What y'all do in response?
It was kind of chaotic, trying to figure out, they said two out of 3 of our guys was gone, and we didn't know who. And I kind of still blame myself because they listened to me. If I would have just said, "Nah, we not going nowhere,"
What y'all do once y'all here, once y'all find out that information.
We was outside just trying to hold each other up and trying to call home and trying to figure out what's what. We ended up going to the hospital about 6.
Were you able to see anybody when you all went?
No, they wouldn't let us in.
What y'all do?
Just stood around outside. KP had some family down here. They showed up. His auntie was consoling us. Just trying to tell us to get some rest. You know, nobody had been to sleep.
So did she eventually have y'all to leave the hospital?
Yes,
Where'd y'all go?
back to the room. Tried to get some rest. We laid down for a few hours, but we had to check out, so we had to leave.
Where did y'all go at that time?
Back to Memphis.
Bro,
I drove.
probably.
Scooby and Brandy.
You ever come back to Atlanta to see Mr. Poole in the hospital?
No,
Um, when was the next time that you saw Mr. Minor?
at the funeral home.
What were you, what were you there for?
We was just getting ready for the funeral. Like Scooby was cutting his hair. I told him I was cutting his hair, so they let me back. Randy did the same thing, but they did let us go back there.
And while you were back there, did anybody take a picture?
Yeah, Scooby took a picture.
Stop for 1 second.
Object to the relevance as it relates to this line of question. As it relates to what happened at the funeral.
Okay. Overrule.
I'm showing you what's been marked as Defense Exhibit 20. I know, I already know, but could you please identify Defense Exhibit 20? Do you recognize Defense Exhibit 20?
That's DT.
How do you recognize it?
That's my guy.
Was that the condition that he was in when you all went to the funeral home that day?
Yes.
Is this the picture that Mr. Patrick took while you all were there?
Yes.
At this time, defense would move to enter Defense Exhibit 20 in the essence.
I would object to the relevance as it relates to.
Sustained.
Do I get to argue the relevance, Your Honor?
Nope, I'm good, thank you. Do you have any other questions for the witness?
I need to get this in.
Well, it's not getting in on relevance grounds. Maybe you'll get it in a different way. Do you have other questions for the witness?
Yes.
Okay.
One moment. No further questions.
Mr. Brad, do you have questions for Mr. Williams?
Very briefly. Mr. Williams, I'm sorry for your loss. I know this has been incredibly emotional for you, so I'm going to be very brief with my question. Mr. Williams, you came to Atlanta and checked into that Airbnb with Scooby and Spud, is that correct?
Yes, sir.
And when you got to the Airbnb, you, Scooby, and Spud were drinking and smoking, is that correct?
Not at that moment. Not when we first got there. No.
That's correct. You went to DT's barber shop to check out the shop, is that correct?
Yes.
Not that. Is that when you started drinking and smoking?
Yeah, when we got back.
Do you remember how long you were doing that for? Was that up until 11 p.m. when you went to sleep?
I'd say from about 8 to 10.
10. Okay. And so, after that, you indicated you went to sleep and then Brandy and DT wanted to go out, so you all went out down the street to the bar, is that correct?
Yes.
So it was the bar was pretty close to the Airbnb where you all were staying.
I don't remember it being too far away. We got there probably about 5 or 10 minutes.
And then ultimately you and everyone at the Airbnb ended up at the lounge, is that correct?
Yeah.
And I know earlier you said you don't remember how you got there, whether it was you driving or someone else driving, right?
Well, I remember driving away.
You remember driving away, you just
Yeah.
don't remember necessarily how you got there, whether it was you driving there or someone else driving.
Well, I remember now it was Scooby driving. Scooby drove to the bar.
Okay, so now, previously you said that you didn't remember, but now, you were able to recall that Scooby was.
Right.
So at the bar, you, were drinking as well, is that correct?
Well, everybody was in the bar, but I didn't have too much more to drink. Like I said, I was already tired. So I was just out, just observing and making sure everything was good.
So you're just looking at everyone to make sure they were all good, right?
Right.
And after at some point in time, you see someone ticketing or towing a car, and that catches your attention.
Right.
And so you went back and you told everyone, hey, essentially, we need to get out of here
Before the car gets towed, that's what I was telling everybody.
totally understand. And at some point in time, that was the reason why you told everyone we needed to go, was because the cars could potentially be towed, right?
Yes.
You had not made plans to tell everyone to leave, at that point in time until you saw what you observed in terms of the cars being towed, is that correct?
Yes.
Okay. So, eventually, you all end up, in Scooby's car and you're driving the car, right?
Yes.
Is that with Scooby and Spud as well?
Yes.
And eventually you, pull up to a stop and you see, KP's car, with, DT in the driver's seat and, Devo in the front passenger seat, right?
Correct.
And according to what you observed and what you testified to, you said that you saw KP, in the back seat.
Yes, he got in the back.
And after they drove off, you don't really remember, or not that you don't remember, you didn't see them, after that point in time.
No.
And, eventually, let me ask you this. You don't know what transpired between KP, Devo, and DT after you saw them drive off, right?
Nothing. No, I wasn't in that car.
You weren't in that car. So there's nothing that you can say in terms of what happened, after you saw them drive off.
Just that DT said they had one.
Don't get into what DT said. Please.
Just in terms of,
Thank you.
just in terms of what you physically observed, after that point in time, when they drove off, you didn't see them, until you got that call later in the day, or you heard about the call later in the day. Is that correct?
Yes.
And were you present? I know you had indicated that you were you worked at the barber shop. Were you present at the barber shop when, KP was arrested?
Yes.
And at that point in time, did you tell, anyone at the Georgia State Patrol or any law enforcement, officer about the things that transpired that you testified to, today?
No.
Thanks, Secretary.
Mr. Miller, any redirect?
Without going into what Mr. Minor said, the last memory that you have of Mr. Minor is at that light. Is that correct?
Yes.
And when you saw Mr. Minor, who was in the passenger seat of that car?
Devo.
And approximately what time did y'all leave from that restaurant bar area?
About 3 a.m.
Thank you.
Jurors, any questions for Mr. Williams? Thank you. Thank you. All right, Mr. Williams, I'm gonna be right back. I gotta talk with the lawyers just for a sec and then on question. Okay, thank you.
Sort of order, ring of meeting.
All right, Mr. Williams, you've described how different people were driving. I think it was, it was Mr. Patrick's truck that you were in that night. But at one point he was driving it, at one point, maybe Mr. Underwood was driving it, maybe you were driving it. Was that pretty typical or was that kind of special for that night?
That was pretty typical. We would use one another's vehicle to go get something to eat or anything. It wasn't a big deal at all.
Okay, same kind of topic. Had you seen Detarius Minor driving Mr. Poole's car before?
Yes.
On a scale of 1 to 10, if 1 is no drinks at all or whatever's getting you in a good mood, and 10 is it's hard to stay upright, how would you describe Mr. Poole that night, the last time you saw him?
A 3.
Okay, how about Mr. Jones, Devin Jones?
The same.
And Detarius Minor?
The same.
All about 3?
Yeah.
Okay. tell the jurors where you saw Mr. Poole get into his car when he got into it outside that club.
In the back seat,
Passenger side, driver's side.
driver's side.
At one point during your testimony, you said if they had just listened to you, what was it that you were thinking you were going to tell them, but you didn't?
If I had have just told him, no, it's late. We've turned up enough. It's time to go to sleep. I think they would have stayed if I would have stayed, but I caved.
You're talking about back at the the Airbnb.
Yes.
Okay, when you said they tugged on your toe and you finally caved. If you had said, "I'm not leaving," then people would have stayed there.
Yes.
Okay. Did the relationship that you or people at the barbershop in Memphis had with Mr. Jones's mother, Miss Martin, did it change after Mr. Jones's death? Do you know who I'm talking about?
Yes.
Okay. Did it change?
It wasn't really a relationship. I mean, we had only seen her at the shop like once or twice.
Okay. When Mr. Poole got arrested, did you know for what he was being arrested?
No.
Mr. Miller, do you have other questions for Mr. Williams based on this?
No, Your Honor.
Mr. Rao?
No, Your Honor.
All right, Mr. Williams, I appreciate your time. So ladies and gentlemen, we're going to stop for the week. You were very gracious in giving us time past 5 on a Friday. It's my understanding that the defense has 1 or 2 witnesses left. They're not required to limit it to that, but just in talking with Mr. Miller and Ms. Bird, they think they have 1 or 2 witnesses left. We're going to and I share that only as a forecast, not to bind anyone to anything. We're going to reconvene on Wednesday. As I told you, if you can hearken all the way back to Monday of this week, Monday and Tuesday of next week, there won't be this trial. We're going to start at noon on Wednesday. You should show up with lunch already in your tummy if you are a lunch eater. We won't have a lunch break. We will take other breaks, and it would be great if on Wednesday we could go to 6 again, but that's not a dictate.
I can confidence you say some comments.
Okay, then we won't go till 6 because the commitment was 9 to 5.
Yeah.
Okay.
And do that, but I can.
Okay. Noon is when I need everyone here, and we'll pick up with the defense case at that time. We're going to be apart for a while, so you need to remember the 2 important operating rules, which is no outside research and don't talk about the case because that can lead to unintentional outside research. Monday and Tuesday, you can go to work if you want to go to work. You can leave town as long as you come back Wednesday by noon. The letter that you get at the end of the trial probably will say you've been with us since Monday, December 1st. So no one's policing you on Monday and Tuesday of next week, but the letter will probably cover all that time. Do with that as your moral compass tells you. You should call if something comes up and Wednesday at noon is going to be complicated. Otherwise, I wish you a healthy 4.5 days. And on behalf of the lawyers and Mr. Poole, thank you for your focus and attention thus far. Leave your notepads in the jury room, and we'll see you as close to noon as you can make it on Wednesday.
All rise for the jurors.
Thank you. All right, everyone take a seat, please. We're not quite done. I want to get one thing on the record, and then Mr. Miller, I want to give you an opportunity, now the jury is out of the room, to put on the record your argument for relevance of defense 20. There was a motion for mistrial earlier this week concerning Dr. Henninger's testimony about how Mr. Jones and Mr. Minor, the GBI tested their blood and the presence of cannabinoids was detected. Mr. Miller moved for a mistrial. I denied that motion, offered a curative instruction. He said no thanks to that. And the state has, at my direction, stayed away from exploring that explicitly since then. I need to make, for purpose of the record, should there be an appeal here, a couple of observations. One of the videos that was included in either Defense 19 or Defense 21 has a video of Mr. Minor smoking what sure looks like a blunt, not that I would know what one is. And the jury has now seen that 3 or 4 times. Several witnesses have testified about how Mr. Minor and Mr. Jones were both intoxicated or lit. There's been discussion of alcohol consumption and smoking, et cetera. And so I just need to get that clear in the record. The record won't necessarily show, unless someone watches the video, what it was that Detarius Minor was doing in the video. So that should there be an appeal and someone is assessing, was there any prejudicial impact to the admission of Dr. Henninger's statement, all of that is placed in the crucible and weighed. With that, Mr. Miller, tell me why you think, so we're clear, because I got to see it a little bit. So the picture of Detarius Minor deceased after his hair has been cut by his friends and barber family.
Right. Defendants 20 contained a picture of Mr. Minor while he was at the funeral home as his friends were getting his hair cut. And on his forehead is an indentation of what is arguably a steering wheel, which is evidentiary value that the defense could have used in closing to put Mr. Minor behind the wheel of the vehicle. Defense would like to note that the state has produced this pictures of Mr. Minor, pictures of Mr. Jones with blood coming out of their nose, blood coming out of their mouth, out of their ears. And the one picture that the defense attempted to produce, which does show arguably a steering wheel across the forehead of Mr. Minor, they were unable to put into evidence.
Do you have, can I see Defense 20, please? And you're saying something on the forehead is a witness going to say it's consistent, or you want to be able to argue that?
I want to be able to argue that.
Okay. Mr. Rao, I think this was it was Mr. Rao's witness. If you want to consult with Mr. Abate.
I don't mind if Mr. Abate.
Okay, if you don't mind, Mr. Abate, I heard most of that, but let's say it loud enough that Ms. Rivers is able to take it down.
Same objection was made in the first trial, as it relates to this picture. Same ruling by the court was made during the first trial as it relates to this picture, because the picture is a picture of Mr. Minor after his autopsy was performed. And as we're all very much aware, during an autopsy, skulls are taken off and cracked open and things of that nature. So that picture doesn't show anything about consistency as it relates to it hitting a steering wheel. Mr. Miller had every opportunity to ask Dr. Henninger as it relates to any injuries to the front of his head and things of that nature that were consistent with a steering wheel hitting him in the head or the area of the indentation in what you're talking about. So that's the state's position. It's the state's position then, it's the state's position now.
Okay,
In actuality, Your Honor, what happened at the last trial was the defense presented that picture, and the objection that the state made was that they did not receive that picture in discovery. And the defense let them know or showed them the discovery where they had actually received it back in 2022, before Mr. Rabate was assigned the case. And at that time, we were allowed to enter the picture. The issue was the witness we were trying to enter the picture through refused to look at the picture for emotional reasons. And so the foundation could not be laid for the picture to come in, but it was allowed to be in at that time.
it would.
It would have been allowed had the foundation
Been
been
laid.
laid through that witness.
Got it. Okay.
Which is
Well,
purposefully why we chose a different witness to enter that evidence in at that time. At this trial.
understood. Okay. I appreciate both of you bringing me up to speed. Why not explore this with Dr. Henninger?
You never ask a question you don't know the answer, that you don't know what the response is going to be. And I did not trust Dr. Henninger in this trial. We spoke to him
Wow, those are strong words, but let's just
to
stop.
do what I needed him to do.
Okay.
Let me put it that way. Let me qualify. I did not trust him to do what I needed him to do with this trial.
Okay. Other question for you. There are a whole bunch of pictures of Mr. Minor from the autopsy. There's the subset that were admitted, but there's a much, much larger universe, hopefully, to which you were given access. There's not a picture of his head that would eliminate what I think is a pretty valid concern, which is this is after a medical doctor would have opened the skull and removed the brain and done a whole lot to change the way the skull was shaped because of the necessary medical investigation.
That's speculation. They don't know if a doctor.
Just answer my question, then you can argue. I'm open to arguing. Is there not a picture across all the many photos that the medical examiner's team took that shows Mr. Minor's forehead?
There's not one as clear as this one. The pictures that are there, they have blood coming out of his nose. It's not.
You're not focused on his nose, you're focused on his forehead.
I'm focused on his forehead, but those pictures, I wouldn't want those pictures in my clothing. I would rather have a cleaned up picture that displays the same thing that is shown in the ME pictures prior to the autopsy.
Okay. So I'm gonna hold on to 20 and I can always change my ruling. You've laid a foundation for it. And so it was just a question of relevance or not. And I'd like to get, and this can be emailed if that's easiest, from the state, Mr. Minor's autopsy photos that would be sort of the equivalent of this. I don't need pictures of his legs or his arms, but pictures sort of shoulders up so that I can better assess the concern, Mr. Abate, that you've raised, that this is sort of post-mortem. It's after the various invasive steps that the medical examiner necessarily takes. And then we'll see how similar they look.
Yes, John, and for the record, that was the argument that I also made in addition to the discovery issue.
Well, I will also look at the transcript. Those aren't mutually exclusive presentations. You may have argued that as well, but ultimately it may have been excluded because Mr. Miller couldn't lay the foundation because the witness wouldn't look at it. Then we don't even reach the issue of whether it's relevant or not. But I am open to looking at all of that. We will revisit defendants 20 when we reconvene Wednesday at noon. Please look at the charge over the 4.5 day time away from here that you have so that we can have a focused charge conference. In fact, I would ask, and I'll send an email to this effect because you can just respond to the email. I would like to hear from both sides, and I'll set a deadline of some point on Monday or Tuesday, concerns that you have with the charge that I sent out. We'll get it all on the record, but that way I'll know this is a 2-minute charge conference. It's a 4-hour charge conference. So I can figure out how best to schedule it so that we're not delaying the jury's consideration of the case. All right. Anything else from the state?
The charging document you sent us, is the final document you read to the jury last time, correct?
Yes, sir.
I can't imagine the state won't be any objection, but I would be quick for the state.
Okay. I'm not requiring it to be quick if there are concerns, and I don't recall the charge conference. It may have been that too was contentious and that we need to relitigate things, and I'm all right with that. I just want to know a little in advance. So nothing else from the state. Mr. Miller, anything else from the defense?
No, Your Honor, I just want to make sure I was right. You said noon on Wednesday. correct?
Noon on Wednesday, high noon, 12 is when ideally we will be having you call your next witness.
Okay.
It will not be before then. It might be 12:30. It depends. I'll be doing accountability court that morning and trying to get through it in record time. All right. Thank you, Ms. Rivers. Take 4 days off.
You know, I'm